executive session.
Yes, Ms. Hunter?
Your Honor, Dr. Lee has to be on an airplane tomorrow morning, and so it's the state's request, and I think the defense agrees. If there's any way that we could put the dinner reservation for the jury a little bit later, so we can be sure that everybody has had an opportunity to direct and cross-examine him, maybe even a shorter lunch period.
Whatever y'all need, every day I reset the dinner reservation 3 times. So, whatever is fine.
Thank you, Judge, we really appreciate it.
Yeah. Just however, if y'all want a shorter lunch, just tell the jury, I'll explain it to the jury.
Thank you.
We also, one of the jurors has a birthday today.
Oh.
So I'll sign the birthday card.
Did we get to sign the birthday card?
I think
State
we
wants
need
to write our name bigger.
Yeah.
Right.
Yeah.
No, we definitely, I'm always in favor of speeding things up.
Thank you, Judge.
That's why I keep asking everybody. We need Dr. Ross back as well. I also have the jury's copy of the autopsy. If y'all need me to give that back out, I will.
It would probably be helpful
Okay.
if we want to go ahead and put them on their seats. We could be ready to jump in.
Doctor, you're welcome to have a seat. Thank you for coming back this morning. Excuse me, I'm just waiting. Y'all tell me you're ready.
I'm ready.
Are we ready for the jury?
Yes, Your Honor.
State's ready.
Bring the jury in, please.
Ready, Judge?
Yes.
Jury.
Good morning. Thank you all for still being with us, and happy birthday to our viewer that has a birthday. We'll try to get some cake. We'll try to get some cake for you today. Dr. Ross was allowed to go home last night. We didn't keep him. But he hasn't talked to any of the lawyers, which was fine with him, and we have him back here for cross-examination. Ms. Hughes?
Thank you, Your Honor. Good morning, Dr. Ross.
Good morning.
I would like to talk to you about your experience as an expert medical examiner, okay?
Okay.
You are the retired chief medical examiner for Shelby County.
Yes.
You've testified at a lot of trials.
Yes.
Usually, you're testifying for the state, right?
Yes.
And that's part of your job as the chief medical examiner for Shelby County, right?
Yes.
Do you get paid extra to testify?
No.
Now, I want to talk to you about the autopsy in this case, okay?
Yes.
You performed this autopsy on Mr. Freeman.
Yes, I did.
And before you started the autopsy, just by looking at Mr. Freeman, did you know the extent of the heart disease that you would find?
No.
Could you tell just by looking at him that that condition was actually life-threatening?
No.
When you conduct autopsies, you have to gather some outside information, right?
Yes.
You typically rely on hearsay information.
Yes.
Sometimes you need that hearsay information for context.
Yes.
You rely on information from the police.
Yes.
You rely on your medical examiner investigator.
Yes.
You rely on medical records,
Yes.
including clinical history.
Yes.
You rely on things like the video in this case.
Yes.
You rely on those toxicology reports.
Yes.
Those toxicology reports are almost always included in your autopsy reports, right?
Yes.
And you need all of those things to make a complete and thorough assessment for the autopsy.
Yes.
Now, I want to talk to you about your conclusions in this case, okay? Do you have a copy of your autopsy report?
I do.
The pathological diagnosis. What is a pathological diagnosis?
It is a statement of a disease condition of the body, and disease conditions include traumatic injuries.
Okay, and that is on what's, that's basically on the cover page of your autopsy report, right? Not the one with the narrative, but the main front page.
Yes.
Now, in that pathological diagnosis, you noted that there were multiple contusions to the body.
Yes.
You indicated on direct that many of those were healing.
There were some healing abrasions.
Oh, I'm sorry. The contusions
Some,
that
but
you
the
talked about-
contusions all looked fairly fresh.
Okay, so there were some acute things as well.
Yes.
Would the contusions have healed on their own without medical intervention?
Most of the injuries that I saw in him, the blunt trauma injuries, appeared that they probably, provided that the decedent maintained his health, those injuries should have healed, with the exception of the laceration on his scalp. That may have required some type of medical intervention.
Some stitches?
Yes.
Now that scalp laceration is the second thing that we're coming to. There was no underlying fracture, correct?
No, there wasn't.
So there would not have been a need for any surgical intervention, just some stitches?
Well, stitches technically a surgical intervention.
But stitches would have been the extent.
Probably.
That laceration was not a fatal wound.
No.
The laceration, with stitches or without, would have healed on its own.
Yes.
Now, the third thing that you have listed is the arteriosclerotic cardiovascular disease.
Yes,
And the subcategories that you have under that are first, coronary arteriosclerosis.
yes.
What is that?
That is the atherosclerotic disease affecting the coronary arteries, which gives blood supply to the heart.
Was the coronary arteriosclerosis caused by the altercation in this case?
No,
Was it caused by the subdual in this case?
no,
Was that a life-threatening condition?
yes,
Then we move to the aortic arteriosclerosis. And what is that?
that is the atherosclerotic disease process affecting the aorta, which is the main blood vessel coming out of the heart.
Was that caused by the altercation?
No,
Was that caused by the subdual?
no.
Was that on its own a life-threatening condition?
It was fairly mild disease, so at that stage, no.
Okay. The cerebrovascular arteriosclerosis, what is that?
That's the atherosclerotic disease process affecting the blood vessels in the brain.
And that was not caused by the altercation?
No,
That was not caused by the subdual?
no,
Now, all of these all of this vascular disease taken as a whole is life-threatening, right?
potentially, particularly the coronary artery disease.
Fourth, you have the left ventricular hypertrophy of the heart.
Yes.
And please correct me if I say anything incorrectly. And what is that?
That is an enlargement of the heart muscle, the left ventricle muscle of the heart, which is the main pumping chamber of the heart that pumps blood out from the heart to the rest of the body.
Is it bad for that part of the heart to be enlarged?
Yes, it is.
Was that caused by the altercation?
No,
Was that caused by the subdual?
no, it was not.
Can that be a life-threatening condition?
Yes, it can be.
Now here you found the cause of death to be exacerbation of arteriosclerotic cardiovascular disease due to physical altercation and subdual, right?
Yes,
And you listed a contributing factor as probable psychotic disorder.
yes,
The manner of death you listed as homicide.
correct.
Now, the homicide description is for epidemiological purposes, right?
Correct.
The state of Tennessee keeps statistics on the different categories of deaths in the state of Tennessee.
Yes.
Right? That language that you included in that last sentence is not typically included in your autopsies, right?
I have not routinely included it. I have had it in some autopsy reports in the past. And it's implicit, a statement in any and all autopsies anyway, that the medical examiner's classification of a manner of death is not intended to be an indication for you or used for judicial purposes per se.
Right, and even though that's an explicit statement, you don't normally then include it in your autopsy reports.
I have not in the past, no.
But you did here.
Yes,
The epidemiological statistics kept by the state of Tennessee are not to indicate crime statistics, right?
correct.
On direct, you indicated that you had been asked by a prosecutor to include that language.
Yes.
Do you remember when that happened?
It would have been sometime before I signed the final report.
Okay. Do you remember which prosecutor, I know there's multiple prosecutors' offices. Do you know specifically which prosecutor asked you to add it?
No, I don't.
When you say homicide, you are not commenting on any sort of criminal intent.
No,
You are not commenting on anything being a criminal act.
no,
You are not making a legal finding.
correct.
And that's for all medical examiners, right? Homicide is a medical term.
Yes,
It is not a legal term.
correct.
For medical examiners, when you perform an autopsy, if someone died as the result of self-defense, that is classified as a homicide.
Yes,
If two people were out in the woods hunting and one hunter accidentally shot the other hunter, that's classified as a homicide.
Yes,
Because you're not making that legal determination.
correct.
Now, I want to see if I understand you correctly on why this was labeled as a homicide, okay? So I want to kind of walk you through things and tell me if I'm following correctly, okay?
Okay?
Mr. Freeman had a life-threatening heart condition.
Yes, potentially life-threatening.
Physical activity posed a life-threatening danger to him because of that heart condition.
Yes,
When Mr. Freeman was in his cell, he engaged in potentially life-threatening physical activity.
potentially.
When he rushed out of his cell, he engaged in physical activity fighting with officers.
Yes,
When Mr. Freeman was subdued, he engaged in physical activity trying to struggle against that.
yes,
Because he was fighting with people, it was labeled as a homicide,
yes,
even though it was the physical activity itself that killed him.
because it was a physical activity that was the result of his altercation with other individuals.
Right, but the physical activity is what created the demand on his heart that his heart couldn't.
The physical activity, plus he did sustain numerous contusions and the scalp laceration. And those would have caused a release of various humoral factors into the blood that would also have caused an increase in his heart rate and would have further exacerbated disease. So not just the physical activity, but the actual trauma that he sustained as a result of that activity also was a factor.
And those are separate, there's a lot of stressors that were present here, right?
Yes,
And we're gonna go over those a little bit later, but I'm glad that you brought that up. So I wanna talk to you now about Mr. Freeman's heart conditions, okay? He had arteriosclerotic cardiovascular disease, right?
yes,
Moderate to severe coronary artery disease,
yes,
aortic arteriosclerosis,
yes,
cerebrovascular arteriosclerosis,
yes,
left ventricle hypertrophy,
yes,
and possible hypertension.
yes.
Now, with that moderate to severe coronary arteriosclerosis, and I believe you note this on page 7 of your autopsy, what does that do within the body when it's severe?
It has the potential to significantly reduce blood flow to the heart to the extent that the heart muscle does not receive enough oxygen to maintain itself. And as a result of that, some of the heart muscle can die off. That's essentially what most heart attacks are. It can also cause disruptions of the heart rhythm by affecting the electrical conduction system of the heart. If it's not getting enough oxygen, you get abnormal rhythms, and those in and of themselves can also potentially result in death.
Now here, all 3 of his coronary arteries, the main arteries, had disease.
Yes.
And when you talk about this percentage of blockage, what does that look like if you were looking at it?
Well,
Can you give me a visual?
if you were to cut, imagine the coronary artery, like most blood vessels, is a tube. If you cut across that tube so that you end up looking in it and you're looking at a circle, a 50% stenosis would be where half of that circle was obstructed by atherosclerosis. If you're, say, 75 to 80%, that means 75 to 80% of the area in that circle is obstructed, so that only about 20 to 25% of the available area is there for the blood to go through. So it's reduced by a very significant amount.
Your Honor, may I approach the witness with the demonstrative aid? Dr. Ross, does that example kind of explain what you were talking about if you make a cross-section cut?
To some extent, it does. What this shows, though, is what it would look like if you had concentric. A lot of these atherosclerotic lesions are eccentric. They tend to be more on one side versus completely surrounding it, but it varies from individual to individual.
Would it be consistent though with the amount of blood that was still able to pass through the vessel?
Yes,
Okay. Is it vessel or vein? Artery, artery. So the left anterior descending, you found to have a 50 to 60% blockage.
yes,
Is that accurate, is that reflected demonstratively for the jury in that, up to 60%?
yes it is.
If I may approach the pen. Dr. Ross, if you could write left anterior descending on that for me. And that 50 to 60% finding. If, I've got two more for you. The left circumflex you found to be, oh, I just handed you the left circumflex instead of the left anterior. May I approach?
Yeah.
Let's see, where are we here? 40%, so this would actually be the left circumflex with the 40 to 50%. This would be the left anterior. And would that accurately represent, or demonstratively represent the right coronary artery? That's 75 to 80%.
Yeah, yes.
If you could just label each of those for me, please. And Your Honor, I'd ask that that be made a demonstrative exhibit.
About that, what do you mean?
Those three documents.
Okay.
Um,
A collective exhibit.
Yes, please.
We'll let him finish with this, and we can have it.
Thank you, Your Honor. And that would be exhibit number 16.
Sure, you have those yourself. All right, this will be exhibit 16, collective three-page exhibit. All right.
Dr. Ross, if you could please, each in turn, show the jury the demonstrative aid and kind of explain what the blockage means and the percentage of the blockage present.
This shows the right coronary artery and extends the degree of atherosclerosis. This one is showing up to an 80% stenosis of the blood vessel. So the area that's marked in red is the area where the atherosclerotic lesion would be if it were a concentric. In his case, as I recall, it may have been more eccentric, but I don't remember for sure. The area that's white.
Would you explain what eccentric means, please?
Eccentric means it's sort of more off to the side. So sometimes these atherosclerotic lesions develop and may form a lesion that looks like this. So it leaves more of a slit-like opening as opposed to a circular opening if it's concentric around. And a lot of atherosclerotic lesions tend to be eccentric, leaving a little bit more of a slit-like opening. But the overall effect is the same. So if this were a concentric lesion, this is what you would see. The white area in the center would be the area that's available for the blood to go through at that point. And so at 2 points in the right coronary artery, it was severely narrowed so that only a small amount of blood flow potentially would have been able to get through that particular part of the blood vessel.
Your Honor, could Dr. Ross actually step down and make sure all the jurors
If
can
you
see
don't
it?
mind, if you show and speak into the microphone on either end, if you don't mind.
This again is the coronary artery. The white area in the center corresponds to the area where blood would be able to flow through that blood vessel. And that's for the right coronary artery. For the left anterior descending coronary artery, not as severe as in the right, but again, the white area is a representative area that shows how much the normal outer part of the blood vessel, where normally blood would go through all of this, it's only able to go through the white portion because of the disease in that blood vessel. And then lastly, in the left anterior descending coronary artery, he had a 40% stenosis, which is what this shows. So there is the white area is how much blood would be able to get through that blood vessel, not as severe as the other two, but still present and still reducing the blood flow by some amount.
Thank you, Dr. Ross. Particularly the coronary artery, the right coronary artery, it's really bad level of
It was
disease.
severe disease, yes.
And it was significant enough to reduce the blood flow to the heart.
To the portion of the heart that was supplied by the right coronary artery, correct.
And as your heart rate increases, your heart's demand for oxygen increases.
Correct.
And when a blockage is significant, severe, the heart can't keep up with that demand for oxygen, right?
Correct.
When a blockage is 75 to 80%, it does not take much to hit that point, does it?
No, probably not.
When the blood supply is insufficient, the heart begins to suffer from that lack of oxygen.
Yes.
And that can begin the early processes of cellular death due to lack of oxygen.
It can be cellular death. It can also be just a disruption of the normal electrical conduction system within the heart that can result in a dysrhythmia.
Okay? But that can begin the process of cellular death.
Once you have a point where there is insufficient oxygen getting to a particular cell for a certain period of time, that cell will begin to die, yes.
And that can result in a myocardial infarct or a heart attack.
Yes,
And both of those things can be fatal.
yes,
Now, on direct, you had indicated that Mr. Freeman definitely may have required medical intervention for this severe heart disease,
potentially, yes,
whether that be a stent or a bypass.
but possibly. That's, again, a cardiologist would have to make that determination.
And while deferring to a cardiologist, you had indicated that he probably should have been under the care of a cardiologist.
If he was aware of that heart disease, and then that would have been advisable.
Because that heart disease posed a life-threatening risk to him.
Yes,
With this degree of disease, as you testified to yesterday, physical activity could pose a significant danger to him.
yes, people with that degree of heart disease are at risk from increased physical activity.
And Mr. Freeman's heart potentially would have had a hard time keeping up with the demand of physical activity.
Yes,
Now, here you watch the video, you saw Mr. Freeman expending a lot of physical energy.
yes,
He engaged in a lot of physical activity, right?
yes,
He was causing his heart to work very hard,
yes,
and he simply did not have enough blood to supply it because of his coronary, or because of his severe heart disease.
correct,
And that's why his heart gave out.
yes.
Is it unusual for a condition like this to go undiagnosed before someone passes away?
Actually, it isn't. There are a number of studies that show that sudden cardiac death is oftentimes the first initial manifestation of disease of this extent.
And that globular shape you were talking about, is that due to this arteriosclerotic coronary artery disease?
It's more likely due to other causes. The most common cause would be hypertension or high blood pressure.
Now, I want to talk to you about the microscopic description that you have in your autopsy on page 6.
Yes.
Give the jury a chance to get there with us. You noted hypertrophic myocytes,
Yes.
and those are indications of hypertension,
Yes.
and particularly untreated hypertension.
Yes.
What is hypertension?
Hypertension is high blood pressure.
Can hypertension be life-threatening?
If it's long-lasting and causes certain changes to the heart or kidneys, it can be. It can even lead to strokes. So, yes.
And in Mr. Freeman's medical records that you reviewed, did you note that his blood pressure was particularly high?
I don't recall what I noted about his blood pressure. I did not note that diagnosis of hypertension had been made on him at any point in the record that I could see.
Your Honor, if I may approach the witness.
Yes, ma'am.
Dr. Ross, I'm going to pass you some documents. Do you recognize these?
These appear to be some of the documents of medical care from the jail. And this in particular, I think, refers to when they were treating him for potential opiate withdrawal.
On that first page, I'm sorry, on the second page of the package, do you see where they took his blood pressure?
Yes.
What is the blood pressure that's indicated?
There are two blood pressure readings that I can see. One appears to be 151 over some number that to me is illegible. The second one is 151 over 93.
And are those records that you relied on in your autopsy?
I did review these records when making my assessment of the case, yes.
Is 151 over 93 considered high blood pressure?
That's a hypertensive reading, yes.
Okay, if I may approach them. Doctor, you also noted small foci, perivascular, and interstitial fibrosis.
Yes.
Much more fibrosis than should have been in a healthy heart.
More, there is, yes, that's more fibrosis. Normally, a healthy heart, you wouldn't expect to see any.
And that goes along with previous episodes of ischemia in the heart?
It can be. You can also see it sometimes in cases of hypertrophy and untreated hypertension as well.
Okay. Would it have surprised you if he had had previous episodes of decreased blood flow based on those findings?
No.
If, when those fibrosis, when those are created, is that indicative of nearing a heart attack?
Sorry, indicative of what?
Of nearing a cardiac event?
Well, again, it's indicative of reduced blood flow to certain areas of the heart that the tissue responds by creating additional scar tissue in that area. So there may have been some low-level ischemic injury to some areas of the heart that would result in that fibrosis.
And that would have been before October the 5th of 2022.
Yes.
Now, I want to talk to you about your findings in the hippocampus.
Yes.
Changes in the hippocampus can oftentimes be one of the first signs of oxygen loss to the brain.
Yes.
That did not appear here.
No.
You also found early ischemic changes in the cerebellum,
Yes.
and that can be consistent with cardiac arrest.
Yes.
That is created by a lack of sufficient blood flow to the brain from the heart.
Yes.
Usually, if a person is asphyxiated, they have to survive somewhere between 4 and 24 hours for cellular injury to occur significant enough to be detected in an autopsy, right?
Most of the time, but not always.
And there was not any period of 4 to 24 hours that would have created any cellular injury if asphyxia had been present, right?
Not that I could see at autopsy, no.
Okay, so that early ischemic change was not related to asphyxia.
Probably not, but I couldn't entirely rule it out.
Now, I want to talk to you about things that affect a heart that has this degree of severe heart disease, okay?
Okay?
Exercise and physical exertion,
Yes.
and that was present here.
Yes.
And when I say affect, I mean negatively affect, right?
Right.
Adrenaline.
Yes.
A physical altercation increases adrenaline in the body,
Yes.
and that was present here.
Yes.
And even before that door opened, even before an altercation started, Mr. Freeman appeared very hyped up, right?
Yes.
So possibly already producing that adrenaline.
It's possible, yes.
Aggression can increase heart rate,
Yes.
and that was present here.
Yes.
Psychosis can increase heart rate.
In some cases, psychotic manifestations can result in an increase in heart rate, yes.
And that was possibly present here.
Yes.
Pain,
Yes.
and that was possibly present here.
Yes.
Pepper spray,
Yes.
hypertrophy of the heart,
Yes.
and that can cause hypertension.
Yes. Well, that's caused by hypertension.
Oh, I'm sorry. And both of those, hypertension probably present here, hypertrophy present here.
Yes.
High blood pressure,
Well, hypertension, yes.
and that was present here.
Could have been. Well, there was some documented readings. It doesn't mean that he has established hypertensive cardiovascular disease. It would require several readings at multiple different times to determine if he had a consistently elevated blood pressure. It can be elevated intermittently for a number of reasons. So a couple of readings doesn't establish a diagnosis of hypertension, but he did have high blood pressure readings at that time, yes.
And there are other things in the autopsy to support that.
The hypertrophy of the heart is indicative of that, yes.
Drug use,
Yes.
and that was present here.
He did have some drugs in his system, although in my opinion, the levels there weren't sufficient to have had any significant effect on his heart.
But chronic drug use can affect the heart.
Potentially it can, yes.
Chronic alcohol use,
Yes.
and that was present here.
I don't recall a history of alcoholism per se. It may have been in the record, I don't remember.
Your Honor, if I may approach? I'm handing you a portion of his Regional 1 medical records. May I direct the witnesses to where I'm,
Yes, ma'am.
if you'll look right here.
Yes, it does say history of alcohol.
And did he indicate substantial alcohol usage?
But in this note,
Yes.
they say 3 bottles of Jack Daniels daily.
Would you consider that substantial alcohol usage?
Based on this, yes.
May I approach? And chronic alcohol use can have a detrimental effect on a heart, especially one that already has heart disease.
Yes, it can.
Okay, now I want to talk to you about the injuries that were present in the autopsy, okay?
Yes.
Which injuries occurred on the 4th floor?
I cannot specifically determine which injuries occurred on the 4th floor and which occurred on the 5th floor. I can't sort that out.
And some of the injuries that you noted were older.
There were some abrasions older, but most of the contusions and the areas of hemorrhage all appeared to be acute and consistent with the injuries he sustained during that terminal event.
But he did have, and particularly the stab wound,
He had older injuries, yes.
And when you say acute, you mean within 24 hours.
Yes,
So it is reasonable to assume that some sort of situation caused other injuries to him more than 24 hours before this.
yes,
And you know, based on the clinical review, the stab wound had occurred before.
yes.
this.
Mhm.
Did you review any police reports regarding the stab wound?
No, I did not.
But that stab wound would be consistent with an altercation on a different date.
Yes,
And some of those healing wounds may have been consistent with an altercation on a different date.
yes.
Were any of the individual injuries that you found on the autopsy life-threatening?
No specific individual injury appeared to be a particularly lethal injury, in my opinion, no.
Okay. Now, when you talk about blunt force trauma injuries, there are levels to blunt force trauma injuries, right?
Levels?
Yes, like there's a severe blunt force trauma injury, there's levels.
I mean, certainly some individuals can sustain minor blunt force injuries, such as, you bang your shin against a chair. That's technically blunt force injuries. And then, to the extent, yes, if you're in a motor vehicle crash and you sustain severe extensive blunt force injury, then that's a higher level. So, yeah, it can vary. Blunt force injury can vary given upon a certain situation.
Absolutely. And sometimes when you have a severe blunt force injury, you can have something called a patterned bruise.
You can, yes.
What's a patterned bruise?
A patterned bruise or a patterned contusion is a result of a part of the body impacting with an object or an object impacting with the body such that it leaves an actual pattern that you can make out that is somehow indicative or is consistent with the object that caused that contusion. So, for example, if you were struck with a hammer, you might expect to see a perfectly circular, round injury on the body, whereas if you were struck with a 2x4, you might see something that's more rectangular shaped. So that's just an example of what pattern injuries might be.
Shoes, the bottom of shoes, the tread on shoes can actually leave a patterned bruise, right?
Yes, it can.
That was not present here.
No.
Severe blunt force trauma can cause significant swelling, significant immediate swelling.
Yes.
That was not present here.
There was some localized swelling in some areas as a result of that. Yes.
Okay, was there any severe swelling, significant swelling?
Well, there wasn't any life-threatening swelling due of the tissues, but there was swelling of the tissues due to the contusions.
Okay. Any bone fractures?
No.
And that's consistent with severe blunt force trauma.
Yes.
Severe blunt force trauma can also be consistent with damage to internal organs,
Yes.
and that was not present.
No.
Now, when you watch the video, would you agree with me that the majority of blunt force trauma occurs on the 4th floor?
As I recall, yes.
And when we talk about blunt force trauma, that can mean getting hit with a fist.
Yes.
It can mean getting hit with an object.
Yes.
It can mean hitting yourself.
Potentially.
It can mean falling down.
Yes.
It can mean running into something.
Yes.
All of those things happen on this video.
They did.
Now, I want to talk to you about his left upper extremity. You address it on page 3 of your autopsy.
Yes.
What is his left upper extremity?
His left arm.
You did not find any acute injuries on his left arm.
He had two 1/4 inch superficial parallel cuts on the ulnar aspect of the wrist, and he did have a focal abrasion on the dorsal aspect of the little finger. Those were acute injuries.
Could you tell the jury what ulnar and dorsal means?
The dorsal aspect of the little finger means this part of the little finger. So on that part of the little finger of the left hand, there was a localized area of abrasion or a scrape mark. And then he also, the ulnar aspect of the wrist is the part of the wrist that is on the same side as the little finger. The other side of the wrist is called the radial side of the wrist. That's on the same side as the thumb. So on the ulnar side of the wrist, there were two superficial parallel cuts, and those were acute injuries as well.
And those were consistent with handcuffing, right?
Yes.
Now, there were no acute contusions,
No.
no acute hemorrhages.
There was focal subcutaneous hemorrhage associated with the cuts on the ulnar aspect of the wrist.
Okay. No acute injuries to the left arm?
Well, if you include the wrist and the little finger as part of the left arm, those were acute injuries.
What I want to specifically direct your attention to is this part of his arm.
Yes.
So this would be his
Upper arm.
Upper arm. If you watched in the video, do you remember there was a time when Mr. Freeman had one of the sergeants by the legs and he was laid out on the ground, and one of the officers in a green mask comes up and he administers one shot of spray and then 3 quick kicks to his upper arm to try to get him off of that sergeant? Do you remember that?
I don't specifically remember that. I'd have to re-review the video.
In hearing that description of events, did those 3 short kicks cause any acute injuries that you're aware of in your autopsy?
And those, the strict kicks to where?
His
To
upper
our
left
arm? Not that I could see, no.
Okay. Now, I want to talk to you about his knees.
Yes.
Now, those are addressed, this hunter walked you through all of the exhibits yesterday, right?
Yes.
15A, 15H, 15M, and 15O all dealt with his knees.
Yes.
Those were healing injuries.
Yes, they were.
Those were from a different situation.
Yes.
Those were not acute.
No.
I want to talk to you about the injuries to his head.
Yes.
You watched the video?
Yes.
Did the laceration to his head come from the subdual?
I'd have to re-review the video again, but I think it more likely occurred on the 4th floor, but I can't say for certain that it wasn't the result of the subdual without re-reviewing that video.
Okay. Would it have occurred from those 3 short kicks to his arm?
Not to the arm, no.
Can you tell from the video exactly when that injury happened?
Which injury?
The laceration to his head?
No, I cannot.
And there was no subdural hemorrhaging there?
No.
And there was no epidural hemorrhaging there?
No.
Now, I want to talk to you about the injuries on his back.
Yes.
That involved an old injury from a stab wound.
Yes.
That was not from this altercation.
No, it was not.
That was not from this subdual.
The stab wound was not from subdual. No, 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 no.
That was a completely different altercation.
Correct.
In your findings, did you find that the bandage was still intact?
Yes.
Still in place?
Yes.
The wound itself was not broken open?
No.
Not torn?
Nope.
Not harmed at all during any part of this?
No.
Now, I want to talk to you yesterday in Exhibit 15C. You had mentioned acute hyperpigmentation. I'm going to pass that forward to you. Okay, thank you. What is acute hyperpigmentation? I'm sorry, what is hyperpigmentation, not acute? What is hyperpigmentation?
Hyperpigmentation just means an increase in the level of pigmentation in a given area.
Okay, and that is not an acute injury.
No, it is not. But what I'm trying to remember is what this photograph is demonstrating. I believe that's contusion. One can see hyperpigmentation lower down, but I need to re-review my notes as well.
Please. I believe your testimony yesterday was that that depicted hyperpigmentation. Or not yesterday, Saturday.
Let's see. Looking at my body diagram, what I've indicated is that there is some hyperpigmentation down in this area, but there are some contusions higher up in this area here.
Would you please step down and show the jury exactly which parts are which?
So in this photograph, this area here would be an area of hyperpigmentation on the flanks. But higher up on the back, this area here and that smaller area next to my ring finger, those are contusions or bruises, more on the upper back.
Dr. Ross, if I may pass you 15T, are those the same contusions as are contained in 15C?
Yes, it is a close-up of that area, of the of the area of hyperpigmentation.
Okay. Oh, that's the close-up of
That's a
hyper-
close-up of the area of hyperpigmentation.
If you could please show that to the jury, that's 15T. That is the hyperpigmentation?
Yes.
Okay. And while you're standing there, I'm gonna hand you back 15C, and I want you to point out again exactly where the contusions are. Okay.
The contusions are up here on the right upper back is where the contusions are located. So the upper back again is this area up here. So there are contusions, areas of bruising up there. Down here, where my middle finger is, that's the area of hyperpigmentation.
And Dr. Ross, if you could, for the jury, on me, can you show where the contusions would have been?
Up in this area here.
Okay. And that's on the right shoulder.
Yes.
Thank you. Would you agree with me that in the video, Mr. Parham was on Mr. Freeman's left side?
On his left side?
Yes.
Yes, I believe so.
All right, now I want to talk to you about your testimony on direct. You described hemorrhages and bruising, and you were explaining that blunt force trauma can cause immediate bleeding,
Yes.
and it can continue to bleed until the body processes stop bleeding.
Yes.
Is that why it's hard to date bruises?
It's hard to date them precisely because there can be variations in when the degree of, when the hemorrhaging may actually stop and at what stage various inflammation begins to occur within that area of injury after it has stopped bleeding.
And the bruise is kind of the visual manifestation of the hemorrhaging?
Yes, when the bleeding is sufficient enough. And again, depending upon the blunt force that you get to a certain area, you may or may not see immediate bruising in an area. If the blunt force is sufficient enough to break blood vessels, you will eventually get bruising of some type. If the blood vessels that are broken are more superficial in the upper layers of the skin and the subcutaneous fat, which is located just underneath the skin, you usually will see pretty immediate bruising. But if the ruptured blood vessels tend to occur deeper down in the tissue, say down in the muscle, which is underneath the layer of subcutaneous fat that is underneath the skin, in that deeper layers of where the muscle is, if you get hemorrhaging in there, but you don't get any significant disruption of blood vessels in the skin or in the subcutaneous tissue, you'll get hemorrhage into the muscle, but eventually that hemorrhage will sort of work its way up high enough into the tissues, into the fatty tissues and just underneath the skin, that you will then see it. So sometimes that's why you may, or an individual may hit themselves in an area or get struck in an area where you don't see any immediate bruising, but lo and behold, a day or two later you see, oh, there's bruising there. That's because the hemorrhaging was deep enough that it didn't show up immediately, but it eventually worked its way up. So it depends on at what level the blood vessels are disrupted.
Now I want to talk to you about, I've talked to you about the things that were in your autopsy. I want to talk to you about the things that were not present in your autopsy, okay?
Yes.
There were no rib fractures here.
No.
Can weight applied to the chest or the back cause rib fractures?
It can, potentially.
CPR can even cause rib fractures.
It can, yes.
There was no cerebral edema.
No.
Is that significant?
Well, cerebral edema is, again, swelling of the brain tissue. And when you see a significant swelling of the brain, that can occur for a number of reasons. It can occur in individuals who had a cardiac arrest. It can occur in cases of drowning or drug overdose. It can occur in cases of blunt force trauma to the head. But I didn't see any significant, grossly evident cerebral edema. I believe the microscopic examination showed some fairly localized edema in one of the sections, but generally speaking, I didn't see any extensive edema of the brain, no.
And can the edema also be consistent with asphyxiation?
Yes, it can.
There was no petechia here.
No, there wasn't.
And what is petechia?
Petechia are tiny little pinpoint hemorrhages that can occur, and they can occur anywhere on the body. In cases of asphyxia, we frequently will see them in the eyes and the eyelids, but not always. But if one sees it, it certainly is a potential marker of an asphyxial event. I did not see any petechia in this case.
There was no excessive hemorrhaging in the lungs.
No.
Just a normal postmortem process.
Yes.
Postmortem process, I'm sorry. And excessive hemorrhaging could indicate localized or severe trauma to the lungs.
It can, yes.
And that was not present here.
No.
Now yesterday, or I'm sorry, I keep on saying yesterday. Saturday when you testified, you talked about a post-mortem artifact. Could you just tell the jury what that means?
A post-mortem artifact refers to changes that one may see in the tissues that are the result of something that occurs to the tissue after death. So that's what post-mortem refers to. And in many cases, it's because the tissue can begin to break down. And when the tissue begins to break down in some manner, then you can start to see things that look abnormal, but it's related to a post-mortem process. It's not related to a process that occurred before death. So it is one of the things we look at when we're microscopically evaluating the tissues. We want to make sure that lesions or abnormalities that we see microscopically, are they attributed to something that happened before death, or can they be the result of something that happened after death? And in some cases, again, it can be what happens after this. And a lot of that has to do with how soon an autopsy may be performed after death. And for example, in the medical setting where a biopsy is taken, a piece of tissue is taken and is immediately put in formalin, you don't expect to see any postmortem changes. But in forensic pathology, we see it very frequently because of the time delay between when a disease process or an injury, it may stop in the body, but then there's that postmortem interval where the tissue may begin to break down a little bit, and you can see that microscopically.
Now, I want to talk to you next about some of the hypotheticals that Mr. Funk gave you on Saturday, okay?
Yes.
He asked you if contusions can be consistent with a great amount of force being placed on a particular location.
Yes, they can.
Is that the only circumstance consistent with contusions in an area?
No.
Is it also consistent with a blunt force trauma?
Well, technically, even placing an object, with some force on an area without necessarily hitting it, but just pressing it, that's considered blunt force per se. That's a form of blunt force trauma, but that's not the only type of blunt force trauma to an area that can cause hemorrhage. Certainly, if somebody had been struck in an area or fell on an area and that area of their body struck something else, you can see the same kind of hemorrhage. It can be hard to distinguish what caused it.
And you would agree with me that the contusions that you found on Mr. Freeman's back were on the back right shoulder?
Well, that was what could be seen externally, but
Yes.
internally, there were several scattered hemorrhages, and I did see on the internal areas of hemorrhage, and when I did review those photographs, that there were hemorrhages in the mid and lower back as well, that even though one doesn't want to see obvious contusions in those areas externally on the skin surface, it was there in the muscle. So there was hemorrhaging in the muscle at multiple layers on the upper, middle, and lower back.
Yes. The contusions, though, specifically that Mr. Funk asked you about, those contusions were on the upper right shoulder.
The ones that I could see externally on the body, there were a couple other contusions that were sort of in the mid back, but again, they were upper areas. Yes, that is correct. Mhm.
Yes. Now, he also asked if can contusions on the right posterior lateral chest wall be consistent with too much pressure or weight being placed on the back. So, do you remember him asking you that?
Yes.
Please tell me what the right posterior lateral chest wall is. Where on the body?
It would be the posterior refers to back, and lateral refers to the side. So it's on the right side of the back, sort of over towards the side, not in the middle of the back, or not down where your spine is, but sort of out to the side. So the right posterolateral would basically be this part of your chest right here.
And if you would, again, just step down to show the jury on me so everybody can see.
Right posterolateral refers to this region right here.
And that would be on the right side of the body.
Yes.
And again, is that the only circumstance that could be consistent with contusions on the right side of the body?
Any number of things could cause contusions to that area of the body.
And you saw on the video numerous things that could have caused contusions to that part of the body.
Yes.
Between the fourth floor and the fifth floor.
Yes.
Can you say to any degree of medical certainty that the contusions present were caused by weight on the back as opposed to any of the other possibilities?
No.
You were asked on direct, can a deep muscular hemorrhage be consistent with too much pressure or too much weight being placed on the back? Do you remember
Yes.
that? And your answer was it could be consistent with a certain amount of pressure or weight, right?
Yes.
So you were not willing to say it's too much, it's a certain amount.
Yes.
Is that the only circumstance consistent with hemorrhages on the back?
No.
Could the hemorrhages also have been caused by the altercation on the fourth floor?
Yes.
By the times that he fell?
Yes.
By any other interactions with other officers?
Yes.
And all of those could be consistent with deep muscle hemorrhages.
Yes.
You also saw evidence of more than one occasion of injury.
Yes.
Uh, Can you age the hemorrhages if they continue to bleed?
If they're continuing to bleed, it depends over what time period that they are bleeding. But usually it requires about, over 24 hours from the time of onset of injury when you begin to see inflammatory changes, although you can theoretically sometimes see them even earlier. Particularly there's what's known as acute inflammation, and that can occur within a few hours, but sometimes it can be delayed a little bit longer than that. You may not see it for a day or so. One of the other things is sometimes you just look for the other presence of other types of inflammatory changes in those tissues.
Can you say to any degree of medical certainty that the deep muscle hemorrhages present on the back were caused by weight placed on the back, as opposed to any of the other possibilities?
No.
Now, I want to talk to you about a phrase that we've been using a lot, consistent with. As a medical examiner, you get asked questions all the time about whether something is consistent with a certain circumstance, right?
Yes.
Why is it framed that way?
Because there are more than one possible cause for certain types of injuries that one might see on the body. So the evaluation that we do would include making an assessment as to whether or not injuries that are present on a body are consistent with a described set of circumstances or a scenario.
Is it fair to say that consistent with means possible?
What it means is, yes, it can be caused by X, Y, Z.
Okay. Now I want to talk to you about another hypothetical that General Funk had given to you yesterday, okay? He talked to you about him laying out on the ground on the seal versus balancing on one foot or, balancing on one knee, right?
Yes.
And you had agreed that if you were entirely balanced on your knee, that would create a more pronounced contusion.
Potentially, yes, a contusion, and certainly you would be increased pressure in that area, yes.
And you said you would have to entirely balance on the knee, right?
Well, if you wanted to say that, yes, that let's say an individual of X number of pounds of weight was transferred to an area where the knee was, you'd basically have to have everything balanced on that one knee. Whereas if part of your body is on another leg that's somewhere else, then yeah, that weight gets distributed more, so your entire weight is not on that knee.
So right now I'm kneeled on the ground with my femurs kind of parallel to my body. And right now, am I distributing weight between my legs?
Yes.
Right now, am I distributing weight between my legs?
Yes.
Right now, is it fair to say that I probably have more weight on this leg?
Have to get a pressure monitor to actually measure it and know for sure. I couldn't say.
Well, if I can do this, does it mean that I probably have more weight on this leg?
That particular maneuver suggests that, yes, that you've got more weight on your foot than you do on the knee. But again, if you lean more onto the knee and you weren't able to lift it, then yes, then the knee might have more weight on it.
Okay. And that distribution of weight reduces the amount of weight going to a particular, like my knee in that example.
Yes.
I want to talk to you about the pre-existing nature of Mr. Freeman's heart condition, okay?
Yes.
The altercation did not cause the blockage in his heart.
No.
The blockage was pre-existing.
Yes.
That means it was there beforehand.
Yes.
And the physical altercation and struggle are what constituted physical exertion, right?
Yes.
And that increased his cardiac demands.
Yes.
And any pain that he may have suffered would have increased his cardiac demands.
Yes.
Any increase to his adrenaline levels would have increased his cardiac demands.
Yes.
And the increase in cardiac demands is what his heart was not able to keep up.
Correct.
I want to talk to you about psychosis that you listed as a contributory cause.
Yes.
You list it as a contributory cause because of what you saw in the video and because of medical records that you have reviewed, right?
Yes.
It appeared that he was in a psychosis during this video.
He looked like he was having some psychotic manifestations. I'm not a psychiatrist, and I couldn't say absolutely certain, which is why I said possible, but it certainly looks that way to me.
And he had a clinical history of psychosis.
He does have a clinical history, yes.
And in watching it, it appears as though a psychosis may have been affecting his behavior.
Yes.
A psychosis can also affect a person's heart rate.
If the manifestation of the psychosis involves an increase in level of physical activity or agitation, yes, it can.
And here you also have the additional information that he was in a suicide pod,
Yes.
which kind of also lends itself to the possible psychosis. Right?
There are many reasons they might be in a suicide pod. I don't know what relationship the psychosis has to him being placed in a suicide pod. I think that they were waiting on an actual psychiatric assessment, but that it was never completed. So I'd have to defer to whatever a psychiatrist would think about that particular situation.
And it was your understanding that Mr. Freeman originally was not housed in that suicide pod?
I don't believe so, no.
He was moved at some point.
Yes.
I'll object. Personnel.
Yeah, please. First reading.
Your Honor, may I approach the witness?
Yes, you may.
Dr. Ross, if you would please just read this. These are part of the records that I believe you reviewed. And my question to you is, does it appear as though at some point mental health had interviewed Mr. Freeman?
According to this, it does say that he was seen by mental health Ms. Williams and placed on suicide precautions.
Thank you. May I approach?
Yes.
And things like that, the hearsay, medical documents and records from the jail, those are things that you needed to rely on in this case, right?
Yes.
And that's normal for you to rely on them.
Yes.
Among those things that we had previously discussed that are normal for you to rely on was that toxicology report.
Yes.
Now, in the toxicology report, it did not indicate that he was on any sort of antipsychotic medication.
Not per se. One of the drugs that was in his system, Phenergan, I think is sometimes administered, or promethazine, is sometimes administered in some psychiatric patients for certain reasons. But I don't know if that was the case here, since that drug, promethazine, has other uses.
Are you familiar with promethazine being used as a street drug as well?
As a street drug?
Yes.
No, I'm
With
not.
A drink?
No.
The fact that he did not have any antipsychotic medications in his toxicology report, does that necessarily mean that he did not need antipsychotic medications?
No.
And would that also mean that he would be more susceptible to any mental health conditions that he had?
If he didn't have any appropriate medication on board, I would think so, yes.
Now, I want to talk to you about the 5th floor and the 4th floor, okay?
Okay?
It would require considerable speculation for you to try and say whether the actions of the 4th floor or the 5th floor were ultimately more important in Mr. Freeman's death.
Yes.
It would be impossible for you to apportion percentages.
I could not in this case do that.
There is no reliable analytical process that you could use to say whether the 4th floor or the 5th floor was the stressor that caused his heart attack.
I could not tell whether the 4th floor events or the 5th floor events were the more significant, but I believe that both of them, since he was still alive by the time he got on the 5th floor, had some role to play in it. But whether it was primarily the 5th floor or the 4th floor, I don't know. I don't believe it was entirely one or the other, but I believe it was a combination of the two. But percentage-wise, I couldn't say.
Your Honor, if I may approach the witness with the transcript from your meeting with the prosecutors, if you could please turn to page 53.
By your meeting, you mean the witness's meeting or my meeting?
With Dr. Ross's meeting.
Okay.
Which page?
53, please.
Okay.
Okay, and if you will look at line 34, Mr. Gilbert asked you, let me ask you this. So we talked about the 4th floor and the 5th floor, and striking that caused the trauma that we've talked about. We've talked about the 5th floor and the subdual. If somebody handed you a pie chart and said, will you make one distributing 4th floor versus the 5th floor? I guess I've got two questions. Number one, is that even possible? Would you look at this and go, medically speaking, you can't do it? And you say, yeah. And that might be a legitimate answer. If you can do it, I'm interested. You mean percentage to contribute to death? Is that what you're asking? Turning the page. Right. For example, you're looking at this going, hey, listen, it's 50-50, it's 75-25. It's impossible to do. What would your, don't let me put any words in your mouth.
Judge, George,
Yeah.
There's no reliable physical, no reliable analytical process that I'm aware of that I could use to make that assessment. Is that what you told the prosecutors in
Yes.
So, is it true that there is no reliable analytical process that you could use to say whether the fourth floor or the fifth floor was the stressor to cause the heart attack?
That I was aware of.
It would not be a legitimate medical conclusion for you today.
Correct.
Based on the level of disease you saw in his heart, the stress from the fourth floor could have been enough on its own to trigger the heart attack.
Hypothetically, yes.
Based on what you saw, he could have died without the subdual ever happening.
It's hypothetically possible, yes.
Because of the extent of the heart disease present,
Yes.
the heart disease that you believe caused his death.
The exacerbation by the external factors, yes.
And his internal factors as well.
That's a pre-existing condition.
Yes.
So in looking at cause and effect, one has to take into consideration the temporal association between risk factors and events leading up to death. So you have a pre-existing risk factor, heart disease, and then you have the intervening events of physical altercation and subdual, and followed by his death. So exacerbation of his disease by those intervening events is the conclusion that I came to.
His severe coronary artery, arteriosclerotic disease was so severe that his actions in his cell by himself before that door ever opened were enough to have been able to trigger a heart attack.
It's hypothetically possible, yes.
It is possible.
Yes.
If you took everything that happened on the fifth floor and the fourth floor out of this, he still could have died from the stress from the behavior in his cell.
It's hypothetically possible, yes.
You would not say that but for what happened on the fifth floor, Mr. Freeman would have survived.
Not for the fifth floor per se, but fourth and fifth floor, I would say, but not for those.
If you want to look at page 55 of that meeting transcript. Starting at line 7. And you wouldn't say kind of the opposite, which is but for what happened on the fifth floor, he wouldn't have survived. You wouldn't say. And your answer was, yeah. You would not say that what happened on the fifth floor
Right.
was a but-for cause of his death, right?
Mm-hmm. Right.
Now, I want to talk to you about the subdual, okay?
Yes.
In your opinion, the subdual and the altercation figure in with his heart disease.
Yes.
During the subdual, Mr. Freeman was still struggling.
Yes, he was.
That was increasing his heart's demand for oxygen.
Yes.
And because of that increased demand for oxygen, his severely diseased heart was not able to keep up with him.
Correct.
On the video, is it possible for you to determine what amount of pressure was on his back?
No.
Does the amount of pressure matter?
Yes.
You cannot just guess about the amount of pressure there, right?
No.
It would be medically inappropriate for you to do that.
I could not, with any reasonable medical certainty, ascertain what the level of pressure was.
Can you tell if sufficient weight was there to create an asphyxia event?
No, I can't tell. Can't rule it out, but I can't see any evident, obvious findings to suggest that.
Do you know whether Mr. Freeman's heart had reached the point of irreversible damage even before the knee was placed on his back?
It's possible it may have, yes.
Now, I want to talk to you briefly about medical attention, okay? You reviewed the video.
Yes.
You saw that medical staff arrived.
Right.
And you reviewed their records, right?
Yes.
And you relied on the records that the medical staff provided.
Yes.
You relied on the fact that the medical staff staff indicated that he had flickering eyes,
Yes.
that he had a weak femoral pulse,
Yes.
that he was still alive.
Yes.
And you would agree with me that they did not immediately initiate CPR.
Correct.
Now, I want to talk to you about kind of the severity that we're talking about here. And I know we've talked about this, so I'm going to be brief. It would have been entirely possible for Mr. Freeman to have died that same day without any of this ever happening.
It's hypothetically possible, yes.
It's just impossible to know, right? It's impossible
Whether or
to
not
know
he
at what
could, he
point-
could have,
It's
yes.
impossible to know at what point he would or could have died, right?
Yes.
It's also impossible to know, just based on the video, at what point his heart gave out.
Correct. Well, at what point it had sustained an irreversible event that led to his death.
Thank you, absolutely. And that means that you can have that point of irreversible damage and still continue walking, talking, fighting.
Yes.
But you're past the point of return.
Yes.
Is there any direct evidence in your autopsy of asphyxia?
No.
Your Honor, if I may have just one moment.
Yes, ma'am.
Your Honor, that's all my questions.
Listen,
Oh,
we're
wait,
gonna
I'm
take,
sorry, I'm sorry. The degree, particularly the severe blockage in his vessels and arteries,
Yes.
you wouldn't have been able to know that from looking at him.
No.
He was not in the typical risk age.
No.
He was not in, he was not obese.
No.
He didn't have a lot of the physical risk factors that you would associate with severe arteriosclerotic coronary artery disease.
No.
And anyone just looking at him would have no way of knowing.
Correct.
That's all I have.
ladies and gentlemen, we're gonna take a short restroom break, be back with you in just a few minutes, don't discuss the case yourselves, anybody else, stretch a little before you come back. One more call.
Okay.
Mr. Irvin wanted to break his elbow.
I'm gonna try to find an elbow Saturday.
All right, thank you. Take recess, please.
Court stands in recess.
Sorry.
No, I understand. I understand. I know.
Yeah, put up with Jesus mentioned lawyers in Matthew 5. Jesus said lawyers are people who keep burdens on their backs too heavy. What do you thought of that?
Yeah. Interesting. Yeah. Back then. Yeah. afternoon.
Ms. Fuchs was thorough, and I don't have to go over a lot of what she went over, but I want to cut to the chase. And I want to ask what is referred to by the rules of your opinion on one of the ultimate issues in this case, okay?
Okay?
I want to show you this. Zoom in here. So one of the things the jury has got to decide in this case, if the state has proved beyond a reasonable doubt that the death of Gershun Freeman was caused by Stevan Jones, that's my client, or for whom the defendant is criminally responsible, or both. And this is what I want to ask you about. The proximate cause is the cause which is a natural and continuous sequence, unbroken by any independent intervening cause, which produces the death, and without which the death would not have occurred. Now, you have been asked that question directly before, and I want to read, just so that we can ask it the exact same way again.
Judge, can we approach?
Yes.
All right, so the ultimate question I want to ask you, you've watched the video, you were the one that performed the autopsy. Can you say that anything or combination of things that any one particular jailer or jailers did caused the death of Gershun Freeman?
With regard to a particular jailer, no.
And with regard to these two men in particular?
I cannot say.
And with regard to Stevan Jones in particular, and I'll remind you, I know it's probably been a minute since you've watched the video, Mr. Jones is the one that is controlling the lower half of his body, waiting for leg irons. Can you say anything he did in particular caused the death?
No.
Okay. And I think you went on, tell me if this is still your opinion, when you were asked the question before, you said your answer was, to what extent, if I can pinpoint the one thing that were it not for that particular thing, he wouldn't have died? No, I can't do that. And so you cannot do that, correct?
Correct.
And this opinion, and I appreciate that, Ms. Fuchs hit it with you, but these opinions are not new in this courtroom. These are opinions you've had for quite a while, right?
Yes.
You had them when you performed the autopsy and signed the autopsy report.
When I signed the autopsy report, yes.
And then you met with Mr. Funk's team in June of 2023?
I believe so. I don't recall the specific date, but
I think it was June 22nd, 2023. Does that sound right?
could be.
Somewhere in there?
I remember having a meeting with them sometime after I had completed the autopsy report, but I don't specifically remember
Okay.
when.
And this particular issue came up quite a bit. They were really trying to pin you down on trying to apportion fault to the fifth floor. Do you remember that?
To some extent, yes.
Okay. And one of the things you told them in June of 2023 was that based on what you saw, the fourth floor altercation with that degree of heart disease could have by itself caused us that.
Yes.
And you told them that in June of 23.
Yes.
Another thing you said was that you couldn't say that but for what happened on the fifth floor, Mr. Freeman would have survived.
Right.
And you told them that in June of 2023.
Yes.
And you also said that but for what happened on the, or excuse me, that if both the fourth and fifth floors were removed, if he had simply been found dead in his cell, you would say he died of coronary artery disease.
Yes.
And that could have happened on that day.
Hypothetically possible.
And hypothetically, but it's also a reasonable possibility based on the extent of coronary artery
Yes.
disease. That's a reasonable possibility.
Yes.
And they knew this in June of 2023.
That's what I told them.
With no fourth or fifth floor at all, he had the potential to die of sudden death. That was also discussed.
Okay.
The other thing I kind of want to clear up is the term subgroup. Okay, and Ms. Fuchs talked to you about it, but I think that word can mean two different things, and I want to figure out how you mean it when you describe it in your autopsy and you testified today. When you described a subdual as being part of this, you're not referring to a particular manner with which he was held down, are you?
Not a specific maneuver per se, it's just the general overall process by which he was restrained and subsequently subdued.
And that's what I mean by that. Your cause of death is a heart attack, right? A cardiac event.
An exacerbation, that's sort of the immediate cause, yes.
And that could either be an infarct or it could be an arrhythmia, but it's the stress put on him that caused the cardiac event.
Yes.
Right? And when you're describing subdual, you're talking about the process of subdual, the fighting, the continued stressors.
Yes.
The fact that it's requiring a greater output of his cardiac capacity, right?
Correct.
And he's requiring more oxygen.
Yes.
And his heart just gives out. I think that's what you said.
Right.
So you're not talking about, when you use the term subdual, it has nothing to do with an asphyxiation event.
Not specifically, an asphyxial event could possibly have been part of the subdual process, but it not necessarily so.
But you didn't have any evidence of that, and that's nowhere in your autopsy report.
Correct.
Right. And mechanical asphyxia, the way it's been described here, is a hypoxic death. And what is hypoxia?
A lack of oxygen.
To the brain.
Yes.
And you didn't see any evidence of a hypoxic death here, did you?
No, like I say, I saw some ischemic changes in the cerebellum. That could have been the result of the decreased blood flow to his brain that was occurring because of what was going on with his heart.
You just
Which,
can't say.
right.
Let me ask you this. You wouldn't say that a hypoxic death, a brain death from mechanical asphyxiation, you wouldn't characterize that as a more specific diagnosis from your diagnosis, would you? It's a separate cause of death, right? Those two things are different.
As you stated it as such. Now, whether or not there was an asphyxial process again that occurred as a result of the subdual that may have contributed to that. I can't say whether or not there was. There may have been, there may not have been.
You cannot rule it in,
Right.
you cannot rule it out,
Correct.
it's just a possibility,
Correct.
and we have no way of knowing.
I have no way of knowing.
There was nothing, and you're the one that performed the autopsy.
Yes.
Last thing I want to talk to you about. This is your diagram of injuries. You didn't find any acute injuries to the back of his legs?
No.
No abrasions?
No.
No contusions?
No.
No avulsions?
No.
Not even a scratch?
No.
One moment, I may be done. All right. And you've done 5,000 of these autopsies,
Over 5,000, yes.
mostly for the state of Tennessee.
Mostly. I did some for other states prior to my time in Tennessee, but the majority have been in Tennessee.
That's all I have, Dr. Roy.
State have any redirect?
Yes, sir, Judge, if I could have just a minute
Yes.
to organize.
That's fine.
Connor, we were just handed Jake's material that we have not been provided prior to right now, so
You
we
need some
will,
time.
yes.
All right, we'll take another recess. Discuss the case yourselves. Enjoy the walk. Ms. Charles, they still behaving okay? All right, good. Let me know if they misbehave. Recess. Well, thank you for having a quick lunch. We just sit back there when it got here. We were trying to make sure that we don't give you late dinner tonight, so we can catch up and stay online. So I appreciate y'all cooperating with us on that. All right, with that, say that you may redirect. Oh, we need our witness. Yes, we need, Dr. Ross. Remember, everybody except the witness. Thank you again, Dr. Ross. You're still on good.
Good afternoon, Dr. Ross.
Afternoon.
I have several topics to talk to you about. First off, is you take a picture, look at the pictures that I believe have already been introduced into evidence that are the pie graphs.
Yes, they are in exhibit.
And if you can show me which one you're looking at.
The right coronary artery, the red.
That's the one that's, the right coronary artery, you said there was a blockage of 75 to 80%.
Correct.
Is that right? So if there's a blockage of 75 to 80%, what's the percentage that is allowing blood to pass through?
20 to 25%.
20 to 25%. If at 25%, then that would mean 1/4 of the artery is allowing blood to flow through.
Yes.
And so at 25%, if we just do some basic math, if we're doing it by quarters, 25%, 25, 25, 25, how many of those units should make up the entire circle?
Depending, if it's 20%, it'll be 5 units. If it's 25%, it'll be 4 units.
Okay. So I'm going to pass you a couple of other charts. And ask if those are pie graphs that show 25% and 20%.
Yes, they do.
Would those be accurate depictions of how much blood would be flowing through with a 80% blockage or a 75% blockage?
Yes, particularly if these were as eccentric type lesions that someone's showing what that is.
The first one that you held up was what the defense asked you to hold with regards to an 80% blockage. Is that correct?
Correct.
Okay. And if you could just hold the one that shows the 80% blockage on what I just handed you. Just the 80%, not the 75. Right. And can you stand up and show that to the jury, make sure they see the difference? And while you're on your feet, if you would show, I'll let you pass on back. If you've got it, you stay for just a second, you hold up 75%.
Is that 75?
Compared to what they had earlier introduced.
There, this one is intending to show it's 80%.
Dr. Ross, you didn't bring any geometric tools with you, but did
No.
it appear that in the one that you just held up with the pie graph with just the sliver of pie, that would be accurate with regards to 1/5 of the entire 5.
Yes.
5 times the 1 spot, 4 times the 1 spot added to the 1 spot would equal 5, and that would be 20% versus 50%.
Yes.
Would 5 times that white dot fill up the entire circle?
I would think it would take more than 5 times, yes.
You had a conversation with defense counsel that Mr. Irvin went over with you a little while ago, is that correct?
Yes.
At least a portion of it. In that conversation, was there part of that conversation where you discussed any injuries to the left side of Mr. Gershun Freeman's back?
To the left side? I don't recall.
Judge, may I approach the witness? Yes. This is on page 1, lines 5 to 9. So if you can review that.
Okay.
All right. Did you ever tell Mr. Irvin and Ms. Fuchs that there was damage to Mr. Freeman's left side on his back?
On this, I did, yes.
And do you stand by that? That
Yes.
There was damage to the left side of his back?
Yes.
Yes,
If I can-
yes, read
You use this term subdual in your autopsy, in your manner of death. And we talked about it a little bit when I was on direct, and then both of the defense counsel talked to you. That's not the most precise, you didn't say between this time stamp and this time stamp, you just said subdual.
Correct.
Did the time circumference of subdual include the time when Mr. Freeman was prone and Mr. Jones was on his back, but he was not yet handcuffed? Is that part of the subdual?
That would include it, yes.
After he had been cuffed and Mr. Jones was still in some position on or over Mr. Freeman's back, is that part of the subdual?
Yes.
Okay, that's not in evidence, Your Honor.
Sorry, would you all approach
May
the
we
witness?
approach the-
And he was first put into the prone position. Did the subdual include the time from the time that he was in that prone position to the time that Mr. Jones actually got the handcuffs on him?
Yes.
Did the time period that you described as subdual include the time from the time that he was handcuffed to the time that the leg restraints were placed on him?
Yes.
And did it include the time from the time when he'd been both handcuffed behind his back and there were leg restraints until the point when both men were off him completely? Did that all, was
Yes.
When you have hearsay information in medical records, all the different sources of information as you're doing your autopsy, when you have hearsay information in medical records, how much investigation do you do to see if that hearsay information was accurate?
I just read what's in the medical record.
Atherosclerosis, you said, is potentially life-threatening. Can someone with atherosclerosis, or what other causes can cause somebody to die even if they have atherosclerosis?
Well, people with atherosclerosis can die of many of other diseases. There are a lot of people who die with atherosclerosis, but not because of atherosclerosis.
What other causes of death can work with this medical condition of atherosclerosis to cause death?
That sort of act with it, you say? Well, hypertension for one, hypertensive and atherosclerotic cardiovascular disease as a combined entity is a frequent cause of death. And certainly coronary atherosclerosis is as a comorbidity in a lot of other disease conditions ranging from cancer to inflammatory conditions, but any disease which exerts enough of a stress on the body that stresses a heart that's already diseased, that makes it worse. The same can be said of trauma. Trauma on top of coronary artery disease makes that condition worse.
What criminal actions can work with atherosclerosis to cause somebody to die?
Well-
Objection, Your Honor, that's approach.
Yes.
Dr. Ross, can a continuing assault on someone with atherosclerosis cause that person to die?
Yes.
Judge, if I have not moved those graphs into evidence, I want to make sure I do that.
Talking about the circles?
Yes, sir.
They're in evidence. I thought they were going to be in evidence.
I'll move those into
Oh,
evidence.
these aren't the circle, oh, these are the difference, okay. All right, this will be exhibit, are we on 17? This will be
Yes,
exhibit
Your Honor.
17.
Dr. Ross, how can people survive heart attacks?
Some people survive heart attacks even without intervention. It has happened, but most of the time it requires medical intervention to minimize the damage through a number of interactions to the heart. In some cases, may require resuscitation.
What's the most common form that people are trained on to help somebody who has just had a heart attack?
I'm sorry, repeat that
What's the
question?
most common technique where people are trained on in order to help people survive a heart attack?
CPR.
And when is CPR going to be most effective at helping someone survive a heart attack?
I think an emergency physician or a cardiologist might be in a better position to answer that question, but probably someone who has a degree of injury that is not irreversibly fatal.
Does it matter how long it takes to start CPR?
It can.
And when is it the most effective time-wise, as far as from the time of the heart attack to the time that the CPR starts?
From the time that once the heart stops, it's probably best to start CPR as soon as possible.
After a heart attack where the heart actually stops, how long can a person still run after the heart stops?
Once the heart stops beating, it varies from individual to individual, but there may be enough oxygenation left in the muscles of the body to still sustain physical activity for another several seconds.
Could that last minutes?
I don't think so.
After the heart stops, how long can someone struggle?
I would, again, probably on the order of a few seconds at the most.
How long could a person fight?
A few seconds at the most.
We talked on Saturday about the 5 different categories for manner of death. Right? Refresh me. Tell me that real quick.
Natural, accident, suicide, homicide, and undetermined.
Ms. Fuchs had talked about Mr. Freeman with his heart condition, being able to have just been found dead in his cell. If he had just been found dead in the cell, which of those 5 would you have written?
Probably natural.
Could you do that in this case?
No.
What indication did you observe in Mr. Freeman's cerebellum that would be consistent with lack of oxygen?
There were some early ischemic changes to some of the neurons in the cerebellum.
Everything that Ms. Fuchs and Mr. Irvine questioned you about, was anything in those questions new to you?
I don't think so.
Is there anything you know now that you did not know before you came to your conclusions in your autopsy report?
No.
You did not rule accidental, or you did not rule natural cause. What did you rule?
Homicide.
Manner of death,
Homicide.
cause of death,
Exacerbation of atherosclerotic cardiovascular disease due to physical altercation and subdual.
do you stand by your autopsy?
I do.
Do you stand by this conclusion?
I do.
But for the behaviors of other persons, not Mr. Freeman, would you have ruled this a homicide?
No.
Hang on 1 second.
Yes, sir.
Those are my questions.
Thank you, Eric.
Yes.
Isn't it true that your opinion is not that but for the subdual, Mr. Freeman would have died?
It's not, but not for the physical altercation and subdual, but not just the subdual by itself.
Correct. You are not here to tell this jury the subdual alone is the cause of Mr. Freeman's death.
No, I can't determine that it is.
Your opinion is that that would be impossible to determine.
Yes.
And General Funk is talking to you about this homicide determination. You are not making the same homicide determination that this jury is being asked to make, are you?
No.
If a person is involved in an altercation that they started, that would still be a homicide according to the epidemiological purposes, right?
Yes.
Even if that person died as a result of a self-defense action.
Yes.
And this is a homicide because this physical exertion that he engaged in during the altercation and subdual involved other people.
Yes.
And his heart was unable to keep up with those cardiac demands.
Correct.
General Funk was asking you about the CPR process, when someone should start CPR. Can irreversible heart damage occur prior to the heart stopping?
Yes.
Minutes?
Yes.
Once irreversible heart damage has occurred, will CPR reverse that?
By definition, if it's irreversible, no, it does not.
And if a heart has stopped, is there a pulse?
If the heart has stopped beating, there is no pulse.
There would not be a weak femoral pulse if the heart had stopped.
No.
When you were discussing the portion of that meeting that you had with Defense Counsel, you talked about hemorrhages were spread throughout the back, right?
Yes.
And those were there was a left side and lung all over the back, right?
Right.
The contusions that we discussed were on the right side.
The ones that you could see externally.
Yes,
But,
those
but
contusions.
technically, the hemorrhages in the back, even the lower back, would be considered contusions, but just contusions that you couldn't see on
Okay.
the skin surface.
So the visible contusions were on the right side.
Yes.
There was scattered hemorrhaging throughout the whole back.
Yes.
And again, with that continuing assault hypothetical that Mr. Funk had given you, that would be, even if that assault was initiated by the decedent, right?
Yes.
And the decedent would be the person who died.
Yes.
One moment, please.
All right.
That's all I have, Your Honor. Thank you.
Sure.
Dr. Ross, I only have one follow-up, and that's regarding his hemorrhages on the left side of the back. Mr. Funk brought it back out. You're describing those injuries to us on page 1, and I'll read from it. 2 localized, about 2 to 3 centimeter superficial hemorrhages actually on the left side, the left lower lateral chest wall. So it's a little bit area of muscle right here. There was a couple of small hemorrhages. First, can you kind of point out and show the jury where those were?
I'm sorry, where are you reading this again?
I'm sorry, I'm reading from, Mr. Funk read from page 1 of our interview. If I could approach the witness, Joe.
Yes.
He talked about page 1, lines 5 through 9. I think you were just describing the autopsy findings. But you've already gone over that.
Well, there were more hemorrhages than that.
Right, but that's just what Mr. Funk was talking to you about, and I was wanting to know where they were.
I'd have to look at the autopsy photographs again to verify that.
Okay. So that the jury knows, 2 to 3 centimeters, how big is that in inches?
It's about an inch.
About an inch?
Yeah.
So 2 hemorrhages localized, and what does superficial mean?
In the more outer layers of the muscular tissue.
So not like a deep hemorrhage?
No.
Okay. About an inch thick?
Right.
Okay. Thank you. That's all the follow-up I have, Judge.
Dave?
No, the redirect, Judge.
Doctor, thank you very much. You may go.
Thank you.
Appreciate it. Say you need a break for your call you next week?
No, Your Honor, but we will need the TV. We don't necessarily need a break, but if our team can
Okay,
start bringing
that's
that
fine.
in.
You won't excuse the jury to get scared, I'm not gonna bring him back for half hour. Watch him bring in the TV. Come on. Yeah. Go right ahead. I'll hold the door. So you won't block yourself.
Bing Lee.
Dr. Lee, please. Dr. Lee, do you solemnly swear or affirm to tell the truth, whole truth, and nothing but the truth, nothing but the truth? I do. Absolutely. All right.
Good afternoon, Dr. Lee.
Good afternoon.
Would you please state your name and spell your first and last name for the record?
Feng Li, Fengli.
And Dr. Lee, did you recently just retire?
Yes, about a month ago.
Okay, well, I want to congratulate you on your retirement and let you know we're rewarding you by having you come testify in another trial.
Thank you.
Let's start off, Dr. Lee, by letting the jury know about your education, training, and experience. Do you have a CV that tells the jury all about that?
Yes.
Your Honor, may I approach the witness?
Yes, you may.
I'm handing you a document. Can you tell the jury what this is?
It's a copy of my CV.
Your Honor, I would offer his CV into evidence as the next numbered exhibit.
Okay, exhibit 18.
Your Honor, I've made a copy of his CV for the jury. Can we pass it out to them?
Yes, ma'am.
Your Honor, I've also made it part of a PowerPoint presentation. May I publish it to the jury in
Yes.
a digital format as well?
That would be fine.
Dr. Lee, can you tell us about your educational background first?
I graduated medical school from China. Have PhD in physiology from University of Louisville, Kentucky. And I also have a law degree from Nashville School of Law. And I have my residency training in anatomic and clinical pathology in Philadelphia.
Wait,
Uh,
and Dr. Lee, if you could hold on just a second, I want to go through that a little bit more thoroughly with you, okay?
Sure.
So we can see at the top of your CV that you've got a lot of letters behind your name.
Yes.
So you said that you got your MD in China. Can you tell the jury what an MD is?
Doctor of Medicine.
And then we also see that you have an MS behind your name. Can you tell the jury what that is?
It's a graduate degree, Master of Science.
And then you also have a PhD behind your name. Can you tell the jury what that means?
PhD of Doctor of Philosophy. It's in physiology.
And then you also have a JD. Can you tell the jury what that is?
JD is Juris Doctor. It's basically a law degree, a lawyer, like a lawyer, law school graduate.
A law school graduate, just like me.
Yes.
Okay. All right. And are you board certified in anatomic and clinical pathology?
Yes.
And is this by the American Board of Pathology?
Yes.
What does it mean to be board certified?
So basically, you had a medical school graduate, residency training, passed all the boards, required boards, and certified, board certified by the American Board of Pathology.
Okay. And it says that you are board certified in anatomic pathology. What is anatomic pathology?
So pathology is a subject or specialty in medicine, basically a study of the disease. There are two broad categories. One is called anatomic and one is called clinical. Anatomic is for a layperson, it's basically a doctor who examines, say, surgeon cut off a tumor. And anatomic pathologists, usually surgical pathologists or other anatomic pathologists, they will make a diagnosis under microscope to determine if the tumor is benign or malignant, and then guide the surgeon or clinician to treat that disease accordingly. So that's called anatomic. The second category is called clinical. So clinical side is more like a lab. When we go to the hospital, we draw the blood and urine and body fluid, and the lab microbiology and other specialties is more like a clinical side.
Are you also board certified in forensic pathology by the American Board of Pathology?
Yes.
Can you tell the jury what that means?
So forensic pathology is one specialty or subspecialty under generally anatomic side. Basically, we're in charge of medical legal death investigation to determine the cause of death or manner of death of these cases or these patients.
Do you hold unrestricted medical license in Tennessee, Kansas, Ohio, and Texas?
Yes.
Can you tell the jury what that means?
So basically, I'm licensed by the individual state to practice medicine.
Okay, and up until recently, that included Mississippi.
Right, because I no longer go there, I said, I will not renew my license.
So you let yourself be retired from Mississippi, but you're still having to work here in Tennessee.
For now, yes.
Okay. Okay, have you taught at Vanderbilt University Medical Center in the Department of Pathology, Microbiology, and Immunology?
Yes.
Okay, now I want to ask you some questions about your employment history. Up until recently, you were the chief medical examiner in Nashville-Davidson County. What does it mean to be the chief medical examiner?
So as a chief, I oversee the operation of the entire office to see what is going on, how it's running, and basically a management position.
How do you become the chief medical examiner?
So there is a process. The mayor first appoint me as the chief medical examiner for Metropolitan Nashville Davidson County, and then City Council is like a legislative body. They have confirmed me on the appointment.
And before holding that top position in the Nashville-Davidson County Medical Examiner's Office, did you work as kind of a regular medical examiner in that office as well?
Right, I started with assistant medical examiner, associate medical examiner, senior associate medical examiner, and then the chief.
What is forensic medical?
So Forensic Medical is a private company who's contracted with Metropolitan Nashville and is in other county to perform the service to the counties.
And have you worked for Forensic Medical, and what positions did you have within Forensic Medical?
Right, before I retired, I was a CEO of the company since 2012.
Were you also a fellow in forensic pathology at the medical examiner's office in Philadelphia?
The forensic fellow, as I said, it's a training position, yes, as a fellowship training.
And that's where you did your training to become a medical examiner?
Yes,
Were you also a resident in Philadelphia?
yes, I did.
What does it mean to be a resident?
So basically, after you graduate from medical school, you have to pass some board examination and accepted by the program to do further training. You are not just a graduate from medical school and then do the work. You have to be trained, in the residency program and then move up to the fellowship training.
Next, I want to talk about some memberships that you have. Are you a member of the American Society of Clinical Pathologists?
American,
I'm sorry, are you a member of the National Association of Medical Examiners?
yes,
And also the American Academy of Forensic Sciences?
yes.
Okay, and just the jury's going along with your CV. Have you in the past been a member of the American Society of Clinical Pathologists and the College of American Pathologists.
Yes,
Have you written peer-reviewed articles which have been published?
yes.
Can you tell the jury what it means to be peer-reviewed?
So when you do the research and you want to submit it for publication, and before you can, publish these articles, somebody else in the field will review your work to see if there's a value, for example, new idea, new methods or so. And they decide if it is publishable. And these are made by peer review. And if they decide there's a value, they will recommend for publication.
Okay, and all of these publications that you have listed here, do they fall under that category?
Yes.
Over the course of your career, Dr. Lee, have you performed any autopsies?
Many autopsies.
Okay, and about approximately how many autopsies have you performed, if you can put a number on it?
I never counted individually, but I would say way above 5,000.
And have you ever testified in an expert in the field of forensic pathology where you were called upon to give testimony regarding cause and manner of death?
Many times.
Have you been tendered and accepted as an expert in the field of forensic pathology right here in Shelby County?
Yes,
And on few or many occasions?
few occasions.
Okay. Your Honor, at this time, I would tender Dr. Lee as an expert in the field of forensic pathology.
Any questions from the defense?
There you go.
All right, ladies and gentlemen, just as I allowed Dr. Marco Ross to testify and give his opinions as an expert in forensic pathology, I also find that Mr. Finn Lee is an expert. I'm going to allow him to give his opinions as well in forensic pathology.
So the jury, Dr. Lee, has already heard from Dr. Marco Ross, who also recently retired from the medical examiner's office in Shelby County. Are you familiar with him?
Yes,
Do you know him?
yes, personally, yes.
Do you respect him?
Yes,
And we heard him answer the question that he thought that you were an honest doctor. Do you also think he's an honest doctor?
definitely.
Okay. And have you been sitting here through his testimony when he testified in front of this jury?
Yes,
And can you tell the jury whether or not you agree with most everything that he said?
yes.
Okay, now I want to ask you some questions about this particular case. Back in August of last year, did you have an occasion where you met with Glenn Funk, Chantley Frazier, and myself to discuss the death of Mr. Gershun Freeman?
I remember the meeting, but I didn't remember what you call the exact date or month or so.
Okay, but you remember having the meeting?
Yes,
And did you agree to consult with us regarding this case where Dr. Marco Ross had already performed an autopsy and had already concluded the manner of death was homicide and the cause of death was atherosclerosis due to, or exacerbation of atherosclerosis due to subdual?
due to, there's a subdual and there's something else. There's a, what you call it, not struggle, but there's a word before the subdual.
Okay, did you, and you agreed to talk with us about that, where that autopsy had already been performed?
Yes,
And are you being compensated for your review of that case and for your time here with us for this trial?
yes,
Were you called upon to give your opinion as to the cause and manner of death?
yes,
Were you able to review the autopsy report which was prepared by Shelby County Medical Examiner Marco Ross?
yes, I did.
Did you review both the internal examination and the external examination?
I did review the entire autopsy report.
And I'm going to pause here for a second and ask you this question. Why is it important to do both an internal and external examination?
So the autopsy is a process or procedure of procedures, including examination of outside of the body, and to examine, document any injury, disease, any characteristic changes like tattoos or scars and other things. And then you examine internally, including the brain, chest organs, and abdominal organs. Again, to examine and document any injuries, any disease process.
Were you able to review the body diagram that was prepared by Dr. Ross?
Yes,
And the toxicology report that was affixed to the autopsy report?
yes,
Were you able to review the scene investigation report?
yes,
Were you able to review a video recording from the Shelby County Jail?
yes,
Were you able to review the photographs which were taken during the autopsy?
yes,
And did you also review an audio recording of an interview between other members of the district attorney's office in Nashville and Dr. Ross?
yes,
Can you tell the jury whether or not you found these materials to be sufficient to draw your own conclusion regarding the cause and manner of death of Mr. Gershun Freeman?
yes.
First, I have some questions about the external examination. But before I get to that, let me ask you this. Were you able to prepare a consultation report that you were able to give to the prosecutors now on the case in preparation for your eventual testimony for this matter?
Yes.
I'm passing up a document. Your Honor, may I approach the witness? Can you tell the jury what this is?
It is a copy of my consultation report on this case.
Your Honor, I would offer that as the next numbered exhibit.
Says the exhibit 19,
20.
excuse me, 20, that's right.
Oh, wait, no, I'm sorry, 19, no, no, no.
19? All right.
And Your Honor, I've made copies of the report. We pass those out to the jury.
Please, thank you.
While that's being passed out, Your Honor, may I display it on the
Yes,
PowerPoint?
ma'am, you may publish it to the jury.
Thank you, Your Honor. Sure, everybody's got one. Okay, did you agree, or were you able to compare the photographs taken during Mr. Freeman's autopsy to the diagram prepared by Dr. Ross?
Yes,
And did you find that diagram to be accurate?
yes,
Do you agree with his assessment that there was a laceration and multiple abrasions and hemorrhages on Mr. Freeman's body?
hemorrhages or contusions, yes.
And can you tell the jury what the difference between a contusion, an abrasion, and a hemorrhage is?
So these are mainly results of blunt force injuries. There are three categories usually. One is called a laceration, basically skin split. Abrasions, it's like a rubbing of skin onto the rough surfaces. Contusions, basically bruises.
Okay, and these you say were documented in photographs?
In photographs, yes.
Okay, and then also in the autopsy examination itself, and then also in the diagram?
Yes,
And right now, we're just talking about the outside of Mr. Freeman's body. Can you tell the jury whether or not the injuries that are seen on the outside of Mr. Freeman's body are consistent with the video that you watched from inside the Shelby County Jail where Mr. Freeman was hit, kicked, stomped, struck with hard objects like chemical agent cans and handcuffs?
yes,
Okay, now I want to ask you some questions about the internal examination. I know it sounds kind of like a silly question, but what is the difference between an internal examination and an external examination?
Again, external examination is outside of the body. Internal examination is when we open the body cavities, including the head, and examine all the internal organs, including the brain, chest organs, and abdominal organs.
I want to go kind of line by line on your consultation report and talk about the injuries that you saw internally. You said internal examination reveals patchy subscapular hemorrhage on the head and neck. What does that mean?
So basically, the hemorrhage under the skin of the head and the neck.
You also said that there are small abrasions on the anterior lateral chest wall with associated subcutaneous soft tissue hemorrhage. What does that mean?
Basically the same thing, there's an area of abrasion and associated with subcutaneous tissue, meaning under the skin. There's a soft tissue hemorrhage.
Okay. So there's some injuries that you can see on the outside and some that you can't see unless you look on the inside.
Right, you have to cut open of the skin, remove the skin to see it.
And can you tell the jury whether or not you agreed with what Dr. Ross said about there being hemorrhages that you could only see after you opened up the body?
Yes,
And here's one of them that you just testified about. Can you tell the jury whether or not there were any hemorrhages that were internal on Mr. Freeman's back?
yes. Again, patchy from here to here. It's not like a universal or just localized to one place.
Okay, so when you say patchy, what do you mean by that?
Meaning from place to place. It's not located in one place.
Okay, so kind of all over the place.
Patchy meaning here, there. It's not necessarily all over, but several areas.
And did you agree with what Dr. Ross said about there also being hemorrhages that you couldn't see until you opened up the body along the chest?
Yes.
You also said that there are healing scars on the left elbow, a focal abrasion on the left little finger, superficial cuts on the ulnar aspect of the left wrist, and focal subcutaneous hemorrhages associated with these cuts. Can you tell the jury what you meant by that?
So basically the same thing, abrasions and subcutaneous, meaning under the skin. There's a soft tissue hemorrhage associated with the abrasion and other trauma.
You said there are small abrasions and healing abrasions on the right upper extremity. What does that mean?
So abrasion, this rough of the skin, and healing, meaning in the process of heal, and not necessarily complete heal, on the right upper extremity, meaning basically right arm, including the hand.
Then you said that there are healing abrasions on the knees, right ankle, and left ankle.
Yes.
Can you tell us what you mean by that?
So basically the same thing, abrasions and healing abrasion on these areas.
Dr. Lee, can you tell the jury whether or not any of these injuries that you've described are consistent with heavy weight being placed on Mr. Freeman's back?
Will be consistent.
Can you tell the jury what you mean by that?
So not necessarily I can, say this is caused by some specific acts. But when you say this is what happened, I said it will be consistent.
So the injuries that you saw could have happened from a heavy weight being placed on his back.
Right,
Could have been caused by something else.
exactly.
Both are likely, or
Right.
both are a possibility.
Yes.
Now I just generally want to ask you some questions about the cardiovascular system. Were you in here when Dr. Ross testified about the cardiovascular system?
Yes,
And so that you're not repeating the same thing that he said, out of being careful about wasting the jury's time, do you basically agree with what he said about the cardiovascular system and how it works?
yes,
Do you agree with what he said about the coronary arteries?
Yes.
And how they function?
yes,
And were you able to hear him describe what atherosclerotic cardiovascular disease is?
yes.
I'm doing better at my pronunciation on that, I think. What do you think?
You did well.
Okay, it's hard. Were you able to hear about what he said about stenosis?
Yes,
And you basically agree with what he said about that
Ye-
description?
yes,
Were you able to hear him describe what it means when you have a stenosis? And he talked about there being a tube, and if you have a stenosis, a blockage would be part of that tube. Were you able to hear that?
yes,
Do you basically agree with what he said about
yes,
that?
yes.
Okay. Is there treatment for atherosclerotic cardiovascular disease?
Yes, as medicine or medical field advances in research, there are multiple measures or medications or other ways to treat these diseases.
Can it affect a person's ability to function?
In theory, yes.
If somebody has that disease, does it keep them from being able to function?
Disease itself, as Dr. Ross described, will affect the person's activity, but there's a treatment for that to some extent.
Does everybody react to that type of disease the same?
Differently.
Okay. Tell us what you mean by that.
So it all depends on the individual situation. For example, if you normal weight or heavy weight or overweight or obese, and the other comorbidity like other disease, like diabetes, like hypertension, and other natural disease will affect the person's outcome and with the same degree of disease.
And could some people have that disease and not know it themselves?
Absolutely.
Where it would not affect their own ability to function?
Just without knowing the disease, a lot of people, they can function normally.
I think I left a part out of the questions about what we saw. You also said that there are faint contusions on the upper back, small abrasions on the left shoulder and the right shoulder. There are faint contusions on the right posterior lateral chest wall. What is that?
So basically, faint meaning, you can see it, but not very clearly, and not as like a discrete type of thing. These are the contusions and abrasions on the areas that I described.
And then you said dissections of the back reveal scattered subcutaneous and deep muscular hemorrhage.
Right. Basically, you cut the skin, reflect the skin, and you can see the hemorrhage, the bleeding underneath the skin, in the muscle and in the subcutaneous tissue underneath the skin.
Okay, does subcutaneous just mean under the skin?
Under the skin and deep muscle.
And can you tell us what a deep muscular hemorrhage is and what that means?
So basically, there are several layers on the back, as a matter of fact, on all of the body. Skin, subcutaneous tissue, other tissue, and then muscle and other tissue. So there are layers of the tissues.
Is it easier to get a bruise that's just on the top of your skin or a deep muscular hemorrhage?
So basically, it varies from individual to individual, even as Dr. Ross explained to you, because some people are easy to be bruised, based on personal experience or your friends or family. And other people may be more resistant. And also, it depends on how deep it is. If it is superficial, it will show right away. If it is deep in the muscle, then it will have, time to show up.
On some deep muscular hemorrhages, would that be a more severe type of injury than a superficial one?
It probably, yes.
You go on to talk about significant internal examination revealing cardiomegaly with left ventricle hypertrophy and severe atherosclerotic coronary artery disease with the right coronary artery showing up to 80% stenosis. Is this in agreement with what Dr. Ross testified?
As a matter of fact, these are all description or findings by Dr. Ross, and I have no reason to doubt that, so I will just put it into the consultation report from Dr. Ross's autopsy report.
And then this last part here, about the post-mortem toxicologic studies indicating the presence of multiple substances in the blood or urine. Do you agree with Dr. Ross's assessment that there were some things in his blood, but nothing that would have affected his death?
Again, these are numbers from Dr. Ross's report.
Right. Now I want to switch gears and talk about asphyxia. Can you tell the jury what is asphyxia?
So asphyxia is characterized by inadequate oxygenation of tissue.
How do you get oxygenation, that word, of tissue?
So basically, oxygen would be present in the atmosphere, breathe in, exchange with the blood, and then transported throughout the body to the different organs.
And what are the different categories of asphyxia?
So generally, there are three general categories of asphyxia. One is called a suffocation, one is called a strangulation, and one is called a chemical asphyxia. So do you want me to,
Please.
give the jury the types of the suffocation? So suffocation basically means that oxygen cannot reach the blood by whatever mechanism. There are four types of the suffocation. The first one is called environmental. Basically means that there's no oxygen in the environment. Whether you breathe or not breathe, there's no availability of the oxygen. So the example usually the given is some kids play hide and seek, hiding inside the refrigerator. So the refrigerator closed, the environment in this small limited area will deprive the oxygen very quick. And this is the example of what we call environmental asphyxia. There's no oxygen available. Second category or type is called smothering. Basically, your nose, mouth is covered. There's no breathe in. There's no oxygen reach. So example will be somebody committed suicide by put a plastic bag on self and cover the mouth and the nose. There's no oxygen reach to the blood. Third category is called the choking. Choking basically means there's some object blocked the airways, whether it's in trachea, whether it's in bronchi. Therefore, it will prevent oxygen reaching to the blood. Example of these, like elderly population, when they eat, didn't chew well. For example, hot dog, you chew piece and then aspirate one piece and block the trachea. That's an example of the choking. And the fourth category is called mechanical asphyxia. Basically, when you have the pressure, the weight on the body, especially on the chest and the abdomen, you will prevent the expansion of the chest wall and the diaphragm, the other muscle, to breathe in the oxygen. And therefore, there's no oxygen reach the blood. Quick example, somebody worked under the car and suddenly the jack fell and the car on top of that person. That way, the heavy weight will prevent the person to expand the chest and abdomen, so there's no oxygen reach the blood.
Can mechanical asphyxiation also happen if there is pressure placed on the back?
Yes.
Can you tell the jury about that?
So especially when the person face down and heavy weight or pressure on the back, that will have the same effect to prevent the person from expansion of their chest and abdomen to breathe in the oxygen and then reach the lung and then reach the blood.
So how does oxygen come into our body?
By the breathing.
And if you don't get oxygen into your body, what happens to your body?
So that there's a mechanism. The most important consequences of lack of oxygen is the brain and other vital organs. And the brain is especially sensitive to lack of oxygen because the brain accounts for 2% of the body weight, but it will need 20% of the oxygen consumption. And it has a very limited reserve for oxygen and other nutrients. So it needs constant, nonstop, non-interrupted supply of the oxygen, the blood, and other nutrients to sustain its function. And it is very sensitive to the lack of oxygen for even very short period of time. If it suffers extended period of time, you will suffer what we call the irreversible brain damage.
So going on with that, what happens if your brain is deprived of receiving oxygen?
If it is for a short period of time, it will recover. But if it is long enough and past the point that it causes irreversible brain damage, then it will have very, very severe consequences up to the death. And if it revives, maybe a vegetative status.
Why does it cause irreversible brain damage all the way up to death? What is happening within the body to make that happen?
So basically, the brain, as I said, brain cells, they need a constant, non-interrupted supply of oxygen. If the oxygen supply is interrupted, the brain cells, they will die. And if the brain cell die enough, then the brain function will not sustain. And then it will, because the brain cell will not regenerate its status number. Although there's some new information saying potentially some new cells maybe, but it will not come back because the brain cell died and it will not come back, and the brain function is basically cannot be recovered.
If your brain function is not being able to be recovered, or if it's deficient for a period of time, what is your brain telling the rest of your body to do?
So the brain is a command center. It will generate a command through the brain. There are three parts, as Dr. Ross explained to you: the cerebral hemisphere, cerebellum, brainstem, and these are all very sensitive to the oxygen. And the brain, especially the brainstem, is a command center for respiration and the heartbeat. Basically, these are the command centers for the vital function. If the brain is dead, all the other functions usually follow and stop the function.
Does your brain tell your heart to beat?
Yes,
Does your brain tell your body to do other things?
to the breathing, heartbeat to a certain extent, but sometimes the heart can beat by itself, but it will have the center, command center in the brain.
So if you don't have oxygen to your brain and your brain is not telling your heart to beat, then what happens?
So everything is shut down. Heartbeat stops, breathing stops, and the body is completely dead.
And can you say more about what happens if your heart stops beating?
Yes, the basic function of the human body is this. Every organ system is connected. And a lot of the organs are vital, and you cannot live without heart function, lung function, kidney function, liver function, and so on. And the most important or most sensitive to the oxygen deprivation is the brain.
In this particular case, you said that you reviewed all the materials in this case, including that video. Were you able, after reviewing all of these materials, to come up with your own independent cause of death?
Yes.
Can you tell the jury about that?
So the cause of death is complications of mechanical asphyxia.
Can you tell the jury what it means, complications of mechanical asphyxia?
So mechanical asphyxia basically is an act, and it causes asphyxia. Then, as I described to you, the brain suffers irreversible damage, and then it will stop the heart, the breathing, as a result of mechanical asphyxia.
You go on in your cause of death in your report to say that a contributory cause of death is atherosclerotic cardiovascular disease. Can you tell the jury what you mean by that?
Right. On Dr. Ross's autopsy report, he found that the coronary arteries, especially one, it's the right coronary artery, had a severe atherosclerotic coronary artery disease, basically up to 80% occlusion. So I feel that this condition is severe enough to contribute to the cause of death.
And were you able to hear Dr. Ross talk about the 5 different categories for manner of death?
Yes.
And he excluded natural causes as the manner of death and chose to classify it as homicide. Do you agree with that?
I agree completely.
Why do you agree with that?
So if it is natural cause of death, manner of death, it has to be 100% natural. Like say this decedent had severe atherosclerotic coronary artery disease. If he died at home with the condition, without drugs on board, without any other outside influencer, then it is a complete natural death. Then we can classify it as natural. Anything else other than natural, we cannot classify it as a natural. For example, if the drugs, if significant drug involved, then we'll say maybe accidental. If it is a struggle, there's a fight, and then the person died. As a result of that, usually we'll classify it as homicide.
Dr. Ross's autopsy report found that the cause of death was subdual. Do you agree with that?
So I would say I agree with some of his assessment, but my opinion is more specific and not necessarily in lump sum of subdual, or there's another word on his report.
Yes.
Ross's autopsy report found that Mr. Freeman died as a result of exacerbation of heart disease due to altercation and subdual. Do you agree that Mr. Freeman died as a result of altercation and subdual?
I would agree with, in principle, with Dr. Ross's opinion because of that. But my opinion is more specific, you know, due to the mechanical asphyxia.
Does mechanical asphyxiation come under that category of altercation and subdual?
I would consider so.
Okay, can you tell the jury what you mean by that?
Because, you know, if they said the altercation, subdual, these are the tactic and what do you call the measures, and I would say that the mechanical asphyxia is part of that subdue, a struggle or altercation.
Now, Dr. Lee, I'm going to show you an excerpt of the use of force policy that's been offered into evidence in front of the jury. This has been offered into evidence. This is just a part.
Yeah.
Dr. Lee, I'm showing you what's already been entered into evidence as a portion of the use of force policy for the Shelby County Sheriff's Office. It says inmates may not be placed face down in a prone position while in restraints because of the possibility that they may be unable to breathe properly and asphyxiate. And then it goes on to say deprive a person of oxygen, usually leading to unconsciousness or death. Do you agree with their definition there of asphyxiate?
Asphyxiate, I agree with the description.
Okay, so they've defined it appropriately according to you.
Yes.
Okay. And when you say that the victim in this case, Mr. Gershun Freeman, died from asphyxiation, is this the definition of asphyxiate that you see here in the use of force policy?
It's very similar, yes.
Okay. Their use of force policy goes on to say if an inmate must be placed face down in a prone position, he or she must be observed continuously by security staff. Employees must exercise great caution when placing their body weight on an inmate in the face down position and must ensure that the inmate is able to breathe effectively. Can you tell the jury whether or not you think that is good medical advice?
It is a good policy, I would say,
Why is that a good policy?
because it's clearly say, you know, in order to avoid the situation we're facing right now, because of the consequences of potential unconsciousness and the death as a result of this prone position, plus the weight, plus the time, and risk of asphyxia. And in order to avoid that consequences or bad consequences, this is a good policy to follow.
The last sentence there says, once staff has gained control of and the inmate is compliant, the position must be changed as soon as possible. Do you think that that's a good advice?
Again, this is a good policy because if you really needed to restrain the inmate, even face down, even need to wait. You monitor it to make sure the patient or the victim underneath is still breathing. As soon as you accomplish your goal to restrain the inmate, you should turn the patient on the back, so, or in a sit position or stand position. Therefore, there's no restriction on the ability of the person to breathe and suffer the severe consequences up to unconsciousness and the death.
I'm showing you another section of the use of force policy that says employees are trained to use physical force such as control techniques, compliance holds, and/or chemical agents to achieve inmate compliance. In a situation where physical force must be used, employees are to use extreme caution when placing their body weight on an inmate, especially when holding them in the prone position, lying face down. Officers must be aware of the possibility that inmate may be unable to breathe properly, which may cause asphyxiation. Do you agree with that advice?
This is also a good policy. Basically just say, in order to do your job and avoid any risk or danger to the inmate, we have to do this, to follow this policy.
Now, we know that Mr. Freeman had a heart condition at the time that he was killed. Would his heart condition have had any bearing on his being asphyxiated?
So the conditions come with whoever the victim or the patient is. And it happens that he had a severe heart disease. It will not help him. It will make the situation worse in the scenario we'll discuss.
Can you tell the jury whether or not you agreed with Dr. Ross when he said that there was some evidence in Mr. Freeman's brain that showed that it was deprived of oxygen?
Yes, I agree.
You stated that part of your review of this case was looking at the fifth floor video from the Shelby County Jail. Were you able to see evidence of mechanical asphyxiation in that fifth floor video?
Yes.
Do you think that it would assist the jury if we showed them that fifth floor video so that you could point out what you're talking about?
If I don't know if they saw the video before or not, certainly it will help to understand.
Your Honor, may I play a portion of exhibit number? Exhibit 12.
Yes, ma'am. It's rather easy.
Sir, can I position the monitor in a way where all of the jurors can see it?
That's fine.
Just turn it this way,
For the record, we're talking about the big TV.
like it is.
Doctor, you can look at it up here on the wall. Yes, sir.
Position myself to make sure that
No, go right ahead. can't see it, please raise your hand and let them know.
We're starting at 4 minutes and 44 seconds for the record. I'm gonna pause here at 6 minutes and 12 seconds into the video. Have you seen anything up to this point that gives you concern about mechanical asphyxiation?
I saw one or two guards either put the legs, arms on the back of Mr. Freeman.
And what about that causes you to have concern already at this point in the video regarding mechanical asphyxiation?
So probably it is a start of the process. First of all, he was facing down, and the guards tried to restrain to put him under control by using the knee or knees or arm to do that.
You said the knees or arm. Can you tell the jury what you mean by that?
So knee, obviously the knee, arms, either the hand with the arm on that or the other part of the extremities.
And, okay, I'm gonna go ahead and play again, beginning at 6 minutes and 12 seconds. I'm pausing right here at 6 minutes and 31 seconds. Can you tell the jury if you're seeing anything here that is causing you concern regarding mechanical asphyxiation?
So again, maybe a knee, maybe an arm on the back of this Mr. Freeman.
Starting again at 6 minutes and 31 seconds. And again, I'm stopping at 7 minutes and 3 seconds. Are you seeing anything up to that point that causes you concern regarding mechanical asphyxiation?
So at that point, Ms. Freeman is still moving and trying to fight and still alive.
You testified before that you were concerned about it being the beginning of a process. What does that mean?
beginning process meaning, I mean, dying process, you mean. It's not there yet. It is still alive and still struggle and still try to fight.
Starting again at 7 minutes and 3 seconds. Pausing at 7 minutes and 14 seconds. Are you seeing anything that causes you concern?
So because he's still trying to fight, still trying to struggle, still trying to do something, I'm talking about Mr. Freeman. And the guards, they put the knee or knees or arm on the back of Mr. Freeman, try to prevent him from moving, struggle, and fight.
They're back up on.
All right.
I'm gonna back up for the record to 6 minutes and 19 seconds. Actually, I'm backing up for the record to 5 minutes and 33 seconds. All right, so can you see that Mr. Freeman has been handcuffed or is in the process of being handcuffed?
Yes,
And now he is handcuffed.
Check for bleeding.
After.
Please don't
he-
leave.
Yes, Your Honor. I lost where Your Honor was.
No, that's fine.
Yes, Your Honor. So after he is cuffed, can you tell the jury whether or not Mr. Freeman still is alive?
from this, I mean, it's still a frame, but if you play forward, yes, he was moving, he was struggling, he was trying to fight, yes.
Okay, wait, I want to stop there. What do you mean when you say he's trying to fight?
Basically, his head was moving around, and his arms or other parts are still moving, and it shows that he was still alive and tried to be alive.
Okay, so when you say fight, you're saying fighting to be alive?
Yes.
Okay. That's an important distinction to make in this case, whether or not he's fighting or fighting to breathe. Is he fighting to breathe?
Struggling, I would say struggling.
To breathe?
Yeah.
Okay. Is it easier when you're in the process of being mechanically asphyxiated to breathe if you roll over to a side?
So, the position is this, or the mechanism is this. If you put a pressure or weight on the chest and the abdomen for extended period of time, it will cause harm. But if you release the pressure, release the weight, and put him on the back, it will make his breathing easier, much easier.
And if a person who is being mechanically asphyxiated is moving around, could that try to give them relief from what's happening?
If, from that point on, if you remove the pressure, remove the weight, put him, say, on the normal position, face up, sitting, standing, then it will potentially relieve any risk from that point on.
And what I'm talking about, Dr. Lee, is the person who is actually on the ground being asphyxiated. If they move, could they be trying to move their body in order to breathe?
Right, exactly. Face down is more difficult to breathe, and they try to say, lift the head or lift the body, or at least with some room to breathe.
Starting again at 6 minutes and 22 seconds. I'm going to pause at 6 minutes and 57 seconds. We just saw Mr. Freeman's head move. Can you tell the jury whether or not that is consistent with a move to try to get a breath?
I would assume so, or consistent with.
And we'll start again at 6. Starting again at 6 minutes and 57 seconds. I'm gonna pause there at 7 minutes. What did we just see Mr. Freeman do?
He's still moving and trying to lift his head.
Okay, and what is that consistent with?
Probably just struggle to breathe or try to be alive or to survive.
We'll start again at 7 minutes. Okay, pausing right there. At 7 minutes and 8 seconds, what did we see Mr. Freeman doing there?
Again, he tried to lift his head up, body, and struggle and fight.
Fight.
Fight
Okay,
for
so
his
different.
life.
Okay, it means something different in this case. When you say fight, here you're saying fight for his life.
Oh, struggle, yeah.
Okay, and can you tell what his maneuver here is consistent with him trying to do?
So first the lift his,
Well, just a second. She said, can you see? And so if he can, he could say yes, and then she can ask a question.
What is that maneuver that he just did consistent with?
so from looking at it, it appears that he tried to lift his head and body up to breathe, to struggle, to breathe.
And we're starting again at 7 minutes and 8 seconds. And at 7 minutes and 17 seconds, he's back, not in a position where he's trying to get a breath. Is there something that concerns you here about mechanical asphyxiation?
So what I see is this. Other guards try to restrain him, put the knee or knees on the back of Mr. Freeman.
Dr. Lee, you already testified that you were concerned about mechanical asphyxiation before we see a guard put his knee on the back. Once there is more than one person applying pressure, does that make you more or less concerned?
I would say more concerned,
Can you tell the jury why that makes you more concerned?
because the more weight in different areas is more dangerous to limit his ability to breathe.
What evidence do you see from the video that leads you to believe that there is weight being placed on his chest and back area?
So basically, the knee, the arm, or arms or knees, they have weight, they have pressure on the body, on the back, and it will prevent Mr. Freeman from breathing by expanding his chest and abdomen, and it is very difficult to breathe in.
And if you can't breathe in, can oxygen get to your brain?
Right, that's like a basic mechanism of mechanical asphyxia. It limits or prevents the chest, the abdomen to expand. Therefore, there's no oxygen breathed in, and therefore the brain is lack of oxygen supply. Therefore, that's a result of a mechanical asphyxia.
We'll start again at 7 minutes and 17 seconds. And did anything happen that just caused you some concern, or have you noticed anything that just happened in that moment of the video?
So you can clearly see that one of the guard's knee on the back, and one of the arm of the another guard put the arm on the back.
Starting again from that moment. And I'm gonna pause at 7 minutes and 59 seconds. Can you tell the jury whether or not you just saw Mr. Freeman's head move again?
Can you play back?
Yes, we can back up 10 seconds.
Okay.
And we're gonna start playing at 7 minutes and 49 seconds.
Yeah, his head is still moving.
Okay, and when his head was moving, how many people do you see over top of him?
I would say at least two.
And you testified earlier that you're concerned, you said specifically the knee and arms. What are you concerned that the arms are doing?
So the same, it's like a mechanism, the weight, the pressure on the back to prevent the breathing or expansion of the chest and abdomen.
You're starting at 7 minutes and 54 seconds. Pausing at 8 minutes and 37 seconds. Mr. Freeman just slightly moved his head. Can you tell the jury what that's consistent with?
Probably still alive.
And do you have an opinion as to whether or not it's consistent with him trying to breathe?
Right. It's in the process of trying to fight for his survival.
We're starting at 8 minutes and 37 seconds.
I didn't clearly see that Mr. Freeman is still moving, but the knee was still on the top, on the back of the patient.
After the correctional officers have been on top of Mr. Freeman's body and he was struggling to breathe, did you ever see a moment where they permitted him to do that?
I don't see it.
Pausing right here. At 10 minutes and 55 seconds, what do you notice about Mr. Freeman's body?
So from that point, you can clearly see the guard's knee was lifted, walk away, and they tried to lift the body of Mr. Freeman. And you can see that his body is so limp, his head dangling, his shoulders dangling. It's basically a sign of life, no life on that.
And do you see the way that he is being pulled up from that position on the ground?
Right, they tried to lift him up
Okay. And how are they lifting him up?
by grabbing his arms
So are his arms behind his back?
behind his back.
Okay. And how are they pulling him up?
So you can see that one or two guards tried to lift him up by pulling the arms on the back.
As a medical doctor, can you tell the jury whether or not that would be painful?
If it for a normal person, should be,
Okay, why would that be painful?
because that based on the personal experience, your arms are lifted against your will, and then you might feel or suffer some pain.
We're starting again at 10 minutes and 55 seconds. From this point on in the video, Dr. Lee, do you ever see Mr. Freeman regain consciousness?
I don't think so, because his head was so weak and dangling. There's no muscle tone to the neck or muscle or other part of the body, and his body is basically free falling. It's not, if they let it go, he will fall to the ground.
And the way he's being pulled there by his arms in that same manner, is that pulling him up his full weight of his body by that part of his arms?
Yes,
Can you tell the jury how painful that might be?
could be painful.
Yes.
evidence in this video of Mr. Freeman reacting to what that extremely painful motion would cause him?
I don't see it.
And what does that tell you as a doctor, Dr. Lee?
He probably was, in the process of dying, or is already dead, and certainly is completely unconscious, and there's no tone, muscle tone, and no sign of life.
Starting again at 11 minutes and 13 seconds. Dr. Lee, at this point, if he was unconscious due to lack of oxygen to the brain and his heart stopping beating, how important would it be to begin CPR?
I would leave that to, Dr. Ross said, to the cardiologist, ER doctor, or whatever. But as a medical doctor, it would make sense that you will hand aid to the patient or to the victim right away as soon as possible.
The longer he is unconscious, what are the chances that he would be able to survive if CPR was started?
So the longer it waits, the less chance of surviving or less chance of recovery.
And since we were talking, I'm going to back this up just a little bit and start playing again from 11 minutes and 52 seconds. Due to my error, I'm going to back this up just a little bit. I was trying to pause it. I'm going to pause right there. Again, we see that movement pulling up on the arm. Do you see his body react in any way to that painful thing?
I don't see his body is completely a lack of muscle tone, and he couldn't held his head straight, and his muscle on shoulder fall. If nothing what you call lifted, he will his body will free fall to the ground.
Start again at 11 minutes and 58 seconds. Dr. Lee, can you tell us what you just noticed there?
It shows to me it's like without a sign of life. He's completely limp, and there's lack of muscle tone, and he basically falls if nothing, hold on to his body.
Do you see anything at this point in the video where anybody has tried to give him life-saving care?
I don't see it.
Have you seen any life-saving care?
I don't see it.
I'm gonna pause here at 16 minutes and 20 seconds and ask you a couple more questions. After having watched the video and paused several times, can you summarize for the jury why you came to the conclusion that Mr. Freeman died from mechanical asphyxia?
As I described to you, the mechanism of the mechanical asphyxia is basically prevent the expansion of the chest and abdomen from expansion, therefore to breathe in, if there's a weight or pressure on the back, when Mr. Freeman was facing down, it will certainly prevent that. Exactly the same mechanism that he couldn't expand his chest. So therefore, there was no breathing, and for I'll say a few minutes, and that is the mechanism, and that's what exactly happened here.
Dr. Lee, is there a general rule about how long somebody can go without breathing in and supplying oxygen to the body before it causes irreversible damage?
So there's no clear cut as to say 1 minute, 2 minutes, 5, 4 minutes. It is usually a consensus that few minutes, it will vary from one person to another, all depends on the other conditions. For example, Mr. Freeman has heart disease. It will not help him. It will reduce his ability to survive with that same condition. And that the time for him probably will be shorter because he will suffer more damage because of the other condition, his bad heart. And other conditions the same, whether it's, have like a drug on board or other disease, heart disease, hypertension, coronary artery disease, and so on. It varies from individual to individual, and there's no clear cut as to exact how many minutes is needed. But I'll say this, the longer, the worse.
We've used the term a couple of times, irreversible damage. What do you mean by that?
So basically, as I described to you, the brain is so sensitive to the blood and oxygen supply, non-stop, non-interrupted, continuous. If for some reason it is cut off, there's no blood, no oxygen supply to the brain, few seconds will be okay because a little bit in reserve. After a few seconds, the brain started suffering. And first few neurons die. The longer it takes, the more dangerous to the brain. So more damage to the brain. To a certain point, after that point on, the brain is suffering so much, it will not come back. It will not recover. That's called irreversible. Cannot be returned. They cannot be reversed.
Can somebody's body move when they are not conscious?
It depends, some terminal twisting, terminal moving, it is not uncommon.
By the time Mr. Freeman's body went limp, as we just saw in the video, do you have an opinion regarding whether or not he is conscious?
More likely than not, he was unconscious.
And if he is still being deprived of oxygen even after he has lost consciousness, can you tell the jury what that does to the body?
Can you ask the question again, because it?
Yes, and actually, I think it might help if we were looking at.
Yeah,
each other.
exactly, lose conscious, lose concentration.
Thank you. If Mr. Freeman's body was still being deprived of oxygen even after he lost consciousness, can you tell the jury what that would do to the body?
Yeah, if time goes on, the longer, the worse situation for him.
You have said to the jury this phrase a couple of times, in the process of dying. Can you tell the jury what you mean by being in the process of dying?
Sometimes the death is not like a switch on and off. It has like a process. It takes a little time, and it's not like we can flip on, off, dead, not dead. There's a process. So it's a process of dying. He is dying, and eventually he's dead, and after a certain period of time, and he's dead.
What is happening during that process of time when he's going from being alive to being in the process of death and then until dying? What is happening to the body during those moments?
So basically, if there's no help, the process is going forward. It will not come back. Maybe it depends on the condition and the underlying situation. For example, if he is lack of oxygen because of deprived of oxygen, give him the oxygen may help him, and the CPR might help him, and some other situation might help.
Did you hear in Dr. Ross's testimony that the reason he didn't believe that Mr. Freeman died of mechanical asphyxiation is because somebody in a medical record mentioned that they detected a faint femoral beat?
So faint
Pulse, I think
femoral pulse, basically on the groin area, you can feel if there's any pulse. And I would not be surprised, you can feel faint meaning it's not normal or regular, maybe very, very weak. It means like weak or faint pulse. And to me, this is a terminal event. And after he was deprived of oxygen, his brain suffered irreversible damage, and he's in the process of dying. And therefore, his heart was not beating as regularly. His heart would not pump normal, and would not beat normal, and there's no regular or normal pulse can be felt.
So if a person is in the process of dying, is it possible to detect a faint femoral pulse?
It depends on the condition, and sometimes I will not be surprised to see, probably you can still feel.
Dr. Ross also mentioned somebody saw the eyes flutter or something like that. That is mentioned in a medical record by somebody. Were you able to look at those medical records from the jail which noted that?
I did.
And can you tell the jury what you think about that?
So, first of all, it was a chaotic situation. I don't know whether they really saw Mr. Freeman had some flooding of the eyes or just a twisting of eyes in a terminal event. I don't know. I cannot speak for them. But I would not be surprised. Sometimes even in the process of dying, some people still had terminal involuntary movement of their body parts, like finger twisting, eye twisting, or something like that. But it doesn't mean that he's still alive, or it means that he's not dead.
Is it possible for somebody to have already passed away, somebody to already be dead and have a flutter of the eye?
Not necessarily flutter of eyes, but a twisting or terminal twisting of some muscle. That I would not be surprised.
As a medical examiner, do you sometimes have to consider medical records when you're determining a cause of death?
Right. As a medical examiner, we are doing our job like any other physician doing your job. You have to have information as much as possible, and just like you ask a patient what is going on, and gather information. The information is important for us to make a decision.
And like Dr. Ross was asked the same question, do you ever do any independent investigation to determine who made that comment or whether or not it was accurate or anything like that?
No.
Have there been times where sometimes medical records are not exactly accurate?
I would not be surprised.
Did you have an opportunity to look at the WellPath records in this particular case?
Yes, briefly.
And when we say WellPath, is that the health company that supplies the jail? WellPath meaning the person who made these records, the company that made these records.
Right.
Please don't leave it, son.
I'm going to pass this record up to you, and can you tell the jury whether or not this is the medical record that Dr. Ross would have been referring to? can turn the page if you need to.
Yes, I've already was supplied with this documentation.
Is there something in that medical record that you know not to be true based on your viewing of the video?
I will not be able to say that, but some of them, it says, the record says, security staff stated patient took a big can of chemical spray and began spraying staff.
Did you see that in the video?
I didn't particularly see that.
Is that the same medical record that on the next page talks about there being a faint femoral pulse?
Yes.
Okay, I can have that back. Can you tell the jury whether or not the heart has an electrical rhythm?
Yes.
What does that mean?
So basically, there's a special group of cells in the heart. They generate the electric signal and then transmit it to the muscle. So it basically commands the muscle to beat, to contract. And the heart is a pump to pump the blood out.
And is there a mechanism that is sometimes used to be able to determine whether or not somebody's heart still has an electrical rhythm?
Yes.
And can you tell the jury what that is?
So EKG, will be used to monitor the heartbeat or the electric activity.
In this particular case, do you know what mechanism was used?
I would say they used AED.
Okay, AED pads?
AED, they put the pad on the body.
And what would an AED pad be able to detect?
So first of all, it will, receive the signal if there's any electric signal. And then you will make decision whether AED will be used to shock the patient.
And I think I took this back before I should have. Did the medical records state whether or not, may I pass this up to the witness, Your Honor?
Yes, ma'am.
Did the medical records state whether or not the AED pads were actually placed on Mr. Freeman's body?
Yes, AED was placed.
And when the AED pads were placed on Mr. Freeman's body, was it ever able to detect a electrical rhythm?
So basically, it says AED advised no shock. And there's no shock rhythm, and so the AED was not even used or shocked to shock the patient.
And we'll back up and talk about that in just a minute, but just from the records, did they ever indicate that they found an electrical rhythm in Mr. Freeman's heart?
It basically said it advised no shock, and no pulse palpitated, and the CPR initiated.
Okay, so even though in those records it says somebody said they felt a femoral pulse, when the AED pads were used, was there ever a pulse indicated?
Probably not.
Okay, well, look at the records and say whether it was or not.
It says AED was placed, no pulse palpitated, CPR initiated, and AED advised no shock, CPR continued.
And then it checked again.
Check it again.
Did it ever
No
detect
shock
pulse?
advised, and CPR continued. Check it again, and then did some IV and other life-saving measures. No shock advised, and CPR continued. CPR continues. No shock advised, basically. So there is a shockable rhythm. Usually included two, most common one is called VFib, ventricular fibrillation. That's one thing called the VFib. The other thing is pulseless VTach, ventricular tachycardia.
Do you need a glass of water?
It's okay.
Okay.
So I can finish talking. So these are the two shockable rhythms and advice to shock. But the other unshockable, non-shockable rhythm includes assistedly. Basically, there's a flat line, there's no electrical activity or contraction, and there's another one called PEA, pulseless electrical activity. And these are non-shockable. So in this condition, in this situation, there was no shockable rhythm detected. So AED was not used, and they started the CPR.
Okay, for a defibrillator or an AED, if there was a detectable pulse or a detectable rhythm, would it have recommended a shock?
Again, depends on the, the wave, the rhythms. There are two, rhythm, as I said. If these are the rhythms, they will advise the shock.
And was a shock ever indicated by the AED pads in this case?
No, they checked again, after CPR, check it again, no shockable rhythm
What does
detected.
that tell you?
That's completely flat, and this is already, the patient is already dead.
You mentioned the word asystole.
Assistedly, yeah.
Asystole.
Yeah.
Can you tell the jury what that means?
So basically, assistedly, it's like a word without the electrical activity, without the contraction or mechanical activity. Basically, there's no contraction of the heart.
So it's a flat line.
Right.
Okay. So once a heart is asystole, what is the only way to try to restart the heart?
Usually, they will do CPR on the
Okay.
patient.
Can you tell the jury what CPR is?
CPR is called the pulmonary resuscitation. Basically, do the compression of the chest, and sometimes, although it's not advised to do the like a mouth to mouth breathing type of thing.
All right. The jury instructions in this case will say the defendant's conduct need not be the sole or immediate cause of death. There can be more than one cause of death. Do you agree with that?
I agree with this legal definition, yes.
And again, you went to law school after you went to medical school.
Your Honor, may we approach?
Yes.
Dr. Lee, can there be more than one cause of death?
It is very common, especially in clinical setting, yes.
Can you tell the jury what you mean by that?
So cause of death is defined as disease or injury leading to the eventual death of the patient. And either disease or injury. And sometimes there are more than one disease, and sometimes more than one possibility of how there's the cause of death.
Are you familiar with the definition of proximate cause?
Yes.
And I've got that definition. Can you?
Well, I think, I'll give the jury the definition. Yes, ma'am.
Do you have an opinion as to whether or not mechanical asphyxiation was the proximate cause of death?
And that's, he can give a legal opinion, you can give a medical opinion, doctor, but not a legal opinion.
Exactly. So the cause of death, in my opinion, is complications of mechanical asphyxia.
Your Honor, those are my questions.
All right, let's take a 5-minute break for the jury, and we'll be back with you on a few minutes.
for the jury, Your Honor.
Yes, sir.
Jury's entering the courtroom. Your Honor, all jurors are present.
All right. Let me cross this in.
Dr. Lee, I want to talk to you about your role as the state's expert, okay?
Yes,
We're all lawyers, right? None of us are doctors, right?
yes,
So we consult with experts in any given field because we're doing the best we can to understand these very complicated medical issues, right?
yes,
And in this case, Dr. Ross is the one who performed the autopsy.
yes,
And all of the lawyers conferred with him, right?
yes,
To understand the very complex medical situation.
yes.
So now I want to talk to you kind of about the timeline with your role, okay?
Okay,
This was a death that occurred on October the 5th of 2022.
yes,
And that autopsy by Dr. Ross was done on October the 6th of 2022.
yes.
When did the DA's office reach out to you regarding the consult?
Again, I couldn't remember the exact date, and whatever the record showed, I agree with that.
Would that be August the 4th of 2025?
Again, I don't exactly remember the exact date, but I will not be against the date.
Your Honor, may I approach the
Yes,
witness
ma'am.
with the transcript? Dr. Lee, if you'll look at page 42 of that transcript from October the 13th, I'm sorry, April the 13th. Lines 23 through the first line of the next page. Oh, I'm sorry. Page 32, I apologize. Lines 22 through 25.
Right.
Does that reference August the 4th of 2025?
It says just August 4th meeting. Yes, sometime after the August 4th meeting.
And you would agree that that meeting occurred in 2025?
Yes.
Okay. You can keep that up there with you, Doctor.
Okay.
And at that meeting in August of 2025, you were given the autopsy report,
Yes.
you were given the toxicology,
Yes.
you were given the video,
Yes.
you were given the body diagram.
Yes.
You were given the scene investigation report.
Yes.
You were not given any discovery.
No.
You were not given any witness statements.
No.
You were not given any medical records.
No.
At the meeting that you had, the prosecutors discussed the facts of this case with you.
Yes.
They watched the video with you.
Yes.
They told you that these men had already been charged,
That I don't remember exactly.
okay? If they were consulting you to testify at a trial,
Right.
does that indicate that charges have already been filed?
Probably.
Okay? And they discussed trial dates with you.
That I couldn't recall.
Okay. They did not meet with you in your regular capacity as a medical examiner for Davidson County.
I don't understand what the question about.
Okay, so if a normal meeting with the medical examiner
right?
would be the prosecutors meeting with the chief medical examiner or other medical examiner that conducted the autopsy normally, right?
But, I was consulted from time to time for my role in other cases. It will not be, what do you call it, uncommon.
My question though was, normally, when prosecutors meet with the medical examiners, they're meeting with the medical examiners who conducted the autopsy.
Yes,
They met with you for a second opinion,
yes,
and you knew that.
yes.
And you knew what Dr. Ross's findings were.
I couldn't remember exactly, but I would assume so, yes,
Well, and they gave you the autopsy
Yes.
report. So you knew what his findings were,
yes,
and you knew that they wanted a second opinion.
yes.
Do you know if any other medical examiners other than you were contacted?
I don't know.
Now, they spoke with you in the role as a consultant, right?
Yes,
So that's not your role as the medical examiner, that's your role with, you said you were the CEO for Forensic Medical Management Services?
right.
So that would be more in that capacity.
As well as the chief medical examiner for Metropolitan Nashville in Davidson County, yes.
Okay, well, when you testify as the chief medical examiner for Davidson County, in Davidson County, do you get paid extra to do that?
No, I don't get paid for that capacity, no.
Okay, but here, you're getting paid $500 an hour.
Yes,
And that's by the DA's office.
yes,
Even though normally when you testify in your normal capacity as a medical examiner, that $500 an hour is nothing.
no,
And these are prosecutors that you have worked with for a very long time.
yes,
You told the jury, well, you are here to testify on their behalf, right?
yes,
Yes.
yes.
And we talked about the items that you were provided. Did you receive any additional items at any point?
Yeah, maybe over the time, even during this, meeting, yes.
During this meeting, do you mean while you're testifying?
No, I mean, during I'm here in Memphis, yes,
This time?
yes.
Since you've been here this time,
Yeah.
you've received additional information?
Oh, last time, yeah.
Okay. Have you reviewed all of the information that you were provided?
If I'm provided with the material, yes, I'll always review them.
And when did you issue your report?
That exactly date, you can give to me because I don't have the report in front of me.
If I may approach the witness, Your Honor, with Exhibit 19? When did you sign your report?
I didn't have, it didn't have my signature and the date on it.
If you look at the very bottom, sir,
This is like August 7, 2025.
August 7th of 2025?
Maybe this is transcribed. I don't know whether it's, I signed exactly the same day or not, because I don't have that signature and time on the report.
Is it fair to say that that report would not have been generated after August 7th of 2025?
That I cannot say.
Well, if it says August 7th of 2025.
Right, because
Is it
August,
fair to say that that was not generated after that date? It would have been either on August 7th or before?
that I will not be able to say, because sometimes the report was transcribed on August 7th. I will sign maybe 2 days later, 3 days later, I don't know.
Okay. If it was transcribed on August the 7th of
Right.
2025.
Right,
You would have had those findings on August the 7th of 2025.
probably. Yes.
May I approach with your honor?
Yes.
And that was only 3 days after you met with the DA's office?
No, I mean, this is not the only meeting. Again, before that meeting, we have another meeting or two. I didn't say, or nobody asked me about it. But that meeting was, I was asked, you said that meeting, but there was maybe more than one meeting, or two. I couldn't remember exactly.
You indicated on August 4th that you received the autopsy report and all of those things, and that this report was transcribed on August the 7th of 2025, right?
Right, so the meeting, maybe that's the last meeting, or there are more than one meeting. I think there's more than one meeting.
Okay. Now, what I asked you though was whether you received all of those items at that meeting on August the 4th, and that's when you were given the autopsy report.
That is maybe the last meeting, or one of the last meetings. But I was provided the material through the course of that several meetings. Yes.
Were you receiving information from the prosecutors about the case during those meetings?
Yes.
You still have that transcript up there. If you look at page 32
Okay.
and start earlier up on that page at line 2.
Okay.
And just read that page and let me know, I'm sorry, if you actually want to back up to page 31 at line 23. That would probably help. On August 4th of 2025, did you meet with me to discuss the autopsy of Gershun Freeman in the case? And then later down, at that meeting, you were provided a copy of the autopsy in this case.
Right.
So you would have been provided the autopsy on August the 4th of 2025.
Right.
Now, in this case, you did not conduct the autopsy.
No.
Dr. Ross did.
Yes.
You received the photographs that Dr. Ross took.
Yes.
You did not personally view the body.
No.
You could not view it in its totality for that reason.
Right.
You could not review anything that was not documented.
No.
You could not review anything that was not provided to you.
No.
But you did have the autopsy report.
Right.
And that was done by Marco Ross,
Right.
the chief medical examiner for Shelby County,
Yes.
close in time to the autopsy itself.
Right.
You were able to review his body diagrams,
Yes.
the toxicology reports,
Yes.
the video.
Yes.
Did you review the microscopic slides?
No.
Did you note that he had microscopic findings?
Yes.
You were able to review the audio recording of Dr. Ross's meetings with the prosecutors and the TBI.
Yes.
Dr. Ross had a cause of death listed as exacerbation of atherosclerotic cardiovascular disease due to physical altercation and subdual.
Yes.
Did you receive, with a contributing factor of possible psychosis?
Right.
Now, you did not address any psychosis in your report.
Right.
Did you receive any medical records, clinical history about a history of psychosis?
According to Dr. Ross's report, yes.
Okay. Did you receive any medical records or clinical records of a history of psychosis?
I don't think so.
Did you receive any medical records for the clinical history regarding his stabbing?
According to Dr. Ross's report, yes.
Did you independently receive any of that
No.
information? Did you receive any information about 201 Poplar?
The jail itself?
Yes.
That's the only thing I reviewed was the video.
Okay. Did you, at the time that you were making your assessment, know what 4J was?
No.
Do you now know what 4J is in the genome?
Maybe that the cell he was in.
And do you know what that pod is for?
It's I was for the either suicide watch or what do you call this, psychiatric or some like mental illness.
Did you have that information at the time you made your determinations?
Probably not.
Okay. Now, when you watched the video, is it fair to say that every single moment may not have been captured by all of the different video angles?
I would agree. So
Now, I want to talk to you about your conclusions in this case. okay?
yes,
First, the manner of death. You found this to be a homicide.
yes,
And that is a different determination than the legal determination, right?
the manner of death has what you call the implication or useful for several areas. One is vital statistics. One is for public information, public health monitoring stuff. And one is also used for maybe insurance company. And the other one is obviously useful for the legal and criminal aspect because it has some implication. And whether it is prosecuted or not, it will be determined by the district attorney's office.
But the medical term of homicide does not indicate criminality.
Right.
The medical term of homicide is completely separate and distinct from the legal definition of homicide.
I would say so, yes.
Nothing about the medical term of homicide indicates a person's intent.
Right.
A justifiable homicide looks the same as an unjustifiable homicide in an autopsy.
Right. It will be determined by the district attorney's office and the court, yes.
Or by a jury.
Or by the court, yes, the jury, yes, including the jury.
And someone who passed as a result of self-defense, that would be a homicide.
Right.
Someone who passed as a result of a person defending themselves or the people they love, that would be a homicide.
Yes,
A hunting accident would be a homicide.
yes.
Now, you are not making a finding of intent, you are making a medical finding.
Right.
And that medical finding is for epidemiological purposes.
One of them, yeah, is for the epidemiology.
And you would agree with me that it is unusual for a medical examiner to include in an autopsy that homicide is purely for epidemiological purposes and not to indicate criminal intent.
Right, I have never used that phrase in my report.
But Dr. Ross used it here.
Yes, I noticed that.
And your report says that the manner of death is consistent with homicide.
Yes,
But your cause of death is different than Dr. Ross's.
I would say not that completely different. I would say my cause of death is more specific.
In your report,
Yes,
you indicated that pre-existing medical conditions, specifically arteriosclerotic cardiovascular disease in the present case, might have contributed to the eventual death.
right. So that's exactly what I say, contributing cause of death is atherosclerotic cardiovascular disease.
Whereas Dr. Ross said, this is what caused his death.
His cause of death is more like exacerbation of the cardiac condition due to the altercation and the subdual. So my cause of death is more specific, just not that like everything together, subdual, struggle, or altercation. My cause of death is more like due to the mechanical asphyxia. Maybe this is a part of the subdual. I don't know.
You don't know if the mechanical asphyxia was part of the subdual?
I don't know. I mean, that he in his mind maybe, but in my mind it is more specific.
in your report, you don't mention the aortic arteriosclerosis.
I said atherosclerotic cardiovascular disease. It includes all the vessels, including the aorta, including the, the brain, the vessel too.
Okay, so you didn't address them specifically, you addressed the heart conditions more generally.
It is cardiovascular disease, atherosclerotic cardiovascular disease, yes.
But you found mechanical asphyxia due to weight of knees or hands or arms on a back.
As I said to you, the elements of the mechanical asphyxia is this. The weight, the pressure on the torso, especially the back, sometimes the chest, the abdomen, to prevent, if it is long enough, to prevent them from breathing, from expansion of the chest, and if it's long enough to cause the, serious consequences.
You agreed with Dr. Ross's assessment of the severity of Mr. Freeman's cardiovascular system.
Yes,
Now, I want to talk to you about the evidence that is in the autopsy report, okay?
yes,
There's evidence that supports Dr. Ross's opinion that Mr. Freeman died due to severe heart disease.
so this is contributed, in my opinion, if without the mechanical asphyxia, I don't know whether he is still alive or not.
My question was, there's evidence to support Dr. Ross's opinion that Mr. Freeman died due to severe heart disease.
In my opinion, it is the part of the cause of death, it's contributing cause of death, severe enough to contribute it.
My question
Yes,
was, is there evidence in the autopsy to support the finding that Mr. Freeman died due to severe heart disease?
again, it is not exactly due to heart disease, because there's a,
Doctor, I'm sorry, I'm not asking for your interpretation, I'm asking a
Judge, I'm
direct
asking,
question.
the witness can answer the question.
Let him answer the question his way, then you can define it if you wish. You can shrink it down. It's a good question.
right, because the cause of death generated by Dr. Ross is this: exacerbation of the heart disease due to. The due to part is very important. If there's no due to, it will be a natural death. It is completely heart death. It is a natural death without anything else. It will not be homicide. Because of due to, it is classified as homicide. And due to what do you call the altercation and subdue, that condition in itself is most important in this opinion. And my opinion is more specific because I review the autopsy report, review the video, and I explain to you on the video, you can see it because of the weight and the pressure on the back that prevented Mr. Freeman from breathing, from expansion of his chest. If it is long enough, it causes the consequence resulting in his death. That's exactly what my opinion is.
Present in Dr. Ross's autopsy, there is arteriosclerotic cardiovascular disease.
Yes, agreed.
It was severe.
Yes,
It was severe enough to cause his death.
yes,
There was coronary arteriosclerosis.
yes,
There was aortic arteriosclerosis.
yes,
There was cerebrovascular arteriosclerosis.
yes.
There was left ventricle hypertrophy of the heart.
Hypertrophy, yes.
Thank you. There was thickening of the mitral valve.
Slightly, it's not like a severe.
There was thickening of the mitral valve.
Yes,
There was small foci, perivascular, and interstitial fibrosis
yes,
present.
yes,
There was physical exertion viewed in the video.
Right.
There was possible psychosis.
That it is based on the finding and based on the his report, yes.
And all of those things supported Dr. Ross's position that Mr. Freeman died of the the exacerbation of the arteriosclerotic cardiovascular disease.
All right. So talk about the psychosis. I want to make a little bit comment because I didn't include the psychosis itself as a cause of death. Because psychosis is a mental condition or state, not necessarily a disease. Just like you say, I have chest pain. I don't want to put the chest pain as a cause of death because chest pain is caused by something else. Same as psychosis. Psychosis might be a result of psychotic disease, like schizophrenia and bipolar, or maybe by drug on board. A lot of drugs can cause psychosis, and maybe alcohol, and some other situation too. So I would not, that's why I didn't include psychosis as a cause of death or contributing cause of death, because psychosis itself is a state of a mental state. And again, I would not agree with this, just say this is a hard death without qualification. Because if it is the, the atherosclerotic cardiovascular disease, as I said, it is a natural death. It cannot be classified as a homicide because it's most important here, due to the physical altercation and subdual. And in my opinion, after I reviewed that, it is more specific because you can see if I explain to you because of the knees, because of the weight, because of the arm, because of the pressure on the back, that's important because it prevented Mr. Freeman from breathing in and would not expand his chest because of the weight and pressure on his back when he was facing down. That's the most important thing, not just a heart disease. If it is a heart disease without a qualified phrase, it is a natural death. It will not be homicide.
So you said it has to be 100% natural
Exactly.
in order to be deemed a natural death.
Exactly.
So if there is some sort of altercation involved, whether it is the fault or not,
Right.
that would be deemed a homicide.
If it is not 100% of natural, you cannot call this natural. Anything above or anything other than natural, for example, drug on board, struggling, fighting, and heavy weight on the back, pressure on the back, that would be different.
So when Mr. Freeman rushed out of his cell and attacked these officers, engaging in physical activity that caused an increased demand on his heart, that's why this is a homicide, because of that altercation, because of him struggling during the subdual.
Right, if that's the only thing, if that they fought each other, struggling, and then there's no other things, for example, no face down, trying to restrain him, no pressure on his back, that would be a very different situation. And you can tell the difference.
How much weight is required to cause asphyxia?
So again, there's no exact weight required, but it is sufficient to prevent him from breathing, from expansion, from his expanding his chest cavity or, to breathe in. But nobody will say how many pounds and exactly how many pounds is required. I don't know.
And you can't say how many pounds were actually placed.
Right.
Or
I cannot tell. Right.
So you can't say whether the amount of pressure placed equals that amount sufficient to create an asphyxial event.
Right. So from viewing the video, you can tell that the weight, the pressure, whether it's a knee, whether it's an arm or whatever, is sufficient or was sufficient to prevent him from breathing, from the expansion of the chest wall and result in death.
I want to talk to you about evidence of asphyxia that can appear in an autopsy, okay?
Yes,
Petechia,
right.
was that here?
No.
Cyanosis,
A lot of times we don't even describe the cyanosis or not. Usually, when the person is alive, you can more clearly say. After a person died, usually I will not describe. But petechial hemorrhages there means something. If not there, didn't exclude.
was cyanosis present?
I don't know. I don't remember. Probably not.
Was there excessive facial swelling present?
I don't remember seeing that.
That could indicate asphyxia.
You know, again, if it is there, it will mean something. If it's not there, you will not say exclude the possibility of asphyxia.
So it not being there does not exclude the possibility,
Right,
but it being there could support the assertion.
maybe.
Okay, and those things were not here.
But these are non-specific. These are the things we don't say, if there, it has to be this. If not there, it has not be this. It's just a finding or, observation, mechanism, but not necessarily tell me whether this patient died as a result of this or not.
Was there, excessive congestion of the head can indicate asphyxia.
Again, this is non-specific. It's there may mean something, may mean nothing. But if it is not there, again, it is non-specific.
My question was, though, excessive congestion of the head can support a finding of asphyxia,
I would say maybe.
and that was not here.
I probably don't know. But usually I would not describe that in my report.
If there was excessive congestion of the upper body, that would support a finding of asphyxia.
Again, that's non-specific. There or not there didn't mean too much.
My question, though, was, does excessive congestion of the upper body support a finding of asphyxia?
I would say maybe.
And that was not present here.
I don't remember that, seeing that.
Specific neck structure damage can support a finding of asphyxia.
Depends on the mechanism. In this situation, neck has nothing to do with it because the weight is on his back and on his torso, and the neck has nothing to do with that in the picture.
Which is why rib fractures can support a finding of asphyxia.
Again, it will say maybe, because if it is there, may indicate that there is some damage, but what caused the damage or caused the rib fracture, we don't know. Maybe due to CPR, maybe due to excessive force, maybe due to excessive pressure. But it is there means something. If it's not there, it didn't mean nothing.
There were no rib fractures.
No.
And rib fractures can result from excessive weight being placed on the rib cage.
Right.
There were no findings in the autopsy to support your finding of mechanical asphyxia.
Right. So I will tell you also, in the asphyxia condition, as I described to you, suffocation, right? If it is smothering, say plastic bag on the top of the head, or close, or if somebody put a pillow on an elderly person or child, after they remove the plastic bag, remove the pillow, there's nothing left behind for me to see or for anybody to see, because there's no autopsy findings if I don't have the information. Somebody put a plastic bag and a family member took it away before medical examiner's office, investigator, or police arrived to see it. Same situation with the mechanical asphyxia. Mechanical asphyxia, a lot of times you probably would not see specific trauma to the body. If it is there, may mean something. If it's not there, it's not saying, okay, it is not due to mechanical asphyxia. That's why viewing the video is so important, so crucial. If I don't have the video, I will not be able to say this is a mechanical asphyxia because there's no diagnostic sign to say because of this present, this patient died as a result of mechanical asphyxia. If I don't have the video surveillance, video footage, I will not be able to say this is due to the mechanical asphyxia. Because of the video, plus the autopsy report, plus the other investigation note, plus the other information I get, together, I reach the conclusion. The cause of death is due to the complications of mechanical asphyxia. You can see the weight, the pressure on the back of Mr. Freeman for extended period of time. And that's the result of he is dead. That's why I said this is a mechanical asphyxia. Although I don't have any specific autopsy findings correlated with the cause of death.
Now, Dr. Ross found that the cause of death was that exacerbation of the atherosclerotic cardiovascular disease, which still resulted in death, right? He died in both of those circumstances.
Due to, that's important, physical altercation and the subdue. So my opinion is a little bit more specific. It is due to the mechanical asphyxia by reviewing the video, and you can see it.
Is it fair to say that in both your cause of death and in Dr. Ross's cause of death resulted?
Yes.
Is Dr. Ross's cause of death unreasonable?
No, it's not unreasonable.
Is Dr. Ross's opinions in this case, are those unreasonable?
No.
You agree with Dr. Ross that the extent of heart disease present was severe?
Yes.
You agree with Dr. Ross that the extent of heart disease was potentially life-threatening?
Yes.
And when we're talking about all of these medical terms, they're very hard to understand for people who aren't in that world.
Right.
But basically, the heart is a pump.
Yes.
It pumps blood to the whole body,
Right.
including the brain,
Right.
including the heart itself.
Right.
And these coronary arteries are the major supply of blood and oxygen to the heart.
Yes.
And blood and oxygen for the heart are needed to maintain its function.
Yes.
And its function of beating is what gets blood from the heart to the brain.
Yes.
And if the pump is damaged, then the function of the heart is damaged.
Yes.
And that would affect blood getting to the brain, right?
Potentially, yes.
But that source would be from the heart.
Yes.
There were a couple of heart conditions that you did not address in your report. Cardiomegaly and the left ventricular hypertrophy.
I thought I addressed that.
Okay. Did you find the cardiomegaly to be of clinical significance in your autopsy?
I mean, any enlargement of the heart is significant. It depends on the degree. And in this heart, it was not too bad, I was started with, because he was only 30-some years old. And we usually don't expect that, usually I say, exceptions apply. But usually the heart is in this condition, it's not too big. 418 grams for his weight is not excessively big.
It's big enough to cause hypertension.
It is, it's not a true cause of hypertension. It is maybe a result of hypertension because the heart pump will increase the resist, so it is increase the size and thickness of the heart. And that is a condition or risk factor.
And that on its own can cause a cardiac arrest.
Yes,
That on its own can disrupt the heart's electrical system,
if it is severe enough, yes,
and that could cause an arrhythmia.
yes.
That alone can cause sudden cardiac death.
It's potential, yes,
It increases the risk of heart failure.
yes.
It increases the risk of a fatal cardiac event.
You know, it potentially, yes.
And that left ventricular hypertrophy, that's the heart's main pumping chamber, right?
It's like a thickening of the wall, yes.
Okay. And that impairs the heart from pumping efficiently.
It's not necessarily impair the pumping, it's more like it needs or demands more oxygen supply.
Does it impair the heart from pumping?
Not necessarily completely impair, because in theory, you know, the reason for the thickness of the heart is have more force, like you know, athletics. They have heart, a big heart, you know, increase the ventricle thickness.
And the ventricle thickness here was 1.8 centimeters.
Yes,
That's thick enough to be dangerous.
yes,
That alone is a significant risk factor for sudden cardiac death.
it's potentially yes,
That alone can be dangerous for causing arrhythmias.
yes,
That alone can cause a fatal cardiac arrest.
it's potentially yes.
Mr. Freeman's heart disease was so severe that it had the potential to cause sudden cardiac death that same day without any altercation.
Potentially yes.
I want to talk to you about some of the injuries on Mr. Freeman's body, okay?
Yes,
You discussed what contusions, lacerations, hemorrhages, what all those are for the jurors.
yes,
There were multiple instances of contusions and abrasions and hemorrhages, right?
yes,
There was the one laceration to the head.
on the back, yes,
And some of those abrasions, particularly on the knees, on a couple on the hands and on the ankles, those were older injuries, right?
yes. According to Dr. Ross, they are healing.
Okay. Well, and according to you too, in your
Yeah,
report.
yeah, because you know I, you know, correlated with his finding. Yes,
And there was a stab wound that was healing on his back.
yes,
You cannot isolate, based on the video, what actions caused what injuries.
no,
And you would agree with me that there was evidence of both acute and older injuries.
yes,
I want to talk to you about hemorrhages, okay?
yes,
Now, hemorrhages are bleeding under the skin.
yes.
Usually, hemorrhages heal on their own.
Depends on the condition. You know, I would say yes.
Oftentimes, you may not be able to see a hemorrhage from the outside.
It depends on you know severeness and the deepness, you know, of the nature of the trauma.
Okay? Even in an autopsy, you cannot determine the cause of any particular hemorrhage usually.
Right.
Do you know, in this case, exactly where Mr. Parham placed his knee?
In a general sense, but not specifically.
Okay? And you cannot tell that from the autopsy.
You know, you can, what do you call it, stipulate, you know, maybe where the injuries are. You might correlate it if you can, but I will not say specifically.
And here, you could not tell specifically.
Right. No.
You discussed on direct the small abrasions on the anterior lateral chest wall associated with subcutaneous soft tissue hemorrhage. Do you remember that?
Yes.
Sandra?
Yes.
What is subcutaneous?
Basically beneath the skin. Sub meaning beneath, cutaneous meaning skin. So subcutaneous beneath the skin.
And is that the layers that you were talking about? It goes skin,
Skin, subcutaneous tissue, and other soft tissue, other layers, and muscle, and other layers. Yes.
so these small abrasions that were associated with subcutaneous soft tissue hemorrhage, that hemorrhage was the first level.
Probably yes. Subcutaneous. Yes.
So not a deep muscle wound.
Right.
And where is the anterior lateral chest wall?
So anterior meaning front, lateral meaning side. You know, anterior, lateral.
Tell us what's the 50%.
Dr. Lee, is it fair to say that your finding is based on the video and not on the findings in the autopsy report?
Again, as I said, we reviewed all the material, basically me included, review all the information available. Autopsy report is very important in reaching my conclusion, because if without the autopsy report, I would not be able to say the heart disease contributed, and I would not be able to say, you know, the other conditions he had. But in combination with the autopsy report, video footage, lab studies, interview, and other investigation, toxicology also included, that we needed all the information available to us to reach the conclusion. Although there is no specific trauma associated with mechanical asphyxia, as I explained to you, sometimes you don't see that. But if you don't see it, it doesn't mean it's not there. If I don't have the video footage, I would not be able to reach the conclusion as to the complication of mechanical asphyxia as the cause of death. Because, as Council pointed out, there's no specific findings associated on the autopsy report to the mechanical asphyxia. So we have to correlate all the information. If it's not there, doesn't mean much. If they're there, it means something. Again, it is correlate all the information. It's not necessary. I just review the video. I can conclude one aspect, but not all the aspects.
In your previous testimony on page 113, starting at line 25, do you recall being asked, so is your opinion basically, it's because you saw it on a video, a knee on his back, despite the fact that there's no physical evidence in the autopsy, your finding is mechanical asphyxia? And your answer was yes.
Again, one aspect of the mechanical asphyxia, if I just look at the video alone, I can reach the conclusion. But the heart condition, I will not be able to, because I need an autopsy report.
And again, when previously asked in your testimony, you indicated that your opinion is based not on the autopsy, but on the video.
Again, as I said, the video is sufficient for me to reach the cause of that. But contributing cause of that, I have to say, I need an autopsy report.
I wanted to talk to you about the healing stab wound that was on his shoulder, okay?
Yes,
That stab wound, based on Dr. Ross's autopsy and notes and photographs,
yes,
that was not reopened.
right,
That was not torn.
right,
That was not bleeding.
right,
It was not disturbed in any way.
right,
It was, the bandage was still in place.
right,
And the notes make clear that that was from a different altercation
right,
on a different day.
right.
Now, I want to talk to you about the knee on the back that you referenced in the video.
Right.
Now, is it fair to say that you referenced multiple people's knees on the back?
Knees and arms, the pressure and the, what do you call that, the weight.
Okay, so you are not exclusively saying one person's knee or one person's arms or one person's weight.
Right, usually I don't point finger to which one did what and which officer did what.
Do you know how much Mr. Parham weighed at the time of this incident?
I don't.
Do you know how much weight Mr. Parham was placing on his knee to use?
Again, I don't.
Would you agree with me that in the video, it shows one knee,
Right.
and this other leg extended out,
Mhm.
and this back foot, if you can see my foot, this right foot propped up like this?
Okay,
Would you agree with me?
okay.
Would you also agree with me that that indicates weight was on the left leg
Okay,
and weight was distributed to the right foot?
yes,
And all of that would minimize the amount of weight pressing through the right knee.
or just opposite, as you pointed out. Because you said the left knee is on the back,
No, right knee.
the right knee, okay,
So if I've got my left knee up, there's weight on here.
okay,
There's weight here.
right.
And like right now, I can have my knee like this,
Mhm.
and I'm not putting pressure on anything.
If there's nothing underneath, like this, squatting position, the knee is not on the back of the victim, then it's not there. But
Even if my knee were touching the back of someone right now, it would not be putting adequate pressure to cause an asphyxia event. Is that correct?
right, if that's the position, but the video shows different story.
Do you know how much weight is placed on his back?
Again, I don't know.
Do you know how long his knee was consistently in one place?
Right, you can see from the video.
Can you also see on the video frequent repositioning?
It's a little bit, but the most of the time it was there.
Okay?
Or,
So-
one is there, other people were there. So I would say several officers, I don't think, point fingers who's doing what, but you can see the knee or knees or arm on the back of Mr. Freeman.
Would you agree with me that you cannot tell based on the video how long the knee is consistently in one place?
You can pretty much tell, yes.
You can tell based on that video?
Right,
You can also tell based on that video that is of relatively poor quality, that Mr. Parham frequently adjusts his placement.
maybe a little bit, yes, but, the knees were there.
Do you know how much weight is required to create an asphyxia event?
Again, as I said, there's no just cut number, say how many pounds or whatever the weight is necessary. I don't know.
Can you distinguish in the autopsy the different times that you indicated different individuals had knees or hands or arms on Mr. Freeman?
Again, I don't know specific, which one is which, but a lot of, or patch, contusions or subcutaneous hemorrhage or muscle hemorrhage present.
tell me what of those Mr. Parham is responsible for?
I don't.
Can you tell me if he's responsible for any of them?
I would not say any of them, but I would not say any specific of them, but some of them.
Now, would you agree with me that that video is not grade quality?
Right,
And it's difficult to see exactly what's happening?
right, but it is sufficient for me to reach my conclusion.
You would agree with me that oftentimes people walk through the frame and block the view?
Right, sometimes, but still, it's sufficient for me to reach my conclusion.
You would agree with me that from the video, you can't tell exactly where the knee is placed?
Right,
You can't tell exactly how much weight was placed?
right,
You can't tell exactly when he stopped breathing?
right,
You can't tell exactly when his heart stopped beating?
right,
We know that at some point those two things happen,
right.
but you can't tell when.
Not exactly.
I want to talk to you now about some of the other factors that were present, okay?
Yes,
The chemical sprays, OC spray.
right,
That is an oil-based spray,
right,
right?
right,
That would make your skin slippery.
right,
At the time that Mr. Freeman was on the ground, he would have been very slippery,
right,
and he was naked.
right.
Is it possible for heart conditions to be exacerbated by OC spray?
It could, potentially, yes.
OC spray is intended to incapacitate a person.
Right.
I'm sorry?
I said right.
Okay. On the video, you can see all of the jail staff in distress from that OC spray.
Yes,
In the video, you can see Mr. Jones and Mr. Parham struggling from that OC spray.
I don't specifically, what do you call it, recall that, but I will take your word for it.
Did you see Mr. Jones gagging?
Again, as I said, I don't pay specific attention to which officer doing what in his situation, but I will take your word for it.
Would you agree with me that OC spray causes intense burning, blindness, and breathing difficulties?
If it is, directly aimed into the eyes or something, maybe.
And all of those things can increase stress levels.
Yes,
And stress on its own can trigger a cardiac event.
yes,
Pain can trigger a cardiac event.
yes.
But death from OC spray is incredibly rare.
I don't have any personal experience on that, but I will take your word for it.
You've done more than 5,000 autopsies?
Yes,
How many autopsies have you determined the cause of death to be OC spray?
I don't have one.
Generally, that is just a tool for self-defense as an incapacitation, not as deadly force, right?
Right,
Now, I want to talk to you about the psychosis, okay?
right.
Now, did you watch the video of Mr. Freeman in his cell before?
A little bit, yes,
Would you agree that he was behaving erratically?
yes.
Would you agree that in watching the video, he did not seem to have a normal response to the OC spray?
That I don't know, but I will take your words for it.
Well, you watched the video.
Yes.
right? Did you see Mr. Freeman get sprayed with OC spray and continue charging through officers?
Yes,
Did you see him get sprayed with OC spray and then just stand up and walk away?
right.
Would you agree with me, that's not a normal response to being sprayed with OC spray?
Again, I don't have personal experience on that, but I will take your word for it.
Did you suspect from the video that Mr. Freeman was in a psychosis?
I will say some sort of mental distress.
Okay. And if he was in some sort of acute mental distress, like a psychosis, that can affect his heart rate.
Yes,
It can raise his heart rate.
yes,
And a high heart rate for a sustained period of time is dangerous to have, right?
yes,
Especially for someone with a severe cardiac disease.
yes,
A high heart rate for too long can cause a cardiac event.
potentially, yes,
you agree with Dr. Ross that the physical activity from the cell before the door ever opened could have been enough to trigger a cardiac event?
Potentially, yes.
Now, I want to talk to you about signs of aggression in the video, okay?
Yes.
You saw evidence of aggression in Mr. Freeman in that video, right?
Yes.
Starting in the cell,
Right.
and then fighting with the officers through the hallway.
Right.
Anger can raise your heart rate.
Right.
Agitation can raise your heart rate.
Yes.
Fighting can raise your heart rate.
Yes.
Do you agree with me that at the beginning of that video, Mr. Freeman already appeared sweaty or moist?
Yes.
And again, that high heart rate can trigger a cardiac event.
Yes.
Now, I want to talk to you about the 4th floor and the 5th floor.
Right.
okay?
Right.
You cannot distinguish between the injuries from the 4th floor and the injuries from the 5th floor.
On the autopsy report, yes.
You cannot do
You
that,
cannot,
right?
yeah.
And Dr. Ross opined that Mr. Freeman could have died from the events of the 4th floor alone.
Yes, potentially, yes.
And you agreed that he could have died at any time.
Exactly.
You cannot say whether it's a 4th floor or a 5th floor situation.
What do you mean by that?
That he could have died at any time. You can't say specifically it was just the 4th floor or just the 5th floor.
Right, in theory, yeah, he could have died anyway, but in reality, he was running, he was, struggling, fighting, and even running from the escalator from 4th floor to 5th floor. He was alive.
And someone can be at the point of irreversible heart damage and still run and fight.
I don't know what you mean by the irreversible heart damage. How do you define that?
The point at which the heart is so damaged that there's no coming back from it.
Right. If that's the case, I didn't see it because nobody can run so long, struggle, fight, if the heart is already completely dead. There's no heart function. I don't see a person can
Well,
run that
That
long.
wasn't my question. My question is, you discussed this dying process,
Right.
right?
Yes.
When you're talking about the breakdown of some internal organ, that's not normally super fast, right?
Right, right.
That is normally a process.
Right. Yes.
And that's true with the brain,
Yes.
that can be true with the heart.
Yes.
The heart cardiac arrest event can be a process.
Right.
And someone can hit a point of irreversible heart damage in that cardiac arrest, right?
Yes.
And that, you can be at the point of irreversible cardiac damage during an arrest and still be talking and moving and walking and all of those things.
Depends on what you're talking about, talking, moving. We see that he is running, not only from the 4th floor through the escalator to the 5th floor, still, struggle, still fight. And that is not the sign of somebody is dying and somebody is or in a position of the process of dying or suffer irreversible heart damage because it was not consistent with that scenario.
Would you agree with me, from the point at which Mr. Freeman goes from the ground on the 4th floor
Right,
and he stands up
right,
and walks to the escalator to
Right.
go up to the 5th floor?
right.
From the time that he stands up, he does not run anymore in that video.
He runs from the escalator. It's like, it's not like it just stood there with the escalator. He leaped.
Would you agree with me that as he's going up the escalator, he is hanging on it?
Hanging on it or not, but he was leaping. It's not like it just without stepping.
Would you agree with me that when he went towards the escalator, he was staggering?
maybe, but I don't specifically have that opinion on that.
Do you agree with Dr. Ross that Mr. Freeman could have died without the subdual event?
He could have died, on, as you said, in theory, in his cell on the 4th floor, on the escalator, or on the 5th floor, but in reality, he was very alive.
Okay. But you do agree with Dr. Ross that he could have died even without the subdual event?
Agree.
Now, I want to talk to you about the medical response, okay?
Yes.
Mr. Parham, you watched the video, right? So I'm going to back up just a little bit. When you were talking on direct, you discussed the use of force policies and saying even if you have to use this position, right? So
Yeah.
even your assessment contemplates that there may be a situation in which this is necessary.
Yes.
Okay, so it is then incumbent upon the officers to follow their training.
Right.
Mr. Parham had placed his knee to hold Mr. Gershun Freeman down.
Right.
And Mr. Jones had been sitting on Mr. Parham's buttocks.
I'll take your word for it, yes.
And prior to Mr. Mr. Parham going down onto some part of Mr. Freeman's back, Mr. Freeman had actually grabbed the testicles of Mr. Jones.
I would not be able to see it or.
You weren't
feel-
able to see that in the video?
Right, no.
Because sometimes things in the video got lost.
Right.
Now, so that, putting the knee was when that happened, because Mr. Jones had to pop up. So, Mr. Parham was able to stand up when the smocks got there to cover Mr. Freeman. Mr. Parham stood up at 4:56:50,
Okay.
okay?
Okay.
You would agree with me that CPR did not start until 9 minutes after that.
I will take your word for it.
Now, there is medical records in this case, right?
Yes.
There were medical staff on scene that responded after that code white was called.
Yes.
And the medical staff that responded indicated that he had a pulse.
That I will take the word for it.
You didn't get those records,
No.
did you?
No.
Okay. Now, I want to talk to you about that AED pad.
Right.
You indicated that there is a shockable rhythm.
Right.
What does a shockable rhythm mean?
Meaning, you don't blindly use AED because it might do damage to the body. And if, to define the shockable rhythm, there are generally two rhythms you can shock and probably make a difference. One is called VFib. VFib may basically ventricular fibrillation. And basically the heartbeat is so erratic, didn't pump the blood out. That's one of them. The second one is called pulseless VTAC, ventricular tachycardia. It beat so fast, it didn't pump the blood outside of the heart. So these are the shockable rhythm. And the AED will help to correct the arrhythmia to a normal rhythm, hopefully. The other two non-shockable the non-shockable rhythms include asystole. Basically, there's no electrical activity or contractual or mechanical force to the heart. If you apply the AED and shock, that might cause more damage. It will not help at all because there's nothing to correct. And the other way of non-shockable, the rhythm is called pulseless electric activity, or PEA. And that happens most of the time, very common in the situation with this cardiac, pericardial sac full of blood. It's called a cardiac tamponade. The heart try to beat but cannot. And the massive PE, pulmonary embolism, the same thing. So you cannot shock them and make any difference. So these are the situations, whether shockable or non-shockable.
If an AED is placed
Right.
and a rhythm is detected that is not in arrhythmia, will it advise no shock?
I don't know specifically. If depends on what type of rhythm.
Would it be a good thing to shock someone who has a normal pulse?
I don't think so, because if it is already normal, you don't shock them.
Even if it's a weak pulse?
Depends on what you mean about what the rhythm is. It depends. If it is a flat line, you don't shock them.
Right. But also, if there is a consistent non-arrhythmia pulse, it would advise no shock.
That I would assume so.
Okay. And you saw on the video medical staff check his pulse
Right.
without them starting CPR.
Right.
You saw medical staff bring out oxygen
Right.
without then administering oxygen.
Right.
Is it fair to say that someone's condition can deteriorate over minutes?
Yes.
Now, I want to talk to you about mechanical asphyxia.
Yes.
okay?
Yes.
Now, with asphyxia, you were discussing the brain being very susceptible to a loss of oxygen.
Yes.
The brain gets oxygen from what?
Right. Constantly, nonstop, non-interrupted.
And the heart has to pump that blood to the brain.
Yes.
Scientifically or medically, how long does it take to cause an asphyxia event?
I again, as I said, there's no clear cut, but I would say a few minutes. Few minutes, actually to start with, few seconds, maybe 10, 30 seconds, the person will suffer, unconsciousness because of the lack of oxygen. And a few minutes later, without the constant continuous supply of the oxygen, the brain cells keep dying to a point. From that point on, there's no coming back or return. It's called irreversible. You cannot reverse the process.
But there's not a bright line rule on how long that takes.
Right, it depends on the condition of the person individually. Some people are more vulnerable, other people may be less susceptible.
Now, when Ms. Hunter was talking to you about the use of force policies, you indicated it's a good policy to have, right?
Yes,
And that's, have you ever heard the phrase, an ounce of prevention is worth a pound of cure?
I would take your word for it.
Now, have you ever heard that?
I heard
phrase?
of that, yes.
Okay, so it's better to be safe than sorry. right?
Yes, yes,
So when you looked at the use of force policy, it says you should avoid that prone positioning because of the possibility that a person may be able to breathe properly, right?
may be suffering.
Right.
Yeah.
It is possible that it may inhibit their movement.
Yes,
And that's why it's a good policy to have to avoid that if you can.
yes,
But if you cannot avoid that situation.
right,
If that is necessary under the circumstances.
right.
Then it's also a good policy to be continuously monitoring.
To basically if you have to do it, you do it, but continuously monitoring the situation. And if it is already restrained, you put the patient or victim, in a position that they will not continuously suffer.
And so they should rely on their training to know exactly when they're supposed to get up.
Yes,
And again, those use of force guidelines talk about possibilities, not certainties, right?
so, I would say this. The prison guard have a tough job to do. and they have their policy and procedures. And the policy and procedures evolve over the years, and some old policy may be okay, but new development, new research or new outcome, better outcome, will teach them not to use that. Maybe in the past it's okay, but not anymore. So they have to abide by the new policy and procedures. And the situation here is this. It caused so many, I want to say, death or bad or severe outcome because of this face down and restraint and pressure on the back, cause mechanical asphyxia. So they try, and we try to teach law enforcement not to use it. And according to their own policy and procedure, it is avoid. I mean, you should avoid using that technique.
If that's possible.
Yes.
And if it's not possible, then there are certain precautions that you should take.
Right, again, if it's not possible, you have to use it to restrain. As soon as you get under control, you have to release it or monitor constantly or release it, put the prisoner on a safe position or without continuously using the mechanical, the pressure or the weight on the back.
Is it fair to say that you've never gone through a use of force training?
No, I don't.
Is it fair to say you've never been a jailer?
No,
Is it fair to say that you've never been in a situation where you had to subdue someone?
no.
Now, you would agree with me that throughout our country, every day, thousands of people get subdued by police.
Yes,
You would agree with me that sometimes police have to put someone in a prone position.
agree.
You would agree with me that sometimes police have to put someone in a prone position with weight.
Yes,
You would agree with me that thousands of people do not die every day from that.
right.
In your 26 years of doing this, how many prone plus weight deaths have you done autopsies for?
So it's not just the prone weight, it's the time. It's, if you do this prone and the weight, few seconds, no harm potentially done. If you release that promptly, no harm's done. And if it's extended a period of time, we're talking few minutes, the bad or severe situation or outcome will result. In my career, I have encountered a few cases personally and in our office.
And that's in over 5,000 autopsies.
Yes,
And in those handful of cases, were there also co-occurring issues?
that I couldn't remember. Maybe they have drugs, they have some other disease, or that I don't remember specifically.
Is it possible to have a mild restriction of airflow that does not result in asphyxia?
Right.
With asphyxia, is it common for the person to die during the asphyxia event?
So it depends on the situation. Again, it's not like say die or not die because you have to put everything together. The position, prone is more vulnerable because it's more difficult to breathe. Prone position, the weight or pressure on the back, it's the time. It's not like a few seconds, put that, release it, no harm done. But a few minutes, continuously, your brain suffer, your brain heart suffer, you will not be able to survive. That's the elements, not just the position or just the weight. You have to put everything together. Position, the weight, and the extended period of time. Few minutes, we're talking about.
Now, in this situation, when the knee was on his back,
Right.
if that amount of weight was not sufficient to cause an asphyxia event, and Mr. Freeman died, would you believe that his cause of death was due to complications from his severe
You can't see, that's a speculation. It's like a, speculative position, because you have to know that your position, your knee is not even touch the ground. Your knee is not even touch the back. So there's no weight, and I will not be able
But
to.
my question was.
Yes.
And, I mean, I'm kind of imagining a person.
Right.
Okay? If my knee is on that person, holding them down,
Right, you have to put in the whole thing. It's not like it's squatting. You just say, you are in the position, the knee is not even touch anything.
correct, but if it was touching someone.
Not just the touching, you have to put the weight, the
if-
pressure.
If there was weight
Right.
that was not sufficient
Right.
to cause an asphyxia event
Right,
placed on Mr. Freeman's back,
right.
and Mr. Freeman died,
So this is a theoretical, speculative question, and I will not be able to just answer that.
would you agree with me that in order to have an asphyxia event, there has to be a sufficient amount of pressure?
Yes,
So if that sufficient amount of pressure was not present, he would not have died from an asphyxia event, right?
that, again, I will not be able to answer that.
You can't answer whether if there is
If there's
not-
no weight, there's no weight on the back, just by face down, no weight on the back, I don't say this is a result of asphyxia.
Okay. If there is not sufficient weight to cause an asphyxia event,
So-
then most likely someone did not die of asphyxia, right?
Right, if there's no weight on the back of the victim, I will not say this is due to mechanical asphyxia.
Does asphyxia relate or result from any weight?
Again, sufficient weight, but I don't know how many pounds or anything. But weight plus the position plus the time. It's not just the weight alone. Weight may be sufficient sometimes, but if it's a few seconds, maybe okay. Nobody's suffering, nobody died. But in your situation, there's no weight or no sufficient weight. I don't know how you define it. I will not be able to say that person died as a result of mechanical asphyxia.
Okay. If Mr. Freeman
Yes.
had not had a sufficient amount of weight on his back to
Right.
cause an asphyxia,
Right,
what would you found his cause of death to be?
right. So,
The heart disease.
so if there's nothing, no struggle, no, what do you call that, fight, no, subdue, no other activities. If it's died in a cell without anything else, I would say heart disease. But, the situation here at hand is not that just the heart. You have other events.
All of these other things, all of these other stressors, all of these other things that would have built up the heart rate and the demand in his heart.
Right, without any weight on the back, yes, I would not be able to think.
And without sufficient weight on his back, right?
Tell me the definition of sufficient.
Respectfully, doctor, that's what you are here to.
Right, if you have to define that, if there's not enough weight, you will not be able to,
Correct.
yeah,
And you can't tell me what that amount of weight is.
right.
You cannot tell me that Mr. Parham put a sufficient amount of weight because you don't know how much weight was put there.
But from the video footage, I would say this is sufficient.
Would Mr. Freeman's severe heart disease affect his heart's ability to supply blood to the brain,
Yes,
which would affect oxygen being transferred throughout his body?
yes,
And all of the stressors that were present here would have increased Mr. Freeman's need for oxygen.
yes,
And that must be supplied by blood, right?
exactly.
It's not like, this is how I supply oxygen. The oxygen has to go into the blood and be circulated around the body.
Yes,
And that heart is a pump.
yes,
And if the pump is broken, it can't work properly.
right.
And if it's clogged, the blood won't come out at the proper rate.
It's not, it's not necessary if it's clogged. That will affect the supply to the heart.
I'm sorry, say that again?
If the corneal artery is clotted, as you said, then the blood supply to the heart is impacted.
Yes. So it affects the rate at which that blood is
Yes.
provided to the heart.
Right.
And the degree of that underlying cardiovascular disease would make him more vulnerable to all of those stressors that were present.
Yes.
Do you agree with Dr. Ross that it is impossible to tell the degree of respiratory compromise due to positioning?
I don't understand what his question.
Do you agree with Dr. Ross's finding
Right.
that it is impossible to tell the degree of respiratory compromise due to the prone position?
If it's prone position alone, I will not be able to tell. The prone position plus the weight plus the time, that is the components or elements of components together make the difference. Make that Mr. Freeman died here.
Do you agree with him that it is impossible to tell the degree of respiratory compromise?
I don't understand that.
Do you remember on April the 20th, do you have that with you? Matt, approach the witness, Your Honor.
Yes, ma'am.
On page 31, lines 22 through 25, being asked, do you agree with Dr. Ross that it is impossible to tell the degree, if any, of respiratory compromise due to positioning? And your answer being, it's hard to say the degree.
Yes.
Right.
Yes.
Okay. Now, I want to talk to you about some of the things that we looked at on the video, okay?
Yes.
When you initially watched the video with Ms. Hunter at the minute marker of 6:12, that is when you said that the dying process had probably begun, is that right?
That I cannot say for sure the mark, I mean the minute mark.
Okay, that was right after he comes up on the 5th floor, goes against the wall, fights with the officers. The 3 officers take him down to the ground, and they're cuffing him.
I don't believe that in the process of dying. I don't believe that.
So you did not testify that that was the dying process?
Not necessary on that time frame.
There were times when we were watching the video with you
Right.
where Ms. Hunter asked you if you had a concern for mechanical asphyxia.
Yes.
Among those, when you indicated a concern for mechanical asphyxia, was when Stevon Jones was like this over Mr. Freeman's backside.
That alone might not be the sufficient thing, but you know, in other body parts, I mean, you know, the area of the back, some other officers or, I mean, the guard put the knees or arms, or it's not necessary just that position alone.
Do you recall on the video when this position alone was the only thing on Mr. Freeman, you saying that there was concern for mechanical asphyxia here?
No, I don't remember that.
Okay. And then when, in this position, when you saw his head move, you indicated that that was evidence of him struggling to breathe.
Right.
Fighting to live.
Yes.
Could it also just have been him struggling?
Yeah.
Could it also just have been him fighting?
Yeah.
Both of those are possible.
Yes.
Both of those are reasonable.
Yes.
And it would be fair to say that throughout this process, Mr. Freeman did fight and did struggle.
Yes.
And those were not fights to survive when he was fighting with officers on the 4th floor. That was fighting.
Right, in the 4th floor. On the 4th floor.
And when he swung at the officer on the 5th floor, that was just fighting.
Some part is yes, he was fighting.
And when he was struggling against being handcuffed, that was just struggling.
Yes.
I want to talk to you about when Mr. Freeman isn't, okay? That's a hard thing to watch, isn't it?
Yes.
In your testimony, you indicated that at that point in time, you see no signs of it.
Right.
Would that witness also be consistent with fatigue?
You know, just based on the personal experience alone, I want to ask a jury about that personal experience. Even if you are so fatigued after exercise also, if somebody would not hold your arms when you are on that position, you would not probably just free fall to the ground. There's no muscle tone to Mr. Freeman. When you see it, the guard or the officers took the arms. If they release it, Ms. Freeman will fall to the ground. Without, I mean, you can tell that there was no muscle tone, no gesture he could have maintained. And it is very sign of that he is not alive.
Could it also be a sign that he was unconscious?
Unconscious and probably dying, and it's not necessarily fatigue.
And he may have been in that dying process
Yes.
at that time, right?
Agree, yes.
Now, even in that dying process, he could still be breathing.
That I cannot tell, you know, because
That's-
of,
It is possible to be in the dying process and still be breathing.
I mean, to me, it's like a terminal event. Maybe terminal agonized, breathing, potential.
Because it can be, it's a process, right?
Right, yes.
It's not immediate.
Right.
So he may still be breathing, even if he's in the dying process.
Maybe not necessarily regular breathing, maybe agonal breathing or terminal event.
And he may still have a heartbeat.
Maybe, and again, that's like to me is a terminal event. From that point on, he probably will not survive.
And that's because he was in a dying process.
Or without the proper measures.
If he was unconscious, still breathing, still with a pulse, could that explain why there was no immediate medical intervention?
That I cannot tell. I mean, speak for their policy or for their why they not do or why choose
Knowing
not to.
the standards for medical professionals.
Right.
Would that make sense?
I will not be able to speak for that.
Would you start CPR on someone who was breathing?
Breathing alone, if there's no heartbeat, probably you will do the CPR.
Would you start CPR on somebody who has a heartbeat?
Usually not. It depends on what is your heartbeat mean. If it's a regular, it's a terminal event, or arrhythmia, or something. I don't know.
And a lot of these things, even the dying process, that may not be something that normal everyday people think about, right?
Probably.
Because a lot of people, when you think about dying, you think about just dropping dead,
Right.
it being a fast thing.
Depends on the situation.
Right.
Yeah.
But that's not always the case, is it?
Right.
And that's why medical training is important.
Yes.
And having somebody who's trained to recognize those signs, that's important.
Yes.
When we were talking about the OC spray, we talked about how that would affect vision and things like that, right?
Right.
And that it can cause pain.
Right.
And you agreed with me that you can see in the video the officers responding to that, right?
I took your word for it. Yes.
Did you see them?
Again, they use that, and somebody, try to avoid that. Yes.
So, I mean, you saw people gagging and choking.
Yeah. Yeah.
Is it fair to say that being close to OC spray for an extended period of time is hard on everyone around them?
Potentially, yes.
Is it fair that someone who has been exposed to that OC spray could possibly need to go and have some sort of intervention from the physical pain that they are having.
I would agree with that.
Now, I want to talk to you about, aside from mechanical asphyxiation, some other causes of death that could have been likely here, okay?
Okay,
That severe cardiac disease could have been a likely cause of death.
yes,
The hypertension in his heart could have been a likely cause of death.
yes,
The diseases in combination could have been a likely cause of death.
yes,
And all of those would have been exacerbated by all of these stressors that were present.
yes,
And psychosis itself can create a high risk of rapid cardiac failure.
So again, as I described to you, psychosis itself is not necessarily a disease. It's a mental state. It's like, you have a chest pain. Chest pain is a state, it's a symptom. Psychosis is the same, it's a symptom. So usually I would not say cause of death is a chest pain, because chest pain implies something else, underlying disease. Psychosis is the same thing, whether it's a psychiatric problems or drugs or other influence or something else. And maybe sometimes even deprived of sleeping or sleeping. I mean, somebody will have that symptom.
Dr. Lee, if you would please refer to the transcript from 420 on page 26.
26?
At page 26.
Okay.
Line 16, the question is, and people in psychosis are at a risk, are at a high risk of high rapid cardiac failure and cardiogenic shock due to stress cardiomyopathy. And your answer being, yes, it's possible.
It's possible, yes.
So it is possible that psychosis alone puts someone at risk for a rapid cardiac failure.
But your qualification is with the hypertrophy of the heart, right? Or no?
Due to the stress cardiomyopathy.
Right. It's
So
cardiomyopathy.
people in psychosis are at a high risk of rapid cardiac failure and cardiogenic shock due to stress cardiomyopathy.
Right.
And
It's
that
like,
can cause death.
right. It's cardiomyopathy. It's the heart related.
And you would agree with me that there were a large number of stressors present here.
Yes.
Your opinion of mechanical asphyxiation is because you saw a knee, arm, or hand on his back in the video.
Just not just on the back. It's like position, the weight and pressure, and the time.
Even though there's no physical evidence in the eye.
Again, a lot of times these asphyxia, as I described to you, you don't necessarily see or observe or the sign or the marks leave behind.
So your opinion is based on the video rather than the findings in the autopsy?
Again, I told you again and again, autopsy report is very important. I don't discount on the autopsy report. Autopsy report, other information, plus the video footage.
And we've already discussed in the transcript where you have already agreed with that position, right?
Yes.
Your opinion is based on the video, not the autopsy. I want to talk to you about current medical research and literature, okay?
Yes.
You discussed earlier and explained to the jury what peer-reviewed literature is.
Yes.
And that is where, before an article is published, other experts in the field, other doctors review it
Right.
and say, yes, this can be published.
Yes.
You would agree with me that medicine is constantly evolving,
Yes.
and that positions and opinions in the medical community are subject to change.
Yes.
And they can change based on new information gathered.
Yes.
And information is gathered oftentimes through academic studies.
Yes.
And the peer review offers kind of a check to that, right?
Yes,
Now, I've previously given you a couple of medical studies.
yes.
One of those was from 1988, Dr. Ray.
I don't remember that, you asked me about it, but I never saw the article. But events,
I gave you the article. Did you not read it?
No, I don't remember you gave it to me. But
Remember, we reset your testimony because I gave it to you and you wanted time to review it?
even the last time around, I still ask about it. I don't remember
So
that.
I'm sorry, did you read it?
I don't remember that you give to me. Or even if I read it, again, I read a bunch of papers you give to me.
Okay.
I would say that.
Do you remember one of those papers being a position that the prone plus weight can result in mechanical asphyxia?
Again, it's not just the position and the weight. You have to put everything together. Okay, go ahead.
That was a paper done by Dr. Ray. Do you need me to hand it to you?
No, I don't need it because, I read enough about them.
And then, did I hand you some other articles?
Yes,
That was that medical evolution of these opinions, right?
again, the series of research articles, yes.
So from that position of Dr. Ray in 1988, fast forward to 2007, and you had an article primarily authored by Dr. Chan
Right,
regarding ventilatory and metabolic demands during aggressive physical restraints in healthy adults.
right,
And that was a study that was undertaken to determine whether placing over 22.7 kilograms, do you know that translation to pounds?
yes,
About 50 pounds?
right,
Might inhibit ventilatory function such that it becomes clinically important considerations in the analysis of such deaths.
right,
Now, they cannot duplicate real-life situations in academic studies.
right,
It doesn't have the same kind of stressors, even if they simulate a struggle.
right, right,
They can do the best they can within a controlled atmosphere.
right,
And part of that control is that they use healthy people.
right, right,
Because they don't want some sort of other underlying condition to affect the results of the outcomes.
exactly,
So they screen people.
right,
And they do things like here, it was on a gym mat instead of on a hard floor.
right,
And it is for a set amount of time.
right,
So even though these are controlled circumstances, the purpose of these academic studies, specifically this one, was to study whether prone positioning plus weight inhibited maximal voluntary ventilation.
right. The purpose is good for academic exercise, but it will not directly translate to the situation in the case in front of us. It's like, you cannot compare apple to orange or orange to apple.
Well, and this study involved strapping a canvas bag full of lead shot to someone's back, right?
Right, right,
And they used a lightweight,
right,
they used a moderate weight,
right,
and they used a heavy weight.
right.
And those weights were determined based on the subject's weight.
So I will also tell you what is the study about. They select a group of healthy individual to start with and put the position face down and evenly put a weight on the back. And, then they measure whatever they measure parameters. So this, to start with, is a controlled population, healthy population, and use the set weight evenly distributed on the back. I don't know anybody will have the situation like that in real life. And the situation we're discussing here is this. This victim had a heart disease, maybe other disease, and had a struggle throughout, and then somebody put pressure, not evenly, on the back, and then for an extended period of time. That's what we're talking about. Not necessarily academic exercise, say, this healthy person, we're putting him without anything else, just evenly distributed, say 50 pounds. And for a few seconds or a few minutes or whatever, I don't remember exactly what they designed. And this is a situation irrelevant to what we have here, because you don't have a person not very healthy and struggling so much, and eventually a weight of pressure on the back unevenly and for an extended period of time. So I would not be able to say the orange is this, the apple is this. I don't want to compare them. Irrelevant.
Would you agree with me that in this study,
Right,
subjects were placed in the prone position,
right,
they were handcuffed behind their back.
right,
They were actually even handcuffed at their legs as well,
right,
and they were placed in a hog-tie position.
right. Some of
which is
them,
that
yeah, some of them.
maximal restraint
Right,
position.
right,
And in that position, the first part of the test just compared being in the prone position, their breathing.
right.
The second part of the test then applied weight.
Right,
And that weight was placed between their shoulder blades on their mid-back.
right,
And for subjects over 150 pounds,
right.
the lightweight amount
Right.
was about 50 pounds.
I mean, I even remember 25 pounds, I had 40 pounds, but I'll take your word for it.
Well, this is for the subjects over 150 pounds.
Okay.
The subjects under 150 pounds had a different weight.
Okay,
The moderate weight that was placed on them was 150 pounds.
right,
The heavy weight that was placed on them was 225 pounds.
right,
And then the second part of the test, they added 60 seconds of a maximal struggle. They tried to encourage people to struggle against these bindings as hard as they could.
right,
And then compare their maximal voluntary ventilation. Right?
right. So there's another parameter, how long that weight was on.
And at the end of this study,
Right,
it showed that even with up to 225 pounds of pressure on the back,
for how long? That's my question.
I believe it was a minute or over a minute,
Right, a few seconds, maybe 60 seconds.
there was no deviation outside of normal clinical parameters.
Right, so from what we observe, I would say a few seconds, people can survive, as I just described to you. The critical part is this: you don't have constant oxygen supply for extended period of time, minutes. It's not like 1 minute or 60 seconds. 60 seconds, as I said to you, he could have survived if they released him, or lifted their knees, lifted their arms, or let him back on the back or sit up. He could have survived. The critical part is it's not just the weight alone, the position alone, the extended period of time, because the brain needs the oxygen, constant, nonstop. That's the critical part. The weight alone, if it is released with a few seconds or within a minute, it will not have caused major damage. That's the point I try to convey. So the study is this. They studied exercise, academic exercise, with the selected individual, put it away a few seconds, maybe 60 seconds. Nothing damaged. And I would challenge you, nobody was subject to a study with underlying disease and somebody putting knees, arms on the back for extended period of time, because it could have caused harm, could have caused the death. Nobody was submitted to that study. The time component is very important. It's not like I say 60 seconds, 100 pounds, 200 pounds. You can survive.
So, doctor, a couple of things. Number one, are you saying that there is a bright line rule at 60 seconds?
No, no, no. As I said, I don't have just the time. I mean, seconds. You have to have few minutes. The few minutes depends on the condition of the body. If the body, the patient has underlying disease, the minutes will be shorter. Versus a healthy individual, it can last longer without the oxygen, or with the heavy weight on the back, face down, you can survive maybe longer. But I don't have a clear cut 60 seconds, 2 minutes, 3 minutes. The longer, the worse. That I can tell. But within minutes, I don't see a major damage will cause.
So, if I'm hearing you correctly,
Yeah.
what you're saying is someone with a severe underlying condition would be more likely to be in danger in that situation
More vulnerable, yes.
than a healthy person in the exact same situation.
Yes,
And they're more vulnerable because of the underlying condition.
yes.
And the healthy person may be perfectly fine.
Maybe within the shorter period of time, yes.
And here, Mr. Freeman obviously had a severe underlying condition.
Yes, we agree.
Would you agree with me that when you looked at Mr. Freeman, you would not know that he had that severe underlying condition?
No, without the autopsy, we will not know.
He was not in the typical age risk factor, right?
Right.
He was not over 55.
Right,
He was not obese.
right,
He actually appeared to be physically fit.
right.
No indication that, no indication in looking at him.
Right. That's why I said, autopsy is very important.
No indication in looking at him that he was in such a severe condition in his heart.
Right.
Now, you have said that you agree with Dr. Ross's opinion, right?
You have to give me specific.
Okay. You said that your opinion is consistent with Dr. Ross's, just more specific.
Right.
Do you agree with Dr. Ross that psychosis contributed?
Maybe. But I personally, I didn't put that in my opinion.
Do you agree with Dr. Ross that Mr. Freeman's heart could not stand the physical exertion here?
Right.
Do you agree that it is impossible to attribute more or less significance to the events on the 4th floor versus the 5th floor?
I can, because, the 5th floor is critical, especially the last few minutes after we saw the video that he was put face down and weight on the back. That's completely on the 5th floor.
So you disagree with Dr. Ross?
I would not agree with, you cannot tell, the 4th floor, 5th floor, they're saying no. 5th floor is more critical.
But you agreed with Dr. Ross that Mr. Freeman, due to his heart condition, could have died during the 4th floor?
Yeah,
complication.
in theory, or in what do you call it, theoretically, yeah, he could have died in the cell on the 4th floor or the 5th floor. But in reality, he was alive all the way, running up to the 5th floor with escalator, very alive. And that's the point I tried to make.
So you disagree with that?
Right.
Do you agree with Dr. Ross that his heart may have already been in the process of failure prior to the subdual?
That I cannot say.
So you don't agree with him on that?
No.
You don't agree that his heart disease was so significant that he could have already been in that process?
Right. Again, in theory, yes, but I would not agree that he's already dying or something
So
before.
in theory, you agree with him, but you don't think that's the case?
Right.
But that's a reasonable position to take?
I would not say that he is dying in his cell or on the fourth floor or even the beginning of the fifth floor.
So Dr. Ross's position there is unreasonable?
No, I will not, it's his opinion, but I will not have that kind of opinion.
Was that opinion of Dr. Ross's reasonable?
That, I will not comment on that.
Do you agree with Dr. Ross that Mr. Freeman died because he had severe coronary artery disease that compromised the ability of his heart to be able to compensate for the increased oxygen demand while under a great degree of physical stress?
Again, it is a very general blanket statement, but my opinion is a little different. My opinion is more specific because of the position he was on, because of the weight on him, on his back, and for a long period of time. I mean, relatively speaking, that's the most important factor, or most important, the scenario we're talking about.
Do you agree with Dr. Ross that it is impossible to say to medical certainty that but for the fifth floor, Mr. Freeman would have survived?
I would say this, but for the activities on the fifth floor, especially with his position facing down, weight on his back, pressure on his back for a long period of time, but for that, he could have survived. I would stand by it.
So you disagree with Dr. Ross?
I would, agree or not agree, that's my position.
But you agreed that he could have died on the fourth floor?
Yeah, he could have, in theory, he could have died in the cell on the fourth floor, fifth floor at the beginning, yes. But we talked about, not the necessarily theoretical stuff, because we can see from our eyes he was very alive in his cell, fourth floor, escalator, and even on the beginning of the fifth floor.
Do you agree with Dr. Ross that Mr. Freeman's behavior in his cell prior to the altercation was enough to exacerbate his heart disease?
Exactly, that in theoretically, everything is possible. That is a possibility.
Do you agree with Dr. Ross that Mr. Freeman's heart disease was so severe that he had the potential of dying a sudden natural death that day?
I agree.
Is Dr. Ross's opinion unreasonable?
Again, you cannot ask me, he has so many opinions, I will not be able to say this opinion, that opinion, that opinion. You have to give me this scenario or the specific. I don't have the blanket statement or opinion on that.
Is Dr. Ross's opinion supported by the autopsy?
What opinion you're talking about?
The fact that Mr. Freeman died due to an exacerbation of arteriosclerotic coronary artery disease due to altercation and subdual.
Right, so that's the thing. His opinion is more lump sum together, not specific. My opinion is more specific. And, you can watch the video and you can understand what I try to explain to you, what happened.
Can you look at the autopsy report and see evidence of what Dr. Ross found?
Again, Dr. Ross's autopsy said that he had a severe heart disease. I agree. I have no doubt or reason to not agree or believe his findings. So I agree with his findings. But if the heart disease alone, he's dead, we're talking about a natural death. But he's not a natural death.
And this wasn't just heart disease alone. This was heart disease plus that altercation and subdual that involved a lot of physical activity and stressors, right?
Right.
So this was not just heart disease that we're talking about.
Right. We're talking about, lump sum, everything together, subdual, physical altercation. But my specific findings or specific opinion is due to the mechanical asphyxia, because the position the weight and the time. And you can see it by your eyes, what happened. He is dead after they put the weight on.
Did you watch the same video as Dr. Ross?
Yes.
Is it fair to say that you came to some different conclusions?
Again, as I said, I would say more specific, not necessarily different, because he is saying the heart disease and due to this, and I'll say due to this because of mechanical asphyxia.
Is Dr. Ross's finding supported by evidence in the autopsy? And if you want to explain, that's fine, but please answer yes or
Would
no.
you all push
first.
the next one? Gentlemen, we're gonna take a short break. Be back with you all in a few minutes. We need to get this witness through today if we can. He's not gonna be here tomorrow. Take recess, don't discuss case studies, anybody else will see you in 5 minutes. we haven't been playing either. I haven't been playing golf or anything today. We've been right here. We all took a break. I was sitting right here, wasn't watching TV. But I really appreciate it, and we're going to continue to hopefully finish fairly soon. All right, Chief?
Thank you. Dr. Lee, do you respect Dr. Ross?
Yes,
Do you respect his expertise?
yes,
Do you respect his knowledge?
yes.
Do you respect his opinion in this case?
Yeah, definitely I respect.
His opinion in this case is not unreasonable.
You know, as a cause of that, the matter of that, yes.
It is not unreasonable.
Yeah, you know, I will respect his opinion.
That's all I have.
All right?
Thank you, Your Honor.
I have cough drops over here if you want one. Cherry and lemon, okay.
No, it's late, guys. Try to be quicker. Dr. Lee, I want to start out of order because something you said a couple of times piqued my interest. You said on a few occasions, weight plus position plus time.
Yes,
Weight plus position plus time.
right.
And time to you is a very important factor in this process.
Definitely.
And I think one of the last things you told Ms. Fuchs is that, to you, in your opinion, the fifth floor is critical, especially the last 2 minutes.
No, few minutes. I don't say 2 minutes. Few minutes.
The last few minutes.
Last a few minutes, yes.
Okay. What minutes are critical?
You know, from what time he was put face down, the guard's knee or knees, the arms started put on the back of the victim, and then when they finally release it, that's the period of time.
Is it fair to say that you have changed your analysis of the video from when you sat in that chair in April of this year to now?
Maybe because you know more information, more thought may
Well,
evolve a little bit.
let's talk about those two.
Right.
You admit that it's fair that you have changed your analysis significantly since April of this year.
Nothing significant.
Okay. You said more information. What additional information have you received and considered between April, when you gave your testimony in this courtroom, and today?
Maybe more thoughts, more like reviewing what I said during the last time.
Okay, so you haven't reviewed any more information. That
Right.
is not true.
Right.
Okay, so more thought.
More thoughts, more you know when I look back with what I said.
Let's talk about that.
Right.
You got a transcript of what you actually said, right?
Yes. Yes.
And you read it,
Yes.
and you didn't like what you testified to under oath, huh?
Not that I didn't like it. I say you know what you have to give me a specific. You cannot say you know that you don't like it.
That's fair, and we'll get to specifics.
Right.
In a few minutes, we're gonna watch the video, but let's talk about how you've changed at least some opinions, because you said that characterization.
My opinion never. I haven't changed it. The opinion is the same. Cause of death, manner of death, never changed.
Okay. Your analysis of the video has, with regard specifically to Mr. Stevon Jones. Let me remind you who he is. Mr. Jones, stand up. Do you remember me asking him to stand up in
Yes.
April?
Yes.
And you recognize him?
Yeah. Vaguely.
And do you remember when I told you that this was a murder trial?
Right.
And I was interested in what Stevon Jones did.
Right.
And I need to talk to you about what Stevon Jones did. You
Yes,
remember that?
I remember that.
Okay. And in April, the first thing I asked you about was when he placed his knee and grabbed the guy's hand and then repositioned.
Right.
And I asked you,
Right.
in April, did those 9 seconds cause any mechanical asphyxiation?
I still say no.
Well, so your answer is still no.
No.
Today, Ms. Hunter asked you, let's pull up, can we pull up E2? Can you go to back it up to 6 minutes. Or even, back it up until they're standing. Right there. You just play it from there. All right, let's pause it. Do you remember Ms. Hunter asking you and you saying that you were concerned about the mechanical asphyxiation process beginning?
Yes, but not specifically to him.
Okay, you never said that in April, did you?
Nobody asked me about it.
Okay. So right here, no one is on his back. Are they?
That's specific?
Do you see anyone on his back? You wanna play it?
Yeah, play it. See, there's something there going on.
Grabbing his hands.
Right, right. You see
Or-
the.
Press pause.
Did you see the knees on that?
I
Arms?
did, and that's what we just talked about.
Right.
You said that you were not concerned at all about mechanical asphyxiation in those 9 seconds. That's what you told me in April, and you just confirmed it today.
Where is the 9 seconds?
Back it up, please.
The specific. You have to be specific.
Watch here,
Right.
okay? He's not on it, he's standing up.
Right.
Right. Watch the timestamp. There's the knee.
Right.
There's he grabbing a hand.
That's completely different than.
And now his knee's off. Do you have any problem with that?
The 9 second time frame you ask is completely different than this one. I can tell you that.
No, you're wrong, sir. You are absolutely wrong. As a matter of fact, can you pull up the clip? I'll show you your deposition testimony.
Right.
Now, here, watch this. Pause it. Okay. Right there, you would agree with me that Mr. Jones put his knee on the lower part of Mr. Freeman's back to grab his arm, correct? Okay, play it. And as soon as he has his arm, he's off and stop it. So that's from 5:21 to 5:30. And they're not suggesting those 9 seconds of his knee back while he got control. So they're not suggesting that was just like that at all. Okay. And just to be clear, not maybe, that did not cause any. I don't think so. Okay. And Judge, just to be clear, because I just quoted a time, well, first of all, let me ask you, Dr. Lee, is
Yeah.
that the same clip?
I cannot say. You have to play the exact 9 seconds.
I did.
5:29.
I want to be clear, Judge.
5:21.
I may need to introduce it into evidence because the video we used in April is on a different timestamp than this video. I don't know if that requires a break for him to authenticate it, but I want to introduce the actual video into evidence that there's no question that it's the exact same.
Well, is there objection on, right? On market exhibit, there's no objection, otherwise it would have to be.
Judge, it's hard to tell, like, to the 10th of a second from what I'm watching up there versus what Mr. Irwin shown to Dr. Lee. It's within a second and a half of this. I mean, it's essentially the same
It's a
time.
9-second thing.
Is that a stipulation?
I'll stipulate
They're
that
not
that's.
gonna object to it being in.
Okay. I am showing you, we can go back to 8-2.
And we'll mark it later, it will be exhibit 20.
Exhibit 20 will be the original. Okay.
Just, are we talking about just this 9 seconds with a portion of the deposition?
No,
next to
it is the video, and it's already exhibit 1, or maybe not exhibit 1, that's probably a CV, but exhibit to his deposition testimony. And so that video will be exhibit 20 to the trial.
This short video will be exhibit 20.
No, the jail video that we used for his testimony, the entire thing.
So the jail video would be exhibit
Are
20.
you talking about the 9 seconds?
The 9 seconds are part of the jail video.
How much of the jail video?
It's what they produced and introduced in direct exam of Dr. Lee.
I mean,
It's-
I know we had a 20-minute video.
That's what it is. I'm asking him about the 9 seconds. The reason this becomes relevant is I don't want there to be any confusion with this jury.
Judge,
You're gonna approach the bench for a second.
Dr. Lee, the man with the yellow halo is Mr. Jones. I asked you about right here, one. That 9 seconds. That's what I asked you about in April, and that's what I ask you about right now. There's no mechanical asphyxiation in those 9 seconds, right?
The 9 second you asked me about during the April is different than this one.
No, it's not, Dr. Lee.
That's,
And, Your Honor, I can't move, if he's saying that, I cannot move forward without pulling it up and showing him the exact same clip. Can we toggle to the 9 second again? Yeah. Well, first of all, Dr. Lee, while she's pulling it up, the 9 seconds I asked you about in
Right.
April.
Right.
You had no problem with mechanical asphyxiation, right?
during that night, no, I mean,
And
for
you're
this
telling
particular person, yes, I
You're
agree.
telling this jury right now that the 9 seconds I just showed you and the 9 seconds I showed you in April are 2 different 9 seconds?
Right, that's what I remember.
Is there a way to zoom in on that clip?
Your Honor, this is the clip that Mr. Irvin was wanting to introduce. And all parties comfortable with us showing it now and marking it later?
All 22 minutes?
No, going specifically to this 9 second.
Judge, I think maybe if Dr. Lee just steps in front of the video, it's the best view possible.
That's fine.
The one from April.
Yeah, let's go back to his
Go
deposition.
back to the deposition.
May he walk
That's
over
fine.
here?
Dr. Lee, if you ask a question, talk loud because you're away from the microphone. But
All right, back it up again.
if you will watch
Now.
Dr. believe, watched the video in that video.
Focus, yeah, focus on the top left,
Yes.
okay? Can you see, all right, he's standing up, right?
Right.
All right, and there's a blue shirt behind, right, or a gray shirt, right? And there's a third guy, I'm just gonna try to let everybody see, there's a third guy with an insignia on his shoulder, right?
Right.
And you see Mr. Jones's leg kind of sticking out to the left.
Right.
Okay, let's play this.
You have a timeline.
Let's play it. Play from now. Here, watch this. Pause it. You see him drop his knee?
Yeah.
Right there, you would agree with me that Mr. Jones put his knee on the lower part of Mr. Freeman's back. To grab his arm, correct? Okay, play it. And as soon as he has his arm, he's off. Stop it. So that's from 5:21 to 5:30. You're not suggesting those 9 seconds and put the key in the back while he got control. So you're not suggesting that caused the damage. Just like that at all. Okay. And just to be clear, not maybe, that did not cause damage. I know this. Okay. Are you telling us that you think those two are different?
That's what I remember, yes.
Well, you just saw it. Now that you've just seen it and refreshed your memory,
Right.
is that not the same video I just showed everybody 5 minutes ago?
Show me again the new video, yes.
Okay, pull it back. Me too. All right, we'll just play from there. See his leg, see the insignia, see the gray shirt on the back. He drops down, knee. Arm in the cuff. And he's off. Do you have trouble recognizing that as the same clip?
Now I think I recognize that,
Okay.
yes.
And in April, you said no issues with mechanical asphyxiation. Is that still your opinion today?
From that clip, I will stand by, yes.
You'll stand by?
Yeah.
Okay. Let's keep talking about what Stevon Jones did. In April, do you remember when I demonstrated to you
Right,
that after he repositioned, he's got a knee on each side,
right.
right?
I remember that, yes.
Okay. Ms. Fuchs just showed you. You had no problem with that, did you?
Right.
At
No,
all?
no problem.
Okay. And he's waiting for leg irons. Did you say that when you formed your opinions in this case, and we're gonna get to this, but
Judge, brief objection here. He's waiting for leg irons. It's not something that's ever been introduced into evidence. And so I would just ask Mr. Irvin just to ask a question instead of testifying first and then.
I will withdraw that question.
All right, don't preface it with something not.
When you formed your opinions in this case, Mr. Funk came to see you 2 years after the indictment, right?
Well, I'll take your word for it.
August 4th, 2025.
That's one of the meetings, yes.
And he gave you the video,
Right,
and the autopsy report,
right.
his theory of the case.
The record, he shook his head no.
Okay.
Nobody
Okay,
tell me
nobody gave
what
you-
their theory. They just
Did
ask.
he give you any witness
I'm gonna
statements?
object and just allow him to finish answering that particular question.
Did he give you any witness statements?
No,
They-
the question was, did he give you the theory of the
His
case?
theory of the case.
And Your Honor correctly said he shook his head no, and I moved on.
He was
Well, then he said
continuing to
something
answer.
else.
I said, no, nobody asked me, they tell me what is the theory is. They just show me the video, the autopsy report and other related information as my opinion.
That's where I want to go. Other related information, what else did you get?
For example, you know, the autopsy report, toxicology report, and investigation, and that, you know, and what do you call the audio transcription, something.
We've already heard today that medical examiners routinely rely on hearsay in forming their opinions, yes?
Right,
And they routinely rely on the hearsay of investigators.
right,
They routinely rely on witness statements,
Right.
people who actually saw the event.
right,
correct?
right.
Did Mr. Funk give you any witness statements?
I don't remember so. I don't think so.
He gave you no witness statements?
Probably not.
Would that have been important to you if you're watching a grainy video and you can't tell if this man is struggling to breathe? Would it have been important to hear from witnesses like James Perry or Brandon Lawson or Lieutenant Carlos Cleves, all of whom are standing around in that video watching this man? Would that have been important to you?
Sometimes it might be important, sometimes I don't need it.
You're relying on a video.
Right,
You've admitted you don't know how much pressure was being applied.
right,
Could have been a lot, in fairness to you.
right.
Could have been hardly any at all, in fairness to these two men on trial for murder, right?
You know,
You don't know.
I would say it's sufficient, and what I want to say is this: it's not just to say you need this and that. Sometimes I need it, sometimes I don't need it, because when I view the videos and correlated with the autopsy report and other information, I have sufficient information to form my opinion as to the cause of death and manner of death.
I want to keep going with the video, but before I do, let's talk about that, because you said several times
Yes.
that you're correlating
Yes,
the video and the autopsy report.
right,
Let's be brutally honest about that.
Right.
Okay?
Okay.
There is nothing in the autopsy that supports a finding of asphyxia. True?
see, that's the thing. If I don't have the video,
Your Honor, if he could answer my question, then he could
is
explain.
answering the
No,
question, Judge.
I
Let's
said,
Let's
it's a
do
true or
this.
false question.
Wait, stop. Ask your question again, and then you can answer yes or no, or I don't know, and then you can explain your answer.
There is nothing in the autopsy report. There is nothing objective that supports a finding of mechanical asphyxiation, yes or no?
yes, but with the explanation. If I don't have the video, I will not be able to form my opinion, as I explained to you, the jury many times. If I don't have the video, I will not be able to, nobody will be able to say, this is the result of mechanical asphyxia. Because mechanical asphyxia sometimes do not leave any sign or marks to specifically say this is due to the mechanical asphyxia. As I said many times, explained to you, because I will not be able to without the video, without the footage.
So you've changed your opinion on that fact?
I don't.
Well, when we took your deposition in April,
Okay?
you admitted that there's no specific medical finding in the autopsy report that you're leaning on. And you said, right.
Because of that, the thing, if I don't have the video, I would not be able to form my opinion.
We aren't talking about the video.
Right,
We're talking about the autopsy report.
right,
I'm gonna ask it again, and I hate doing this.
Right.
Because it's late. There's nothing in the autopsy report that is an objective finding that supports mechanical asphyxiation. Please answer yes or no.
agree.
You do agree.
I can agree, I've already
Okay.
said to you.
Thank you, thank you, thank you. Let's talk about the video.
Right,
I asked you this in April.
right,
You reached mechanical asphyxia because you saw a knee on his back in the video, period, paragraph, right?
I said knee and arm or knees, you know, that's like a weight, yes.
Knee, arms, knees. Well, let's talk about the arms. Let's keep playing the video. And again, I'm interested in Steve Jones, the yellow halo, okay? So, let's pause it real quick. We've done the 9 seconds. No mechanical asphyxiation.
Right.
True?
Right.
Keep playing. All right, pause it. He's repositioned himself. Okay?
Right.
He was forced to place a knee for 9 seconds, which you have no problem with until he got control of his hands.
Right.
Now, he has repositioned himself. True?
Yeah.
And we kind of froze it in a weird frame. Play a little more. Okay, pause it there. And now he's straddling him with his knees on both sides, his femurs in line with his torso, and he's not putting weight on Gershun Freeman, is he?
I agree.
Okay, I'm glad you do. And there's no mechanical asphyxiation in there, is there?
Right.
Okay, let's keep going. Now pause it there. Back it up 10 seconds. All right. So we have the 9 seconds. What is that, 6:58? Okay, we have the 9 seconds. You said no mechanical asphyxiation, right?
Right.
And then he repositions, and now he doesn't even have his weight on, and he's just sitting there.
Right.
Okay? I want you to pause it at 7:03. Okay? He's still sitting there. Pause. 7:03. You told Miss Hunter earlier this afternoon at 7:03 that he's still moving, but he has begun the dying process. That's what you said this afternoon. What started the dying process? We hadn't seen any mechanical asphyxiation yet.
I don't remember, answer the question, but
You don't remember saying at
Right.
7 minutes and 3 seconds that he had started the dying process.
I don't remember.
Okay. If you said it, do you take it back now?
I mean, depends on the condition.
Well, this is a murder trial. We need to know, you're the medical examiner,
Yes.
right?
Yes.
We don't know the condition.
Right.
Is he in the dying process?
That probably I would not be able to say for sure.
Well, when you said it earlier, what were you thinking? What were you relying on?
Maybe it's not very clear that, just by looking at this.
So, thank you. It's not clear by just looking at this, is it?
For this moment, you're right.
Well, let's not talk about just this moment. It's 7:03. We're paused.
Right.
You told Amy Hunter that he had started the dying process. Tell these folks in the jury, every fact you relied on when you told Miss Hunter that he had started the dying process at 7:03.
That I couldn't honestly remember.
Well, we gotta remember, this is the time. It's 7:15 at night.
Right.
This is a murder trial.
Right.
You testified under oath today
Yes.
with these men's fate in your hand that he started the dying process. Why'd you say it?
So I would say this, you have to continuously replay this until this point.
What?
You start playing again from maybe 5, whatever, and then continuously. Then I might remember what we said during the testimony.
You want to go back and watch the
Yeah.
past 2 minutes?
Right.
In order to answer this
Yes,
question?
yes.
All right, back it up.
Before we do that, would y'all first amendment for a second?
I were sitting on somebody, I would be back putting my butt, the weight of my butt, however much that is, on their person, right?
Right.
Okay. Because when he's straddling, his knee is braced on the ground on one side of him,
Right.
and his knees braced on the ground on the other side of him.
Right. Right.
And he's upright. His femurs are in line with his torso, right?
Yes.
So all of his body weight is on his right knee and his left knee,
Do you
right?
object to calling for speculation?
Well, right now-
His review of the video is
Just
the
a
whole
second, wait,
problem.
wait. She objects to speculation, so you can ask him, if he can answer from his personal knowledge, not yes, I'll allow the question.
From your review of the video and from your personal knowledge, if you were on your knees, and your weight's on your knees, and this is a straight line, right? You're not down putting weight on you. You're standing like this.
That's still speculation, Judge.
Well, he's just saying if it were that way.
Yeah. Do you see it that way? Because you said before you did.
Yes.
Okay, you do see it that way?
Yes.
And so he's not putting any weight on Gershun Freeman?
I would not say no weight or weight on something. I don't. Yeah.
If he's putting weight on him, it's minimal.
Right.
And it is not causing mechanical asphyxiation.
Just by this alone, right?
And this alone is what we've had up to this point. We've had the 9-second until we got control of the arm,
Right.
reposition, and now he's doing this, right?
Right.
All right. And earlier today, you said he was starting the dying process. You have asked to go back 2 minutes to jog your memory.
Right.
Can you do that? That's fine. When he's coming up the escalator, is that good enough?
That's good enough. Yes.
Okay.
Can I say something during this period?
Well, let's pause it at 7:03 first. Oh, actually, pause it. Go ahead.
Before that, there's a
Okay.
little bit
Go
before
back
that.
20 seconds. Okay,
Even before that.
all right. How about there?
Okay.
All
Go,
right,
go
play.
ahead. Stop there. See, that's like a very chaotic
That-
and a lot of arms on the back.
A lot of arms on the back.
Yeah, you can see it.
So you're referring to the 2 men in that video, other than Stevan Jones, that are not on trial for murder?
I don't understand what you mean.
Okay, Stevan Jones is off him. He doesn't have an arm on the back. He's grabbed his arm to get it in cuffs. And you've just testified that there's,
Once again, I don't think Mr. Irvin could say he doesn't have his arm on. But I think, say, you can see on the video whether or not his arm's on.
You can ask the witness.
if
It's
you
gonna be
get
up to
the
the jury what happened on the video.
Okay. All right, so we watched, can we cut the lights real quick? You've testified, and my original question was, why did you tell Ms. Hunter that he had started the dying process? You went back 2 minutes to jog your memory.
Right.
Is a fair summary of your testimony that your memory has been jogged, and it's because there are a lot of hands on him?
Hands, arms on him. Yes.
Hands and arms?
Right.
Okay.
You-
And at least 4 of those hands belong to men who are not on trial for murder, yes?
again, I would not pinpoint who's doing what, because, that will be the jury's job to figure it out. And my job is not to say who's doing what or who did what.
Well, let's get to that. You are a medical examiner, but you also have a law degree, right?
Yes,
You understand that Stevon Jones, while he may be in a joint trial with another man, he is being tried individually, correct?
that I don't know.
Okay, you don't know. Do you know that the jury has to come to the conclusion that Stevon Jones, something he did, caused the death of Gershun Freeman, and without which Gershun Freeman would have lived?
Would y'all approach the bench for a second?
Where were we, Dr. Lee?
I don't know.
Let's keep going. You want to?
We can start wherever you want, Mr. Earl.
What, I'm interested in what Stevon Jones did and your opinions on his actions that caused this death, okay? Is
Okay.
that fair?
Okay,
And you understand why I have to ask those questions?
yes.
Okay. Let's keep playing.
Can you see that? I mean, if I have to point
Press pause.
before that,
Okay, go back 10 seconds.
even before that. Okay, go ahead. If I have to say something, here's the position,
Okay, time out. I don't know if you're confused.
right?
That's the same 9 seconds you've been talking about.
All right, so go ahead and keep going.
That's what you've already said was okay.
All right, so keep going.
Okay.
See here, is that what is it saying?
That's what we've just been over. That's him in the process of repositioning, right?
You can see that,
We're gonna press play and
He was talking, so let's let him answer.
go ahead.
right, if I have to point, I hated to point the fingers on whatever, but if I have to point, then you can see the head or the arms on that body, on the back.
I want to make sure I understand your testimony.
Yes.
Are you suggesting to this jury that grabbing a man's hands and putting them in handcuffs causes mechanical asphyxiation?
Not the
Is that
grab.
your testimony?
No, it's not the grabbing. It's like a head, arms on the back. To try to,
Arms on the back.
right.
You've already told us you were okay with this.
Several of them, several of them at the same time.
The two men that aren't charged with murder?
See, that's the thing. I don't want to pinpoint who's doing what.
Okay, let's keep playing. Now, as we watch this, keep the timestamp. I want you to start paying attention at 7 minutes and then at 7:08, okay?
Okay? What time is it right now?
Right now it's 6:38.
Okay?
All right, and keep watching. He's still straddling, no weight on him, correct?
Right.
Correct?
Yes.
Still straddling, no weight?
No significant weight, right.
Okay. Keep watching. No, don't pause it. Play it through. Right there. Okay.
Right.
Yeah. You commented on that earlier. Do you remember?
Right. I said he tried to move his head up and his body up to another position. I remember that.
You didn't get witness statements, did you, from Mr. Funk?
I don't believe so.
Okay. You have testified that that's 7:08. Fight for his life. He lifts his head or body,
Right.
and he is trying to breathe.
Right. Right.
Okay.
Right.
And that's a possibility.
That's
Right.
what I said. Yeah.
Is it also a possibility that Gershun Freeman has grabbed that man's testicles at that very moment, and Brandon Lawson's trying to pull him back, and Courtney Parham drops the knee at that point? Is that also possible?
That I would not be able to say it.
You couldn't tell from the video.
Right. I cannot.
And you'd need witness statements or something like that, wouldn't you?
Right.
Because all you had was this video.
Right.
Thank you. Let's keep playing. Pause it. All right. Right now, after his testicles are grabbed, I'll strike that. That's not in evidence yet. He has turned away, and now he's kind of positioned himself away from him, and he's just holding his legs, right?
I'll take your word for it, but I will not be able to
I
say.
need your opinion.
I will not be able to, what do you call it, take my opinion, or give my opinion on
So
that.
you don't have an opinion on
No, on that, no.
it? Keep playing.
Can I give an opinion on that?
Sure, pause it.
You can see the arm on the back, in that area, with this knee too.
Stevon Jones has his hand on his back,
Right.
holding him on the ground, awaiting let. Has his hand on his back, right?
Right.
And your testimony is that that right there is causing mechanical asphyxiation.
Again, I will say this. I will not pinpoint who's doing what to start with. My opinion is combination of all the weights. Maybe individually the hand is not significant. With the knee, arm, maybe significant. I don't know. So that's why I hated to pinpoint who's doing what. But if you have to ask me about it, I will give you my opinion. One knee plus something else may be sufficient, maybe, I don't know.
Okay, well, I do have to ask you about it.
Right.
Because I represent this man on trial for murder.
Yes,
So his hand, and tell me if I'm wrong, let's pretend this is Gershun Freeman. He's doing that, right?
right,
I don't want to put words in your mouth. He's doing this, right?
right.
Okay.
Judge, once again, that's speculation.
Well, he's asking him if he's doing it, and so if he sees it on the video, he can agree, otherwise he can say, I don't know.
But you do know.
Right.
Okay.
Here again, ladies and gentlemen, anything that lawyers say, remember, is not evidence, but the answers of witnesses are.
He's doing this.
Right.
That's not mechanical asphyxiation.
Sorry, I can't hear you.
That's not mechanical asphyxiation.
I will answer again. I don't think I will be more clear than that. A lot of times, I will not pinpoint who's doing what, whose hand, or who's on. But what I said was the weight, the pressure on the back, under the condition, face down. Maybe you don't think of this arm alone or hand alone is significant, but in addition to the knee, the hand, the arm, in combination. That's what I tried to say. I don't want to say, the hand alone is not significant. I would not be able to say it, or one way or the other. But what I can say is this: the knee is on the knee or knees on the back, plus the arm, the weight. That's important. I don't want to pinpoint, the hand alone is not important. I will not be able to say that. I hated to say that because I know it is important to individual, but I will not be able to say one way or the other, this individual did this, that individual did that, but combination.
Okay. So maybe we short circuit some of this because it's 7:30. You cannot say anything that Steve Jones did caused or contributed to his death, and without which death would not have occurred.
See, I will not say this. Again, the combination, the weight of the knee, the weight of the arm. If just by arm alone, maybe not, I don't know. But the combination.
You've told us that now twice.
Again, this is jury's job. It's not my job to say who's did what and who's did what.
I want you to listen to my question.
Yes.
Okay? And do your best to answer my question.
Okay.
You cannot say that anything Steve Jones did caused or contributed to this man's death, without which death would not have occurred. Meaning, if you take away something he did, Gershun Freeman lives. You can't say that, can you?
I have no opinion on that.
So you can't say it.
I have no opinion.
Answered the question.
You have no opinion on it.
Right.
This witness's job is to testify the cause of death, but not who's responsible. He's not gonna answer that question.
Let's assume for a second that your theory is true, mechanical asphyxiation.
Okay.
Okay?
All right.
I asked you that premature. Let's keep playing. We're gonna watch the next minute together.
Michelle, you want kind of like it?
Pause it real quick. Now he's way down at his knees, right? I mean, Gershun Freeman's feet are barely sticking out past his butt, right?
Yeah.
So, as far as where he is on that body, he's not even up anywhere close to the butt at this point. He's down by his knees, waiting on leg irons, correct?
Correct.
Okay. And you're not suggesting that's mechanical asphyxiation?
Again, I will not just, pinpoint it to who's doing what.
Let's keep playing. Leg irons, right? Right, Dr. Lee? There's leg irons being passed?
Okay.
And he gets the leg irons on and he walks away, correct?
Right.
Okay. And press pause. And I believe on the other video that we're going to introduce, that comes at 8:35. In April, do you remember the moment when he gets up and walks away being 8:35?
Okay.
Timestamp?
I will not be able to remember specific.
Okay. Could you pull up the 8:35 clip for me? I'm gonna get out of the way. Can we dim the lights? ma'am? Do you think at this moment, yeah, let's come out. Do you think at 8 minutes and 35 seconds, when Stephen Jones gets up, do you think he's already been mechanically asphyxiated? You don't know? Okay. You don't know if the mechanical asphyxiation came before, when Stevon Jones was on it, or came after, when Stevon Jones was off it, do you?
Right. What I can say is, I said probably that's the time he's already been mechanically asphyxiated.
Back it up. Let's play it again. No, not that one. Same clip. Yeah, at 8:35. Do you think at this moment, yeah, let's come out. Do you think at 8 minutes and 35 seconds, when Stevon Jones gets up, do you think he's already been mechanically asphyxiated? You don't know? You said something about probably.
Right.
Right there, I asked you
Right.
if he had been mechanically asphyxiated before Stevon Jones got up and walked away, or after Stevon Jones got up and walked away. Try to focus on my question.
Okay.
That's what I asked you, yes?
I said, probably.
You didn't say probably. What you said, I asked you, had it already happened, and you said, I don't know.
First of all, I said probably. Then you asked me. I said I don't know.
Do I need to play it again?
Did I say probably or no?
Show me probably. Play it again. Do you think at this moment, yeah, let's come out. Do you think at 8 minutes and 35 seconds, when Stevon Jones gets up, do you think he's already been mechanically asphyxiated? You don't know? You said you didn't know.
Okay.
If you're having trouble hearing that, would you like me to read it from the transcript?
That's okay. If you said no, I don't know. I don't know.
Okay. And I'm really interested in what you know or don't know today in front of this jury.
Right.
At 8:35, when Stevon Jones gets up and walks away,
Right.
You don't know if he's been mechanically asphyxiated at that point or not.
If we play that video again, not this video, the actual video,
Asking you about this clip.
that
When
kind
we
of,
watched it in April,
right,
right? We watched the whole thing in April.
right.
You were on that witness stand for 5 hours in April, right?
After,
A long
yeah,
time.
a long time, yeah.
All of Monday, April 13th, yes?
Like, you know, if
All
it's-
of Monday, April 20th.
right,
Ton of information.
right,
We watched this video ad nauseum,
right,
correct?
right,
You said, when I asked you, and I said, had mechanical asphyxiation occurred when Stevon Jones got up and walked away, your answer was, I don't know. And I asked you again, you don't know? And your response, I don't know. And look, it's okay to not know.
right,
There's a lot of question marks,
right, exactly.
It's fine to not know. But here's the point, Dr. Lee.
Right.
Yes.
You wanna watch more video?
The video, you know, just from that clip on.
Okay,
You don't have to go back.
okay. If you could,
8:35 or whatever.
well, it's a different timestamp on this. If you could cue it up to when he gets the leg iron and walks away. He's- He's long gone by then. All right. There we go.
The record when it was started, what number on this?
About 9 minutes.
Okay.
Now, Stevon Jones is gone, Dr. Lee.
Yes,
He doesn't touch Gershun Freeman again. Do you need to see more to answer my original question?
I said I still don't know. I will
Okay.
can stick with that.
Press
That
pause.
answer.
So you don't know if he was mechanically asphyxiated at the time Stevon Jones got up and walked?
Right,
True?
right,
There is a possibility in your mind that he could have been?
right.
there is a very reasonable possibility that he wasn't. And what came after caused the mechanical asphyxiation, right?
I don't know again.
You don't know.
Right.
So you don't even know if Stevon Jones was even around this man when he was mechanically asphyxiated, if that's what happened to him.
Again, I will not answer that specifically because I don't want to pinpoint who's doing what. That's not my job.
Dr. Lee, I want to be as respectful as possible,
Right.
but I get to ask the question. He just told me he wasn't gonna answer it. And my response to that, Your Honor, is.
Let's do this. Ask him a question, we'll let him answer.
This is
Michelle,
the-
let's turn the light back on.
This is the question I would want you to answer. You may not have considered it in the past, right? If you don't know if mechanical asphyxiation had occurred before or after Stevon Jones walked away, you can't say that anything Stevon Jones did caused mechanical asphyxiation. True?
You know, that's not true. Because as I said, the combination of the weight before this area,
Your Honor, move to strike is non-responsive.
No, he's responding to the question. I find that he is responding, so I'll let him finish his answer.
the combination of the acts with the knee, with the arm, I don't point who's doing what, that caused the mechanical asphyxia. I will not be able to say, before this, after this, I will not be able to say.
Well, hold on, let's not gloss over that. If you don't know if the mechanical asphyxiation happened before he got up and walked away, or after he got up away, walked away, then you can't say any combination of things before he walked away happened. Or you can't say any combination of things that occurred after was the cause of his death.
So again,
Lump it
Now,
all in
wait,
one.
stop. He was answering the question. You may answer.
again, my answer is consistent. I don't want to pinpoint who's doing what, who's guilty or not guilty. That's jury's job. You figure out who did what, in what minute, who's involved. My job is, I said, combination of the weight, whether it's the knee, whether it's the arm, on the position for extended period of time. That's the cause of death. Complications of mechanical asphyxia. I would not say who's responsible, whose part on what. It's not my job.
And that opinion comes from you watching that video,
Right.
nothing in the autopsy. Yes?
Again, autopsy is a way to tell me whether there's something or not something, because the autopsy showed that he had a severe heart disease. Without autopsy, I have no idea. On the other hand, if I don't have the ability or chance to review the video, I will not be able to say this is a mechanical asphyxia. The same thing. So you have to have both, and you have to have, the other information to reach the conclusion. It's not just say autopsy alone, without the video, or video alone. I don't know he had a heart disease.
Okay, let's move on. I'm gonna shift gears, it's getting late. You have said maybe 4 or 5 times, maybe more today, that your cause of death isn't different from Dr. Ross's, it's more specific.
Yes.
You remember that?
Yes.
Okay. Dr. Ross diagnosed exacerbation of cardiovascular disease from altercation and subdual, right?
Yes.
He testified in this jury today.
Yes.
His cause of death was a cardiac event. Okay? You were in here,
Yes.
okay? Either a myocardial infarction, a heart attack, or a fatal arrhythmia, correct?
If that's the cardiac event alone, without the due to part, we've talked about it many times. It will not be homicide. It will be natural death, because due to the other parts we're concentrated on. That's the reason the manner of death is homicide. And Dr. Ross, I respect his opinion. He's
No,
lumped
this
some
is
together.
not my question. I know I'm not supposed to interrupt
Approach
the
the bench,
witness.
please. Would y'all approach the bench?
Yes,
Mechanical asphyxiation is hypoxia, correct?
right.
Hypoxia is lack of oxygen to the brain.
To the entire system. Brain is specifically, more
But
specific,
your testimony today
right,
was that the mechanical asphyxiation, the respiratory compromise,
right,
caused hypoxia,
right.
which led to irreversible brain damage,
Yes,
and the irreversible brain damage essentially turned off the switch to the heart. That was your testimony today.
Respiration, circulation, and other vital functions.
That is not more specific. That is not a more specific finding than Dr. Ross. Dr. Ross's
Mr.
cause.
I'm sorry, you have to ask a question. You have to ask him a question and he has to answer it.
True or false? A hypoxic brain death is not more specific than a cardiac event, a cause of death originating from the heart.
What I would say is this. Dr. Ross's opinion is exacerbation of the heart problem due to, and my point is due to is more specific because of the mechanical asphyxia. The mechanical asphyxia, as I described it to the jury, the mechanism is this. The oxygen cannot reach to the blood and then go to all vital organs. Brain is specifically more vulnerable. Even, again, as I said, brain is only 2% of the body weight, but it consumes about 20% of the oxygen. So this is the most sensitive to the hypoxic event, to the lack of oxygen.
I'm going to move on from that. Okay?
Okay.
Last time. You have told us before one of the bases of your conclusions that this was mechanical asphyxiation was the timing. He was alive when he ran up to the 5th floor. He was finally subdued, and he died a few minutes after that.
Right.
Is that still your opinion?
Yes.
And the timeline still weighs heavily on your opinion?
Yes.
Okay. I'm gonna go with you exactly where we went in April. There are 2 or 3 Bibles of forensic pathology, correct?
Right.
And one of the Bibles of forensic pathology is DeMaio's Forensic Pathology.
Right.
Correct?
Right.
I mean, this is an authoritative text.
Right.
They
Well,
spelled it my own for it.
DeMaio is D-I-M-A-I-O apostrophe S.
Thank you, sir.
DeMaio. This is an authoritative text.
one of the textbooks, yes.
It's used in medical schools across the country.
That I don't know.
Okay. And I want to call your attention to chapter 19 of that book. I can pass the book up to you. Let's turn with me to chapter 19.
Can you tell me the page?
Sure, page 433.
Okay.
And the chapter is called Sudden Death During or Immediately After a Struggle.
Yes.
Okay?
Yes.
This is the authoritative text. Now I'd like for you to turn over to page 436.
Yes.
This says post-exercise peril.
Yes.
Do you see it?
I see it.
I want to read it to you. Deaths due to a struggle most often occur immediately after the individual is restrained and the struggling has ceased. This time frame corresponds to the time of post-exercise peril described by Dismail. It is when an individual is unusually susceptible to developing a fatal cardiac arrhythmia. Peak concentrations of these catecholamines, I'm going to ask you about that in a second. Peak concentration of these catecholamines did not occur during the struggle, however, but in the 3 minutes immediately following cessation of exercise. Following cessation of exercise, epinephrine and norepinephrine continue to rise, with norepinephrine levels more than tenfold above baseline levels and epinephrine threefold. Do you agree with that?
You know, the thing is this. In general, I agree with this statement, but this has nothing to do with or relevant to what we have. Because his general statement is this: exercise, stress, but never said anything about the mechanical asphyxia, the condition we have.
Hold on. Deaths due to struggle most often occur immediately after the individual is restrained. It's not relevant to our inquiry today?
Right. Restraint, you can have a lot of components. If you put the handcuffs on the back, is one thing. Put on the face down in a position, another thing. Put a weight on the face down individual, another thing. So I cannot tell you as a blanket statement, I agree with everything, because in general, it is right, but has very little to do with our case here.
Very little to do with it.
Right.
But one of the 2 or 3 Bibles of your profession
Again,
says, hold on,
Okay.
let me finish.
All right.
One of the Bibles says that deaths usually occur in the 3 minutes immediately following restraint. Yes?
that's what I try to explain to the jury. The situation in the textbook is a general statement, but we have a case here. It's different than the general situation because, as I told you, the situation, the scenario is face down, the weight and the time. It's nothing to do with the general statement by Dr. DiMaio. He's saying that during the struggle, during this, during that, have something. But in our case, it's just like compare orange to apple, because facts are different and the situations are different. You cannot use the general statement to cover everything because it is different.
Let me read you the last sentences of this chapter, okay?
Okay.
Sudden death. Thus, even in the absence of additional factors to be discussed next, sudden death can occur after the struggle. Next sentence. In individuals who have underlying natural disease processes, such as an enlarged heart or known rhythm disturbances, they're even more susceptible.
I agree.
It is much like someone with known ischemic heart disease who runs a marathon. The struggle puts an additional strain on the cardiovascular system that it is unable to compensate for, resulting in fatal ischemia or arrhythmia and death.
In general, I will agree with the statement. But the thing is this, we are different. We have a different situation with that, the general statement.
Every single fact in this case is consistent with that, is it not, Doctor?
No.
He has underlying disease, true?
Yes, true.
He had an enlarged heart, cardiomegaly, how do you say it?
Cardiomegaly.
Cardiomegaly. He had an enlarged heart, right?
Yes.
He had left ventricular hypertrophy, correct?
Yes.
He had severe atherosclerotic coronary artery disease, yes?
Agree.
He was in a violent struggle, correct?
Right.
It went on over 10 minutes, correct?
Correct.
He fought 10 to 15 people, correct?
I will take your word for it, yes.
He ran up an escalator, yes?
Yes.
He was finally restrained, yes?
Right.
And he died within minutes after the struggle stopped, yes?
That I don't know, whether it's like with a few minutes or during the struggle, I will not be able to answer the question. But for this mechanical asphyxia, but for the position, the weight, and the time, I will not be able to say that his death is like due to the statement he described here, because of the catecholamine, adrenaline, or norepinephrine, etc. I will agree with you in general, but nothing to do with our case here.
This has nothing to do with our case.
Right.
Okay, I'll take the vote back. I may be done, I'm gonna check with my co-counsel, okay?
Thank you.
Dr. Lee, thank you.
Thank you.
Nate, have you additional questions?
Just two.
Okay.
And may I see what you're referring to as the Bible? I want to make sure we have the right, we have the same. Dr. Lee, that last series of questions was asking you to suppose that you didn't see people restrict Mr. Freeman's chest and abdomen, correct?
Right. The general statement is different than the specific case at hand.
And that's why it's not the same.
Right.
Okay. I want to pass up what Mr. Urban refers to as the Bible on page 443.
You may approach the witness.
Can you read from Mr. Urban's Bible, starting here to the end?
if both the chest and abdomen are restricted for more than 4 minutes, comma, a person may die of asphyxia.
Thank you.
Asphyxia.
So briefly. Dr. Lee, mechanical asphyxia requires a sufficient amount of weight, right?
Yes,
If that sufficient amount of weight is not present, mechanical asphyxiation is not possible.
if it's not there, it's not.
That's all I have.
Sherman.
I'm surprised we went to page 444 or whatever it was. That's in the section dealing with positional and restraint asphyxia, correct?
You know, I'll take your word for it.
He's not holding the book, so
Okay, that's right.
he can't answer that.
No, I have the book.
You do have the book?
Yeah.
You weren't holding it.
No, yeah, I was not holding it because you didn't ask me.
Doesn't it say that studies have now shown that this theory is largely debunked?
Where is that? Which page are you talking about?
So she just read from page 443.
Yes,
Right?
yes.
And she read down here. Look at the second paragraph. Furthermore, Ross and Hazlett also showed that the weight of law enforcement officers on the back of the subject in prone restraint position for about 1 to 5 minutes did not create adverse physiological effects. It's in the paragraph above. Right?
Yes.
Okay. And when she's talking about asphyxiation
So
could
you say
occur.
she, you're talking about the author or the son?
The author, I'm sorry.
Okay, no, that's fine.
So the paragraph above is talking about law enforcement officers, and it says on the back, 1 to 5 minutes, prone restraint position did not create physiological effects, right?
Yes.
And then the language Ms. Hunter just quoted from is referring to, says this is seen in crowd rush incidents and is well documented on surveillance video. It's talking about when someone is crushed, where they both can't breathe up and down, but also can't breathe that way, right?
I don't know which you're talking about. Which line?
Well,
You're welcome to go approach the witness and point to it.
right here. What does this say? That is seen.
That's saying crowd crush incidents and is well documented on surveillance videos. Yes.
Okay, that's what we're talking about there, right?
Right.
No more questions.
State. State anything? The way this works, I have to have 3 passes in a row.
Can you go back to page 443? So that this, while you're going there, I'm gonna ask you this question. Those studies that are mentioned before we get to that, however, statement, are those the studies that you're saying are not, they're done in a lab, basically with healthy people, the things that Ms. Fuchs was asking you about?
Yes.
Okay, and please go back to 443.
You're welcome to come to the point now.
I think it would be just easiest if you just read, starting with applying, all the way to the end.
Applying this to prone restraint suggests that even with significant weight applied with both knees placed on the back of the subject any individual can breathe well with diaphragmatic or belly breathing. However,
Keep going.
However, if both the chest and the abdomen are restricted for more than 4 minutes, a person may die of asphyxia.
Keep going.
That is seen in crowd crush incidents and is well documented on surveillance videos.
Keep going.
These results are supported by prospective field research studies that examined the outcome of prone restraint with violent subjects.
Was Mr. Freeman in a prone restraint?
Yes.
Those are my questions.
You see?
I just want to. What you just read says that weight applied, even with both knees on the back of a subject to the chest, an individual can still breathe using diaphragmatic or belly breathing. Page 443.
You're welcome to come point at it.
Yes, I saw that.
That's what you just read, that someone who has weight placed on their chest can still breathe using diaphragmatic or belly breathing.
You would say, qualified statement, yes.
That's all I have.
Last thing, and I always want to just ask you about it for rule of completeness, because we've read 2/3 of a paragraph and we might as well have read the whole thing. Does that sound fair? The first sentences of that paragraph read, thus, several studies have invalidated the positional or restraint asphyxia hypothesis, as the prone position does not produce respiratory compromise. Additionally, it is known that weights of 375 to 400 pounds on the chest are survivable because of diaphragmatic breathing. Weight force beyond 573 pounds, plus or minus 57 pounds, would cause sufficient rib fractures for fatal flare chest. That's the whole paragraph.
Yes.
375 pounds, they're still breathing fine. That's what the book says, right?
But depends on, how long, the time frame. Time the component is very important.
Here it's 1 to 5 minutes.
1 to 5 minutes, it depends on the condition, and it depends on the population. I will not be able to give the specific statement, and especially to a healthy person.
Thank you, Dr. Lee.
Dave, anything else? Ms. Hughes? All right, ladies and gentlemen, I tell you what we're gonna do, and I'm sorry it's 8:15. We're gonna pay for your dinner tonight, okay? It's on us. Now, I apologize. We're gonna have witnesses, of course, here ready to go in the morning at 10 o'clock. If for some reason it takes too long to eat dinner and y'all need to sleep a little more in the morning, you just let the deputies know. Otherwise, I appreciate if you'd be here at 10, but I'm not gonna wear y'all out, okay? So they can call me and tell me you're gonna be here a little late if you can. We wanna take care of it. So in there, we're gonna stop. Don't discuss the case for yourselves, or you can complain about how late it is, but you can't discuss the case, okay? And we'll see you in the morning at 10 o'clock, or if y'all need to sleep another hour, that's fine. Thank y'all very much.